Excuse me briefly, everyone. Someone filled out a card but didn't put their name on it. If this looks like your handwriting, you want to come by and check, please fill the card out fully.
Good morning, everyone, and welcome to the House Committee on Health and Human Services and Elderly Affairs. As you know, we have a couple of very important bills today to be heard by the committee. But before we get to those, I'd like you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Before I begin the hearing on House Bill 377 FN, I'd like to go over how we're going to proceed today. We have a lot of people interested in testifying on this bill. As you might well imagine, it's an important issue regardless of what side you're on. In order to get through everyone in a reasonable fashion, we do have to limit testimony. The practice of this committee has been that the prime sponsor is given extra time because they were the one who developed the bill. They're going to explain that process. They're going to explain why they did it and the whole focus and background of that. Once we get past the prime sponsor, we will have to insist that testimony be limited to 3 minutes. It's the only way we're going to get through all of the folks who want to testify, and we want to give everybody an equal chance. If you're still speaking at 3 minutes, I'm going to ask you to start wrapping up. I will give you 15 seconds to start wrapping up. At the end of those 15 seconds, regardless of where you are in your testimony, I am going to thank you for that testimony and ask the committee if they have any questions. And again, I appreciate the importance of this issue. I appreciate everyone's feelings on this issue. But the only way we're going to get through this if we adhere to that. And again, I want to be equitable to everyone. And so with that, I will recognize Representative Lisa Mazer, prime sponsor of House Bill 377 FN, and ask her to please present the bill.
Thank you, Mr. Chair. And hello to members of my committee as well. Good morning. For the record, my name is Lisa Mazer. I represent Hillsborough District 44, the towns of Goffstown and Ware. Thank you for the opportunity to speak on this critical issue, and I know it's an emotional one. I stand before you to address the growing use of puberty blockers and hormone treatments in minors, practices that carry significant medical risks and long-term consequences. I'd like to begin with an undeniable truth. Children cannot fully comprehend the lifelong implications of altering their bodies with powerful medications. Yet we are witnessing a concerning trend where children, some as young as 3 years old, are being seen as patients in gender clinics. Children as young as 8 or 9 are being prescribed puberty blockers and cross-sex hormones, often after just a few hours of consultation. While I understand that gender dysphoria is real and painful, rushing minors into irreversible medical interventions is not the answer. These treatments, billed as reversible and harmless, come with serious risks. And these are not just abstract possibilities. They are already becoming tragic realities for young people across the country and across the world. Puberty blockers, drugs like Lupron, were originally developed to treat prostate cancer and endometriosis. When given to children, they halt the critical hormonal surges of puberty, preventing bone growth, brain development, and fertility from progressing naturally. The Journal of Clinical Endocrinology and Metabolism has reported that children who use puberty blockers suffer bone density loss, increasing their risk of osteoporosis. The FDA recently added a warning that these drugs may cause lasting damage to the brain, spine, and kidneys. Studies show that up to 98% of children placed on puberty blockers go on to take cross-sex hormones, a pathway that makes them lifelong medical patients. Scientists at the world-renowned Mayo Clinic carried out a study and found that puberty blockers lead to fertility problems, withering testicles, and even cancer among children who take them. In recent years, 7 countries across Europe, and that number is growing by the day, and many states across the USA, and that number is also growing by the day, have taken significant steps to totally restrict or halt the use of puberty blockers and cross-sex hormones for minors We are talking about children. Their decisions were driven by comprehensive reviews of the available evidence, which revealed profound concerns about the long-term impact of these medical interventions on young people. And what's most alarming, many children begin this process before they're even old enough to drive, vote, or make decisions about their own medical care. You will hear today that if these children don't go through these procedures, they are more likely to commit suicide. Page 195 of the CAS report showed that child sex procedures don't actually prevent suicide. ACLU attorney Chase Stranglio admitted in response before the Supreme Court that there's, quote, no evidence that these procedures actually reduce suicides. Now I'm going to speak from the heart. And I might get emotional, so I'm sorry, because I've spoken personally with these families who have been devastated by these treatments. Parents who believed they were making the right decision to support their children, only to find that those children later suffered greatly from the irreversible changes to their bodies. And I have done the research on this, guys. I have seen the photos and I can't unsee them. So that's why I'm here today. One mother who supported her daughter through medical transition now watches her grown child struggle with severe depression, infertility, and chronic health issues. Her words, quote, "We thought we were helping her, but instead we've taken her future away." Finland's leading expert on pediatric gender medicine and chief psychiatrist at its largest gender clinic says, quote, 4 out of 5 gender questioning children eventually accept their bodies if no medical interventions are carried out. They need time and compassionate care, not radical medical interventions. You will hear today from young adults who were rushed into life-altering decisions without fully understanding the consequences. Chloe Cole, a detransitioner, fears that these treatments will cut children's lives short and that the hysterectomies necessitated by testosterone will lead to early dementia. Whether or not these young women detransition, they will suffer, and their doctors will have no idea how to help them. We don't let minors get tattoos, go to tanning salons, buy cigarettes, or consume alcohol, because we know they lack the maturity to make those decisions and that they may cause later on. Why then would we let them make irreversible medical choices that will affect their health and happiness for the rest of their lives? We are in a very difficult societal situation because medical professionals have pursued a dangerous protocol without first establishing a scientific basis to support it. They have misled both young people and their responsible adults to believe that quickly accessing this care is the only option they have. I urge this committee to consider the scientific evidence and the growing bipartisan, this isn't no longer a party issue, an international consensus that children should just wait until they're 18. That's what we're saying today, wait until you're 18 on this issue. Minors deserve protection from experimental medical interventions that could cause lasting harm. Counseling, yes, absolutely. We must prioritize their long-term well-being over short-term solutions that may seem compassionate, but do carry significant risks. I'm asking you today, please stand with us in protecting vulnerable children. Let's give them time. Let's give them space. Let's give them hope for a future that isn't defined by irreversible medical mistakes. Thank you.
Thank you. Questions? Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. You quoted some numbers about the number of patients that have been harmed by this. Do you have a similar handle on a number of patients that would be harmed if they didn't have this medical treatment?
Well, you'll hear even in my testimony this afternoon that just last week, when we talk about harm, the worst harm is to yourself suicide. And just last week, the Journal of Sexual Medicine put out a study that in over 100,000 people that underwent medical interventions, at the end of this study, there was no change. It was actually, I'm sorry, there was more people that after going through these procedures were committing suicide. And that just came out last week. And that was a huge study. And more studies like this are coming out every day, that these interventions, whether hormonal or surgical, are not saving lives.
Follow up?
Yeah, that's not my question. My question centered around, you mentioned again in the answer you just gave about the harms.
Yep.
My question is, do you have any handle on the number of people that need this care and would be denied this care?
I do not have that.
Okay, thank you.
Nobody has that.
Representative Weber.
Thank you, Mr. Chairman. Thank you for taking my question. You told us anecdotally about people who regret having had treatment. Have you any actual statistical information about the regret rate for this procedure? And have you compared that regret rate with the procedure for other life-changing childhood treatments?
I don't have the answer to that. There's probably people coming behind me that may have that, but I don't have those numbers, no. Because we're talking not even, on the national level, but it's a global situation as well.
Other questions? Yes.
Thank you, Mr. Chairman. Thank you for taking the question. The bill, as part of the description, has a clause that defines, quote, normal puberty. It's been a while, but my recollection is that there's basically nothing normal about puberty. And so I'm curious, lacking a good definition of what that is, how do you expect that to be implemented and enforced? What is normal puberty here?
Yes. Yeah. And yes, we have medical providers that are sitting right behind me that will answer that question. I am not a medical professional, but there are different ages that people do go through normal puberty, and that is the stages of that I know that they'll be talking about. So thank you.
Yes, Representative Lucas.
Thank you, Mr. Chairman, and thanks for taking my question. I'm just wondering, have you done any research or listened to evidence regarding the regret rate for these medications when they're used for other conditions like precocious puberty, for example?
Yes. Yep, it's coming.
Thank you.
Yep.
Other questions? Seeing none. Thank you. Oh, I'm sorry, Representative Hartnett.
Thank you, Mr. Chair. Thank you, Representative Mazur. Appreciating your concern about this medication, these medications, I wondered if you had any moral disapproval for just the category of transgender people.
The moral
Disapproval.
I love everybody. So I don't, as an adult, we're talking about, that doesn't relate to this bill. I'm sorry. This is harmful procedures on minors. And I feel like that's just kind of moving into a debate that's not what this bill is about. But thank you for the question.
Other questions? Seeing none. Thank you. Also signed up to speak is Sam Hawkins from NAMI of New Hampshire. And again, you have up to 3 minutes.
Good morning, Chairman, members of the committee. My name is Sam Hawkins. I'm here today representing NAMI New Hampshire in opposition to House Bill 377. As an organization dedicated to improving the lives of all people impacted by mental illness and suicide, we believe that no one should be subject to policies or practices that can cause or worsen mental health symptoms. And as such, we oppose any legislation that seeks to prohibit or limit access to clinically appropriate care for transgender individuals. It is well understood, I believe, by the committee that too often trans people face stigma, discrimination, and challenges accessing necessary care, which all contributes to a higher likelihood of poor mental health outcomes. I have specific statistics to that in my written testimony, which I will distribute, but I do want to be clear and really hammer home the point that there is nothing inherent in one's life as a trans or non-binary person that contributes to poor mental health. Rather, it is due to these experiences with discrimination and an inability to receive necessary care and supports. Everyone's journey will look different, but access to care can be a crucial part of that, to promoting the physical and mental health of trans people of all ages. With studies we have seen showing that access to care can improve mental health outcomes, including hormone therapy and when initiated in adolescence. I just further want to say that all major medical associations have released statements supporting gender-affirming care. Our policies must focus on improving mental health outcomes for all, rather than impeding the medical decision-making of families and restricting access to necessary care. Trans people, like all people, deserve access to the care they want and need to be well. And I encourage you to please listen to the voices and stories of trans youth that may come before you today as you consider this bill. And I thank you for your time.
Thank you. Before I go to any possible questions, folks, could you not block the doorway? It's a fire hazard. Thank you very much. Are there any questions? Seeing no questions.
Thank
Okay,
you.
Thank you. Also signed up to speak is Representative Erica Leon from Derry.
Thank you, Mr. Chairman and members of the committee. For the record, my name is Erica Layod. I represent Rockingham 13, which is the town of Derry, and it's good to see some familiar faces here. This bill is very important because doctors don't always get it right. We can look back to when the American Medical Association was all right with the Tuskegee experiments, where Black men were allowed to continue living and infecting people with syphilis in order to see the natural course of the disease. That was a tragedy and a disaster that was endorsed by the medical establishment. So sometimes doctors don't get things right. We also remember thalidomide. Back before it was a life-saving cure for blood cancers, it was given to moms with nausea because that was the accepted medical practice at the time. However, it led to severe deformities of babies, and it had unintended, unexpected side effects. When those side effects became known, people looked at the data, looked at the evidence, and realized that they were causing unintentional harm and changed their practice. The reason we're here today is because there is growing medical data and evidence that shows that this is in fact harmful for children. And unfortunately, there's been an entrenched view within the medical establishment that this is the correct way forward, despite mounting evidence. In any other area of medicine, they would reconsider this. But quite frankly, look around. It's scary for a lot of people to talk about this because A, they feel that people will be told that they hate trans people when that's not true. And they are also afraid of the repercussions that will happen to them socially if they speak about this. But the fact is, if you give a young boy puberty blockers while he is still early on in puberty, you will sterilize him for life. He will not be able to develop so that he can have functioning testes, so that he can then bear children. His penis can wither away and shrink, not just staying the size of an 8 or 9-year-old boy, but actually getting smaller. And this is a huge, huge problem for those men who later in life and throughout their life know that they want to live as a woman. Because traditionally, men who want to live as women who have a procedure down below would use that tissue. If you're looking at these young boys, you are denying them the ability to have that reproductive tissue repurposed to be more functional. You are sentencing them to a life where they need to use colon tissue to create a vagina. if they proceed in their medicalization. Not only are you sterilizing them while they're still in the early stages of their mental development, you are closing the door for medical interventions that have helped transgender people over a lifetime. It's not compassionate
You
to
have
give
15
these.
seconds.
It's not compassionate to give these to kids. And I ask that we stand up and we say that it's time to end this experiment and protect kids. Thank you.
Thank you. Any questions? Oh, Representative Lamontagne.
Thank you, Mr. Chair.
Please be quiet. Please be quiet in the back.
And thank you for taking my questions. Do you have references that you can provide for this information?
Thank you. If others don't provide the information, I can send some of that along. I have a feeling that there'll be others, including medical professionals, to speak about this. But if afterwards you don't have your questions answered, please feel free to reach out to me, see me on campus, ask me, and I will make sure you get that data and that information.
Okay, thank you.
Other questions? Representative Weber.
Could you give us some kind of data about the amount of time that these treatments have been used, and in many cases successfully, versus how long it took to discover the issues with thalidomide and correct them?
Well, thank you. This is a developmental issue. The ebb and flow of hormones over a child's development is not just a one-time switch or a one-time valve. As you go through this process, there are different times when the hormones impact your body differently. This goes to development of your brain, it goes to development of your body, it goes to development of your bones. I am actually expecting a massive rash of huge problems with bone density. And we're not just going to see older women having hip fractures. We're going to see children treated with puberty blockers with hip fractures. And as somebody who broke my femur, I have to tell you, that's not fun, and I don't wish it on anybody. Because this is a longer process, it's not going to be the same thing as giving a mother thalidomide and then some number of months later seeing a child that is born that obviously has issues. We can look at the timeline, we can look at the process. However, would you consider it successful to sterilize a child? And if so, I'm just curious why there's pushback on adults that want to sterilize themselves if we're okay with sterilizing children.
Follow up?
The import of my question was not the amount of time developmentally for the individual child. The import of my question was, how long have these treatments been in use versus how long thalidomide was in use before the issues were discovered?
Well, thank you. There's a very, very different method of administration when you're giving something as a one-time or a limited basis versus an ongoing treatment. When you have an ongoing treatment, you need longer follow-up in order to look at the data. There is success using these in precocious puberty. And I do want to note that when we talk about normal puberty in this bill, precocious puberty is not defined as normal puberty. The intention, and what I believe is very clear language, is that precocious puberty is not impacted by this bill because it is not normal puberty. Those children need to be taken off of it because there are serious adverse events if they stay on puberty blockers too long. You have issues with height. You have other developmental issues. If you have these children who begin puberty at 4, 5, 6 years old and they stay on puberty blockers too long. We should learn from that experience instead of somehow pretending that this group of people doesn't deserve the same quality of evidence in order to protect their health and their bodies, because they do. Transgender people, people with gender confusion, are wonderful people that need to be supported, and you need to make sure that people aren't blinding themselves with kindness to the scientific data. We need to make sure we're not allowing harms to be perpetuated.
Follow up?
Could you explain your use of the word gender confusion?
You can define it however you want. Somebody who is born as a girl or born as a boy and they don't feel comfortable in that gender. If they don't feel comfortable as a girl, don't feel comfortable as a boy. I don't want to define somebody's personal experience, and I don't want to medicalize it either until they are old enough to know the consequences. Everybody has their own interpretation of their life, and I use that term to talk about those who aren't born pop out, see pink and hair curlers, and act like a stereotypical girl. I know that's not me. That's not most girls. But I also know everybody has a process, and not everybody always sees themselves one way or the other.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. You pointed out some of the difficulties in terms of providing this care. Sorry. You pointed out the difficulties that some may have later in life if they start at this age. Medicine, as I'm sure you're well aware, is not all one way. Can you also identify the harm that would be done by not instituting it at an earlier age, and the difficulties that would be encountered if it's delayed?
Well, thank you. If there were not documented evidence of harm from this medical intervention, that would be a more meaningful question. However, there is clear evidence of physical harm to children. Generally, when we look at layers of harm, we're usually trying to look at somebody's bodily integrity and their function, because in order to function well throughout life, you want to maintain as much physical health as possible. I think that it's a strange place to be, where instead of looking at the data of actual harms, there are theoretical ideas of what would happen on the other side. I could see a controlled trial. It would be one thing if we had a controlled trial where people could enroll in this and children could enroll in it. I don't think it would be ethical, but at least we could have those data. But nobody would do that, because those who believe that this is causing harm would see it unethical as randomizing children to puberty blockers. And those who believe that it's harm to deny that would believe that it is causing harm in order to withhold those. So we'll never see a study of that. There have been some looks at some of the natural studies and samplings, but we know that level of evidence is poor.
A follow-up.
But that's not my question. You said we don't want to cause harm, and I agree, we don't want to do that. But if the study is not done to see how much benefit is derived and a similar study provided, then we only have data on one side. And what we need is, is there 10 people being harmed for one being helped, or is it just the reverse? There are people that are being harmed, but we have 10 people that are being helped. And so that was my question, which that you just said there's harm being done, let's not do it. But my question is, do you know how many are being helped?
Well, thank you for the question. As a surgeon, I understand why you're looking at this way, because when you look at clinical trials and you look at data and registries for surgery, that is something that you look at, because you look at the risk of treatment and risk of non-treatment, and the way that surgeries don't have to be approved by the FDA. So you're looking and trying to get the data and the best that you can do. Even most of the implantables don't need the same rigorous approval that drugs need. When you're looking at drugs, the first thing you look at is harm from that drug. That is the first process in approving a drug. Is this safe? You can't even look at whether it's effective if it's not safe. And we know that this is harming children.
Other questions? Seeing none, thank you.
Thank you.
Also signed up to speak is Kaylee Brown. Again, you have 3 minutes.
Good morning. My name is Callie Brown, and I'm here today to represent all transgender youth and oppose Bill 377. I am a transgender girl, and I am 20. I transitioned when I was 10 years old. I was placed on puberty blockers at the age of 12 to prevent male puberty, and I started taking estrogen at the age of 14. Me receiving hormone blockers in therapy was not even a question. I needed this to live my life authentically. I needed these things in order to feel complete and to feel like myself. As far as I've been told, the puberty blockers are known to be 100% reversible. Why are we going to punish the transgender youth below me to suffer and live their life in the wrong body, unhappy? According to the Trevor Project in 2022, 39% of transgender youth in New Hampshire have seriously considered suicide. 10% have actually attempted suicide. By following through with this bill, you are going to make these numbers rise drastically. Lack of hormone therapy and puberty blockers will cause feelings of displacement and uncomfort, which could then lead to the thoughts of suicide. The gender-affirming care is not hurting us in any way, shape, or form. It's just simply growing us into the person we truly are inside. To me, that's all that matters. If we wait till we're 18, the damage is already done. In my situation, my voice would be deep and I'd have a more masculine body shape. Thank you for giving me the opportunity to speak on behalf of transgender youth.
Thank you. Any questions? Seeing none. Thank you. Yes. Sure. Okay, also signed up to speak is Representative Catherine Prudhomme O'Brien. Again, Representative, you have you asked for 5 minutes, but 3
Okay,
minutes, please.
got it. Thank you for this opportunity to speak. I think there's a lot of lack of knowledge on this issue. Through word of mouth, it seems that I am a sympathetic figure to people who have detransitioned, and I've gotten some calls. I recently spoke to a woman originally from the western part of the state, and she now lives in a city because she can't drive, and she detransitioned, and she thinks that it was pushed on her, the transitioning to male, because it would be a quick fix for her other mental health issues, and she's angry and wants more medical help with detransitioning and finds that to be difficult to find. That the doctors that helped her transition now will not talk to her and help her with that. I think that that this is a sort of body dysmorphia that would not be dissimilar to someone who went to their doctor and said, I need diet pills, but that person was anorexic. I think it would be immoral for the doctor to give them diet pills. And what if someone came to their doctor and said, I'm not the correct race that I should be, and I need some kind of medical intervention to be a different race? No, we would stop and help them to accept themselves as they are. Telling children that they were born the wrong body is not in the wrong body is not helpful. I don't think it gives the right message. We ask them to accept themselves in other circumstances, but why is this an exception? And it should not be. I speak about all of this with some other insight. My late sister-in-law was my very best friend. She helped me raise my children. She was much older than me, and she recently passed away from gastrointestinal cancer. Not a smoker, ran in the family. She's a lesbian. She's called herself a radical separatist lesbian, and we both were tomboys. I was in a male-dominated field and usually the only woman in a machine shop where I worked, or musical instrument making. Martha used to tell me all the time that she was glad that she did not live nowadays because that she would have been pushed to become male, and she says she would have fallen for it and gone through all of that. One of the last things that I was able to buy for her when she was very ill was a T-shirt. She found out about this T-shirt you could get from an organization called Gays Against Groomers. And she was so happy about this T-shirt that said, "Leave the kids alone." She wanted me to buy it for her, and I did. She got so sick she couldn't raise her arms anymore and she couldn't wear it.
You have 15 seconds.
Okay. Well, I'm here to send that message as well. That is, she went through puberty. It was very awkward. It is very awkward. It's medical definitions of what is a normal puberty are included in this bill. Puberty is not normal, or it's awkward for everyone. And I'll
Thank
take
you.
questions.
Thank you. Any questions? Representative Weber.
You stated that we should help children accept themselves as they are.
Yes.
How does this help the child who starts unaccountably for a parent at age 3, telling that parent that they are not in their right body? How
I would go back to the examples I gave. If you had a child who told you that they were fat, yet you knew that you had medical help with determining that your child was not overweight, and your child kept telling you they were fat, would you give them diet pills if they were underweight? Would you change their race somehow using face creams or pills or things like that? You wouldn't do that. No parent would do that. We would say, you are just fine the way you were born. You are just fine the race that you were born. You are just fine the body weight that you are. We wouldn't do things like that. That would be cruel. And to make a decision for a child when they are way too young to make that decision, they don't have the intellectual capability to make that decision. We don't make decisions for them that would affect their fertility and their sexual function. We don't make decisions that at the age of 3, 4, 5, 6, 7, 8, 9, 10, that they'll never have an orgasm, that they'll never have children. We don't make those decisions. That's cruel. That's inhumane.
Other questions? Seeing none. Thank you. Also signed up to speak is Courtney Reed from ACLU, New Hampshire. Again, you have 3 minutes.
Hi, good morning, members of the committee. Thank you so much for taking the time to hear my testimony. For the record, my name is Courtney Reed. I serve as policy advocate with the ACLU of New Hampshire, and I'm here to oppose House Bill 377. I will try to keep my remarks brief as we have a lot of speakers to get through today. So to get to the bottom line, HB 377 would directly harm transgender youth by barring access to critical medical care in a discriminatory fashion, the consequences of which would be devastating. There are youth in this state right now that are currently benefiting from this care, and this legislation would disrupt thoughtful decisions that families and physicians have made together to support these adolescents. HB 377 would deprive transgender youth and their families of the ability to make critical medical decisions or even to receive a referral to seek this care outside of the state. All of which is antithetical to our country's and our state's values of bodily autonomy and the right to make private medical decisions. And so this bill seeks to ban access to medical care. However, this medical care is well established. It follows standards that are set forth by major medical organizations, including WPATH, the World Professional Association for Transgender Health, the American Academy of Pediatrics, and the Endocrine Society. Gender-affirming care has been supported by decades of research and is endorsed by every major medical association. So the reality is that denying this care altogether is far more harmful than the possibility of regret, which remains exceedingly rare. The government should not be dictating personal medical decisions, yet this bill does just that by imposing a categorical ban on access to this care exclusively for transgender youth, while permitting those same treatments for their cisgender peers. And so we've seen similar laws blocked by the courts when they're challenged. And with ongoing federal discussions in court cases, such as U.S. v. Scrimeti at the Supreme Court, this bill feels unnecessary at this time. And so if safety and regret are really at the forefront of concern for this body, it would make more sense for the sponsors of this bill to advocate for research, clearer guidelines, rather than enacting harmful restrictions that disregard where the research is at and dictating how individuals should be living their lives. With that in mind, I urge you to oppose HB 377 and protect the rights and well-being of transgender youth and their families. With that, I'm happy to take any questions.
Thank you. Any questions? Yes, Representative DeLemos.
Thank you, Mr. Chair, and thank you for taking my question. The New Hampshire medical experts have assured us that gender-affirming care is safe and evidence-based, but many European health agencies have concluded that these are experimental treatments. For example, after a systematic review, the Council for Choices for Health in Finland determined that in light of available evidence, gender reassignment for minors is an experimental practice And England's CAS review concluded that there is not a reliable evidence base upon which to make clinical decisions or for children and their families to make informed choices. Why have you reached such different conclusions? How did you come to those conclusions?
Thank you for your question, Representative. Of course, the debate around the guidelines and standards of care in Europe and in the United States is something that's constantly evolving. And I think the ultimate solution to that is not to completely prohibit care, which has, again, been supported by every major medical association, but to instead follow and establish this experimental research and to have further studies to better understand this care. I would like to see, and I think other advocates would like to see, evidence that suggests it is better to prohibit this care for individuals experiencing gender dysphoria rather than to establish more research to make sure that the standards of care are grounded in clear and compelling evidence.
Representative Weber.
Thank you, and thank you for taking my question. We've heard about treatment and gender-affirming care for children who are very, very young, with the implication that very, very young children are receiving the kinds of drugs that we are talking about here. Isn't it true that the treatment for a younger child, and perhaps well into puberty, may be as simple as allowing that child to wear the clothing that they choose, use the name that they choose, and possibly even the pronouns that they choose, without any kind of medical intervention whatsoever?
Thank you for your question, Representative. Certainly, what you're describing, social affirmation, is an important component of care. I can't speak to the specific ages and guidelines within WPATH, but I do want to express that all of those standards are evidence-backed. Thank you.
Representative Woods, and then Representative Kesselring.
Excuse me. Thank you, Mr. Chair, and thank you for taking my question. Under prohibitions for healthcare in the proposed line 17, page 1, it says, no person shall engage in counseling, make a referral, so on and so forth. How, from ACLU's perspective, does counseling then preclude someone who has questions about their dysphoria? Does this preclude them from, does that preclude them from even discussing?
Representative Woods, can you move your mic still a little closer, please?
Does that does this preclude them from even discussing with one of their patients the question of their dysphoria?
Thank you for your question, Representative. I certainly see concerns about this bill being overly broad, as the definitions include person to be any individual, not just a healthcare provider or a clinician. I think the line that you cite in the bill also raises significant First Amendment concerns, as it prohibits referrals for seeking state out of care where it might be legal.
Other questions? Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So is it the stance of the ACLU that the use of puberty blockers in children are safe and effective?
Thank you for your question, Representative. The ACLU ultimately has a position that it is not the place of the legislature to interfere with the physician-patient relationship, and that doing so in the way that this bill does is discriminatory based on sex.
Follow up.
Thank you. So the ACLU takes no stance on the efficacy or safe and effectiveness of puberty blockers in children.
Thank you for your question, Representative. I want to get back to you and cite the exact arguments that come from US v. Scrimeti, which the ACLU argued, but the ACLU ultimately supports the allowance of these critical medications when medically necessary or deemed medically necessary by physicians to treat gender dysphoria.
Follow up.
Could you define medically necessary for me?
Thank you for your question, Representative. I think that probably a healthcare provider would give a better answer than me coming from the policy advocacy space. But when medically necessary, this means deemed as needed to treat gender dysphoria or to have significant health benefits for the mental health and well-being of a transgender adolescent.
Representative Weber.
Does the ACLU have a policy on the rights of parents to make medically appropriate decisions for their children?
Thank you, Representative Weber. Certainly, this bill is concerning in how it would interfere with a patient-physician relationship, understanding that parents are a critical component of making these important decisions. And I'm sure you will hear from other speakers today about the role of parents in dictating these healthcare decisions.
Other questions? Seeing none. Thank you.
Thank you so much.
Also signed up to speak is Representative Sarah DeVito from Buckingham County District 8.
Thank you, Chair, Vice Chair, and honorable members of the committee. My name is Sarah DeVito. I represent Rockingham District 8. Thank you for allowing me to speak today. I'm testifying today to express my strong support of H. Bill 377. This is necessary in ensuring that young adults or young individuals are protected from making life-altering medical decisions before they reach full maturity. Medical interventions such as puberty blockers and cross-sex hormones have significant and often irreversible effects on a child's development, including impacts on fertility, bone density, and long-term mental health. While proponents argue that these treatments alleviate distress, growing evidence suggests that many minors later regret undergoing such interventions. Given the fact that adolescent brain development continues until the mid-20s, it is essential that we err on the side of caution when it comes to medical decisions that can have lifelong consequences. This bill does not prevent anyone from accessing these treatments once they reach adulthood and can make fully informed decisions. Rather, it ensures that minors are not subjected to medical procedures that they may later regret before they are old enough to fully comprehend the long-term effects. It also protects medical professionals from pressure to administer treatments that may not be in the best long-term interest of their young patients. Additionally, this bill aligns with existing principles in medical ethics that prioritize do no harm. Many European countries, including Sweden, Finland, and the United Kingdom, have moved to significantly restrict medical transitions for minors due to concerns about long-term harm and the lack of conclusive evidence supporting their safety and effectiveness. New Hampshire should follow their lead by implementing reasonable safeguards to protect our vulnerable children. For these reasons, I strongly urge the committee to support 377 and move it forward in the legislative process. Thank you for your time and for your commitment to protecting the well-being of our New Hampshire's youth.
Thank you. Any questions? Representative Weber.
Do you have any hard numbers about the regret rate from youth who have received these treatments as opposed to youth who have received treatment for other life-altering conditions?
Not in front of me, and thank you for the question, Representative Weber. Not in front of me. I do have those numbers, and I can email them over to you if you would like. I will say that the numbers obviously are not hard because a lot of the children, we don't have conclusive numbers. A lot of the children don't express it.
Other questions? Follow-up?
Is it possible that they're not expressing regret because they don't regret having had the treatment?
I couldn't speak for them. I know that I have spoken with several families that their children do regret it, and they're embarrassed, and they would never come forward publicly.
Representative Tellez.
Quick question. Thank you, Mr. Chairman. Thank you for taking my question. How many families have you spoken to who are thrilled with their decision or happy with the outcomes of their medical procedure?
Unfortunately, I've not spoken to one family that is happy with providing that. I will say that obviously I've only spoken to families within my district, so that could be different, but personally, I've not spoken to any. Thank you for the question.
Other questions? Yes, Representative.
Thank you, Mr. Chairman. And thank you for taking my question. Several folks have now testified that we know that this is providing harm, while also acknowledging that there hasn't been a proper blind study or properly structured study to confirm that. So how are you generating the idea that we know that this is bad without the data to support it?
I'm personally speaking to families that their children have gone through it. These are families living this nightmare, and they thought they were providing the best medical care for their child at the time, and now years later they're realizing that it was an awful mistake and it can't be reversed. Thank you for the question.
Other questions? Seeing none, thank you.
Thank you.
Also signed up to speak is Rosie Emrich from Hooksett.
Dear honorable members of the committee, I am here today in Concord for the third week. This is the third week I've had to show up here and sit in front of people just like you and listen to them say horrible things. There are people behind me snickering and laughing and talking. This is painful. I am tired. I am scared. And I don't want to do this anymore. I spent a lot of time this weekend thinking about my testimony, and I'm not entirely confident that what I say is going to land on some of your ears. But my child's journey is theirs and theirs alone, and contrary to the testimony that I read online and some of the things that I've heard today, I did not force my child into this. Why would I? Why would I subject my child to this? They didn't choose this. I didn't choose this. Nobody else compelled or influenced them into this. What I did was listen and pay attention. I listened to what they started telling me from the time they first started speaking sentences, and I continue to listen every day. And if they said, "Mom, I was wrong, I want to go back," I would be the first one to affirm that too. I love my children with everything in me. And it is me and my child, in collaboration with their trained medical providers with years of professional experience, who should be making these medical decisions. So I am here today, even though it feels like it's not accomplishing anything. And I don't think some of you will hear it. I'm here today because I'm doing everything in my power to build my child a world where they know I will always fight for them. Even if I'm bailing out the entire ocean from a sinking ship with a teaspoon, I will always listen and love them when they tell me who they are, and I will fight for them. Despite all of this hardship right now, my trans child has given our family a wonderful gift. We are all more comfortable in our skins, more confident in the ways in which we don't meet the impossible standards of femininity or masculinity. We're more understanding and compassionate. We're more willing to seek to understand. We are fiercer and more likely to stand with those being marginalized. And mostly, we have more love because we have created an amazing community and family for ourselves. Thank you.
Thank you. Did you want to take any questions or
If people have questions, I can take them.
any questions? Representative Weber?
I just wondered if you would be willing to tell us how old your child is.
Yeah, sure. My child is 8 years old.
Thank you.
Yeah, thank you.
Other questions? Yeah, I'm seeing none. Thank you.
Thank you.
Also signed up to speak are Jenny and Luke Beauvais. Is it Bovair?
Bovair, yes.
Can you spell that for me, please?
It's BOIS as in Sam, V as in Victor, ERT. My name is Jennifer, and this is Luke. I'm going to go first, and we are here to oppose this bill. So my name is Jennifer. I'm from Nashua, New Hampshire. I'm a mother of 3 children. My youngest is a trans male. I've always been supportive of my children, no matter what they have needed from me. I have created an environment in my home where my children can be open and honest with who they are. When my son was 9, he told me that he was actually a boy. He had been born female. He socially transitioned to a male. He always hated school, but he began to engage and find friends. With his haircut and wardrobe change, he finally seemed comfortable in his own skin. Gender affirming care at that time was counseling, it was support, it was using his correct pronouns, and it was allowing him to be who he was. As a mother, I did have to grieve the loss of my daughter, but I also celebrated that I gained a son. Over the next 4 years, I watched my son's journey of discovery. He is very confident and aware of who he is. He actually asked me to take him here today. He has a unique situation because he has Turner syndrome and his body does not produce sex hormones. We did not have to pursue puberty blockers because he didn't need them. But we are in a unique situation where we don't have the time to wait until he's 18 to start sex hormones. He's not going through puberty without them. He's had months, years of counseling. He's well-rounded. He's a happy kid. This bill seeks to destroy my family values, my role as a mother to support my child, and it inappropriately inserts the government into my child's health care. His body, his medications, his sense of self are not things to be regulated or banned. I know with 100% certainty that he is a boy, and that having secondary male characteristics are the right choice for him. I didn't choose it. It's not been an easy path. Like the other mom said, we listen to our kids. He knows, he tells me, just as my other kids have chose to go down paths that they've wanted to go down, and I've supported them. I know that he's done his research. I know we don't enter into situations lightly. We have an endocrinologist. We have a trained medical team from Mass General. People come from all over the country to go to Mass General. I trust the team that we have. I never thought I'd have to sit here in front of the government in New Hampshire to remind you that my child's healthcare is my child's healthcare, and nobody in the government has any right to legislate that. I've been sitting back here listening to hateful people who are snickering at people's testimony, who are rude and disrespectful. My son is an amazing person who's here today to stand up for our family and what we believe in.
You
And there's
have 15 seconds.
thank you. And there's people that don't even have the decency to even open their ears to listen. So I please hope that you can listen to my son.
Hello, my name is Luke Bovair, and I am a trans boy from Nashua, New Hampshire, and I oppose this bill. I am 13 years old right now, but I might not look it to some because I have a medical condition called Turner syndrome. Turner syndrome is a condition where some of the DNA of my X chromosome is missing. This means my body physically cannot go through puberty on its own. Because of this, I need to take one of the hormones so I can go through puberty. I would prefer to take testosterone, of course, because it fits what I want to look like, sound like, feel like, and who I am, a boy. I've been out since 2021, but have felt this way for way longer. Growing up, I've never liked girly things. I've always dressed masculine and done what's considered masculine things. I always related to masculine characters and would dress up like them. I dressed up as a handyman all the time, and I always wore so-called boy clothes. My sister would even say I was an old man trapped in a little girl's body. Obviously, these things don't make me trans, but looking back, I was just a little boy who didn't know how to say he was a boy. I, however, could technically take estrogen, but it would be very uncomfortable for me too. But if I don't take any hormones, it will lead to serious problems. This ban cannot be put in place Because if it does, I will be stuck in a prepubescent body for the rest of my life. Or, if an exception is made so I can take estrogen, I will be in a body that's not mine and someone who I've never been and never will be. Thank you for your time, and I will be happy to answer any questions.
Thank you, Mr. Chair. Thank you for taking my question. I was just curious if you would ever want the decision to change your mind. Because obviously, I have an 11-year-old daughter. She changes her mind all the time. So I'm only curious about that because I've heard different testimony back and forth about that it is possible to detransition. It is not possible. So I'm just curious for you, would you like to have that choice in your future to be able to go back and forth with that?
I mean, it'd be nice if I did want to change my mind, but I know that this is something that I'm set in stone. I've felt this way for like 5 years. My mind is not changing.
Okay, thank you.
Other questions? Representative Weber.
Is it of concern to you as a mom that if we pass this bill putting restrictions on kids who do not have pre-existing medical conditions, that just as we have seen with other medical procedures that have been banned, it may make it more difficult for you as a mom to seek the appropriate care that you and your son know that he needs?
Absolutely. That's of utmost concern. Actually, we have been meeting with our endocrinologist for months now. This is not an easy decision. We've been planning his testosterone, but the political climate is something that we've had to talk about in our doctor's appointments. And that's horrifying to me. These are things we've been talking about for years, planning for when testosterone was appropriate. And with his condition, 14 years old is when it's appropriate. That is what the Turner syndrome guidelines are. And the political climate and people trying to legislate this is getting in the way of his best care and treatment. And I do have to say, even if he didn't have Turner syndrome, I would want this decision to be made privately with his therapist, his doctor, and our family.
Follow-up.
This is an intrusive question, so please don't answer it if you don't want to. How long have you been discussing with doctors, counselors, and others this course of treatment?
Sure.
When did you start?
Thank you for your question. So I actually found out that Luke had Turner syndrome when I was pregnant. So I've always known that he would have infertility, that he would have these concerns that he might not have ovarian function. So gender has always been something that was kind of in the background of my mind. And so when he came out to me at 9 years old, we started talking to his doctor right then and there. So he'll be 14 this summer. So we've been talking about it with his doctor since he was 9. We've been on we take a growth hormone, but that's for his Turners, but we have taken no gender affirming care. Right now, it's all been support. And I have to say, the Nashville schools have been completely supportive, have always called him his pronouns, his name, everything, even before we legally changed it.
Representative Kesselring.
Thank you, Mr. Chair. Just have a follow-up question. So the condition that your son has, it seems to me like there's a difference in hormone changes and different things that happen anyways. Is there anything that you would tell us on that? Because I'm not educated on that condition. So just curious more on that.
So with Turner syndrome, on his X chromosome, he's missing some information, and there's a wide variety of the way that can present for kids. He is very fortunate. There are heart conditions, kidney conditions, multiple conditions he doesn't have. He has a very mild form of it. For us, we think it was a blessing because he didn't have to go on puberty blockers because his body naturally provided those puberty blocking. So it actually gave us the time and space to be able to work out what he needed for his hormones.
Other questions? Seeing none. Thank you.
Thank you so much.
Also signed up to speak is Eric Cole Johnson. Good morning.
Good morning. Hello, representatives, and thank you for the chance to speak with you today.
And you have 3 minutes.
I've taught in New Hampshire for 30 years. I've met many teens, and I'm here to represent them in their freedom to get the health care that they need. Adolescence is a time of growth and development. Some students, it's a relatively smooth journey, but others struggle with maybe a learning disability, going through a family crisis, or even loss of a parent. Whatever circumstances a student has, though, we as educators are committed to helping these young people find a path to success. Sometimes that comes through support from their peers, teachers, parents. Other times, consultation with experts like child psychiatrists or counselors or doctors. Let's take one student, Johnny. He's in the class. He struggles to stay focused, blurts out remarks, loses homework, can't complete tests. Finally, he's referred to testing. Oh, he's got ADHD. So this decision, whether maybe we could help him through medication or not, that should be made by him, his parents, his doctor, not by lawmakers. It's not the role of the state to interfere in these private decisions. And of course, it's very different ADHD, but still, like for every medical condition, when you take medications, there are possible side effects, right? Like with ADHD, your height can be, stunted a little bit. You have increased risk of having a heart attack, cardiovascular health. As lawmakers, you all have generously given of your time to make sure New Hampshire and its citizens are the best they can be. I really believe you all care for us in New Hampshire and want to help New Hampshire's citizens flourish. It's important that we look to experts in situations that may be unfamiliar to us, such as the current state of transgender youth here, who hope to be able to consult with doctors and get the medical care they need. Maybe we feel fine in our bodies, and we've always known, we've always had this sense, I'm a man, I'm a woman, or whatever your case may be, and we have trouble imagining what a transgender person feels like. But the fact is that they do exist, have always existed, and will always exist, whether others understand them or not. There are answers to questions out there, many experts in relevant fields. Having the government mandate private citizens' health care choices is not the answer. The answer is to believe in the rights of individual families and their healthcare providers to decide. Every educator knows that a student's setbacks can lead to growth, but knowingly denying a young person's very personal identity is not how we best help them. It's by listening to them, getting informed ourselves, consulting with experts, and realizing that there are many ways of living, many ways of being that are just as legitimate as ours. Whether the child's sense of self is familiar to us or not, we do them the most marvelous justice of all by allowing them
You have
to
15
flourish.
seconds left.
In closing, I urge you to trust in the rights of families and healthcare professionals to make decisions for the young people in our state. We have the opportunity to help all our children, whether cisgender or transgender, live authentic lives and reach their full potential. Let's work together to ensure that New Hampshire is a place where every young person can thrive, supported by the family and experts who know them best. Thank you so much for listening.
Perfect timing. Thank you. You taking questions? Any questions? Yes, Representative Lamontagne.
Thank you, Mr. Chair, and thank you for taking my question. What age groups or classes of kids did you generally teach in your 30 years of experience?
Thank you. Thank you for your question, Representative. I've taught students ages 13 to 19.
Other questions? Seeing none. Thank you.
Thank you very much.
Also signed up to speak is Beth Scare. Good morning. You have 3 minutes.
Thanks. I'm Beth Scare, grandmother from Nashua, and I'm here to testify my strong support for HB 377 to protect kids from damaging puberty blockers and cross-sex hormones. There's a young gender nonconforming New Hampshire man who, as a boy, liked Barbies and other feminine things. At the age of 10, he socially transitioned, began puberty blockers at 12, started cross-sex hormones at 13, and underwent genital surgery at 17. On social media, he talks about wanting to marry and settle down in a house with a picket fence and raise children. He claims to be happy, but he frequently speaks of his non-existent love life. He's lonely. His body has been fashioned into a simulation of a woman's body, but it will never function like a woman's body, and his dating pool is near zero. The promise is made to him and his parents that he could live happily ever after as a woman were lies. At 24, he's coming to grips with this reality. He's learning that no one can change sex. He could have grown up like so many gender nonconforming men who are living with their functional male bodies intact and in good health. That is what I want for these kids. Stop giving them medications that harm their bodies and their minds, leaving them sexually dysfunctional and infertile and with other serious health problems. Let them grow up whole. Let little boys who like Barbies be their gender nonconforming selves. Don't force them into a gender stereotype box. Gender confused kids and their parents deserve better. Girls who are tomboys and effeminate boys deserve better. Puberty is a human right.
Thank you. Any questions? Representative Weber.
Do you have any research on the rates of regret following surgery as opposed to the rates of people who are satisfied with the surgery, or regret rates for other types of life-changing surgeries, as opposed to anecdotal evidence?
My understanding is that no one's collecting the data on regret. There's very little data being collected on regret. What there is, I could send to you. And what happened in the UK is that they tried to go, the kid, after they shut down the Tavistock, they tried to go to the adult services and find out, how many of these people have detransitioned or expressed regret, and they wouldn't share the data with them. So these are really difficult numbers to find.
Other questions? Seeing none? Okay, thank you. Also signed up to speak is Kelly Van Dolsen.
Good morning. My name is Kelly Van Dolsen, and I live in Epping. I'm an independently licensed clinical social worker providing therapy services in the state of New Hampshire, as well as a concerned constituent. I am here today to implore you to find HB 377 inexpedient to legislate. I've had the privilege of knowing transgender children both personally and in my clinical work. They are kids with all of the strengths and challenges of any child, but with a need for additional medical support to live long and happy lives. The children I know would love access and care to be protected because it really is about the least interesting thing about them when they have access to the care that they need. They would much prefer to be focused on things like school, friends, and activities just like their peers are able to. Denying the children I have known and others like them access to care that is largely, and in some cases entirely reversible, has minimal associated risks, and with a 97% satisfaction rate is cruel and unethical. And that satisfaction rate comes from a 2024 article published in JAMA Pediatrics. This legislation would have absolutely no impact on the vast majority of Granite Staters. It would not improve their lives, help them support their families, or make them safer. They would have no idea that others in their state are no longer afforded privacy, autonomy, and competent medical care in their doctor's office. However, for the small minority that it would impact, the effect would be devastating. The state has no business getting between parents, children, and their medical providers in making complex and nuanced decisions. These deeply personal decisions should be made in a doctor's office, not a legislative chamber. As a state that prioritizes parents' rights and personal freedom, I ask you, as its representatives, to legislate in keeping with those values and oppose this bill. Thank you for your time.
Thank you. Representative Weber.
So am I to understand that you believe it would simply be flat out discriminatory to deny these children the care that they need?
I do. Thank you for the question. And I do, particularly as there is an exception for their cisgender counterparts to receive this same care.
Thank you. And
Follow up?
it's not actually a follow-up, it's a whole new question.
Okay, sure.
Thank you for the indulgence. As a professional, do you have concerns that if we put limits and guardrails around this particular type of care, we may wind up discouraging pediatric endocrinologists from coming to New Hampshire to make their practices here when they can go to neighboring states where they will be able to practice the full range of the services that they think that are needed? And the follow-up to that is, will that have effects for children with many other kinds of childhood conditions? Diabetes comes to mind, that require a pediatric endocrinologist for their care.
Sure. Thank you for the question. That's actually an incredibly pertinent question to me because I also happen to be the parent of a child with type 1 diabetes. And it does concern me. Our pediatric endocrinology team is wonderful, and I know that providing gender affirming services is an important part of their practice. And I do fear that there would be a chilling effect on medical professionals. And I, speaking as a mental health professional, I also fear that some of the language of the bill could provide a chilling effect and leave some mental health providers feeling that there is a conflict between the NASW Code of Ethics, by which we are all to practice, and the law that we have to follow as licensed professionals in the state, in the sense of, providing counseling around seeking gender affirming care.
Representative Woods.
Thank you, Mr. Chair, and thanks for taking my question. Being a counselor, do you read this? You may have heard my question earlier. Do you see this as a chilling effect to talk to your patients at all about any kind of sexual dysmorphia for or against a change? I mean, the way this is written, it just says counseling.
Yes, I do. I do. That does concern me. And I have experience not only providing direct clinical services, but also supervising clinicians who are new to the field and who often have these questions. And to be frank, even as someone with 15 years of experience, I would need to seek supervision from other professionals to really understand what the implications of this bill would be for my practice.
Representative Kesselring.
Thank you, Mr. Chairman. Thank you for taking my question. So does the state have the ability to systematically review things and, let's say stop them if there's evidence of damage or something that could happen to a child or anything like that in your clinical practice?
I'm sorry, just to clarify, do you mean the State Board of Mental Health Practice?
In general, the state, because you mentioned here that the government is involved in this conversation. So the question that I have for you is, have you seen that in your practice? Anything else that has happened that the state has come in and said, this couldn't happen because it's unsafe?
Not that I can think of.
Okay. So if I were to tell you there would, follow up. Sorry. So if I were to tell you there were cases of that, would you agree that that's good or not?
That the state would have oversight into intervening when there are unsafe practices in medicine?
Yes.
Yes, I would think that in general, having oversight would be a good thing for the state to have, but that should be happening at the level of the mental health board in the case of mine, or of other state boards of medical practice, and not necessarily through sweeping and broad legislation.
Okay, follow up. So in your clinical practice, would you say that these puberty blockers are safe and effective, as the question I asked before?
That would be out of my scope of practice as a mental health professional. In my own reading of the literature as an individual, taking the preponderance of evidence, I feel personally that they are, but it would be out of my scope of practice to say as a mental health professional.
Thank you.
You're welcome.
Representative DeLamus.
Thank you, Mr. Chairman. Just a quick question. What's the age range in your pediatric practice?
So my current practice is not, I don't see pediatric patients in my current practice, but over the course of my career, I have seen children and their families ranging anywhere from 3 to 21, and then all through the rest of the lifespan.
Oh, okay, great. Can I ask a second question? Not even a follow-up, just a question. So, being involved in these cases, do you see regret? Are there people who come to you who want to detransition, and what have you done with that?
I have never worked with someone who wanted to detransition. If I did have theoretically someone who came into my practice with that, I would provide the same type of support and evidence-based care that I would to any patient who came into my office, which would mean exploring the reasons for it, looking at their preferred ways of being, and providing support to them, whatever that looked like, regardless of my personal beliefs.
Other questions? Seeing none. Thank you.
Thank you all.
Also signed up to speak is Catherine Harris. I'm sorry. Apologize. And you wrote Saris too.
Oh, no. Thank you so much for listening to my testimony, honorable members of the committee. My name is Catherine Saris, and I'm a performing artist and arts educator. And I drove here from Connecticut today because this is such an important issue for me. I believe that we are all made, every single one of us, in the image of God and are endowed by our Creator with the rights, the inalienable rights of life, liberty, and the pursuit of happiness. I am a survivor of sexual assault, childhood sexual assault. I experienced traumatic, violative behavior between the ages of 5 to 10. This caused my childhood self to believe that being a woman was a position of weakness and to reject my own body. I experienced suicidal ideation from the age of 7. If I had been offered puberty-blocking drugs at my preteen years, I probably would have taken them. It was only years later, as an adult, that I understood the origins of my feelings of self-hatred. Thankfully, gender-altering drugs were not available to me as a minor. And instead, the resources at my disposal were a loving family, youth leaders at my church, and counseling. I am so grateful that my story is not the story of so many persons, like Laura Smaltz from Oklahoma, or Simon Prince's girlfriend, or many stories that I have read and heard over the past decades. I so appreciate the testimony of Jamie Reed from the Courage Coalition that you will hear soon, and the detransitioners and desisters that are present today. My story has a happy ending of inner healing, forgiveness, and freedom. I represent the children whose lives will be saved from significant mutilation and possible death if you do not pass this bill. There are many, many persons who have previously adopted a sexual or gender identity that later they found in life was unfulfilling. I have an entire book here of their stories, and there are many, many more that you can find at changedmovement.com. They found that healing from childhood trauma actually enabled them to eventually be able to be restored to their true identity and to embrace freedom. Please, I strongly urge you to pass this bill, HB 377. Protect our children from a lifetime of regret, and don't live with your own regret that you failed to vote to protect them when you had the opportunity. And I would be happy to take any questions.
Thank you. Yes, Representative.
Thank you, Mr. Chairman. Thank you for taking my question. Is it your belief that had puberty blockers been available, your parents would have, you and your parents and your doctors would have made the choice to take them? And beyond that, do you believe that you would have then at some point later chosen to pursue gender transition rather than stopping to take the puberty blockers and having a normal puberty experience from then on?
Thank you, Representative Miller, and thank you for the question. I know that if I had been raised in the current climate of all of this ideology that we are experiencing, I watch my students every single day. I think that it would have been probably a choice that I would have made. I probably would have chosen to go ahead and experience gender, quote, affirming care, which actually I believe is extremely destructive for minors. Does that answer your question?
Yeah, again, sir, could you not block the door, please? Yes, Representative.
Thank you, Mr. Chair. Thank you for taking my question. Excuse me if it's very intrusive, but when you were a child and you were abused, did you ever think that you were a boy?
No, I never. Thank you, Representative Palmer. Thank you for the question. No, I never thought that I was a boy. I knew that I was born as a girl, and I knew that if I wanted to grow up without the organs that I had, that I didn't have an option for that at that time.
Other questions? Seeing none. Okay, thank you.
Thank you.
Also signed up to speak is Representative Alessandra Murray. Representative, you have 3 minutes.
Sorry, it took a second to unlock my
No,
iPad.
that's okay. We're not counting it against you.
Thank you. Thank you, Mr. Chair and my dear colleagues. For the record, I'm Representative Alessandra Murray from Manchester Ward 9, and I'm here testifying in opposition to this bill. I'll try to speak fast since I have 3 minutes. During my first term last year, I testified on a very similar bill, at which point I came out to all of my colleagues as a trans non-binary person. These issues impact me personally and also impact many people I love. Since anti-LGBTQ attacks have started in New Hampshire this past session, I have multiple friends who are either trans themselves or have children who are gender nonconforming, who are now moving out of New Hampshire because it is no longer safe for them here and because the life-saving health care they need is at risk. Legislation such as this is not protecting Granite Staters. It is ruining people's lives and putting them in danger. There is an incorrect assumption that the use of medical treatments like puberty blockers and hormone therapy is prolific and easy to access. This is patently false. Over the last 5 years, fewer than 1,000 trans people per year have started treatment with puberty blockers. This is a tiny fraction of the 121,000 youth who were diagnosed with gender dysphoria within that same time period. Similarly, just 14,000 total of those youth were treated with hormone therapy, underscoring just how rare the situation is. Puberty blockers are safely used in children who start puberty too early, a condition known as precocious puberty, and their use in trans patients is not considered experimental by experts. These treatments have been taking place for decades. A 2023 study published in the New England Journal of Medicine found after following participants for 2 years after they started treatment that gender-affirming healthcare significantly improved trans and non-binary teenagers' mental health and body dysphoria. On the other hand, I've heard members reference the Cass report. I will gladly send the committee a breakdown of the many inaccuracies in that report. But the issue I'll mention today is that the report endorses psychotherapy as the recommended treatment for youth experiencing gender dysphoria. Used since the late 1800s, it did not improve patient outcomes, with individuals reporting significant distress throughout treatment. There is an abundance of evidence showing that medically affirming interventions confer key benefits, and no contemporary evidence whatsoever shows those same benefits for those treated with psychotherapy alone. All this data shows that gender-affirming care is not only an effective treatment for gender dysphoria, but it is also a necessary one. People keep talking about the permanent effects of these treatments, but do you know what is actually permanent? Is puberty. I knew before 10 years old that I was not a girl, and not only did I feel it in myself, but my entire childhood, adults around me told me I was not meeting their expectations of my gender presentation. Now these same adults want to talk about saving the tomboys, but they don't want to save them. They want them to conform. They wanted me to conform. The truth is, even if this bill passes, you will not eliminate gender dysphoria for a single individual. You will solve problems for no person. You will only increase the risk of suicide for LGBTQ teens and make it even harder for them to become the individuals they know themselves to be. As you vote on this bill in committee and on the floor, I urge you to consider how this legislation aligns with your position on parental rights. May I finish my sentence?
Finished sentence, yes.
If our colleagues should be allowed to treat their children with ivermectin outside of the medical context, why should the parents of gender nonconforming youth not be allowed to make the medically supported decisions that they think will best support their child? I ask you to vote against this bill and urge you to please listen to the voices of my community members here today. We are 1% of the population, but our voices, our experiences, and our lives matter. Thank you.
Any questions? Representative Kesselring.
Thank you,
And
Mr. Chair.
Representative
Thank you for
Reyes.
taking my question. So I had a question for you. You said that it wasn't experimental. To your knowledge, is there any puberty blocker that is approved by the FDA under that?
I believe that if not by the FDA, the majority of these treatments are considered on the same level as prescriptions such as Wellbutrin. There are plenty of treatments that are considered off-label, not technically FDA approved, that are widely used across the industry for multiple conditions.
Follow-up.
So question for you too. I know the Mayo Clinic studies. I know a couple different studies that were sent to me over email. They did show that there was harm to kids, whether bone density and different things. Would you agree with those studies or not?
I mean, I would have to look at these individual studies. I would say every medication for the most part has some sort of side effects, and it's up to the individual, their parents, their doctor to determine if those side effects are worth the treatment that is being treated, the medical treatment itself.
Thank you.
Representative Reyes.
Thank you, and thank you for taking my question, Representative Murray. I appreciated you laying out a lot of hard data that we had not yet heard this morning. Could you possibly, if you know, elaborate on how much like mental health evaluation and treatment happens, as a patient is going through this process? Because the previous speaker, it was almost like people thought the drugs are just handed out. And so I was wondering if you could illustrate for us, or maybe another mental health professional, sort of how more detailed the therapy that patients would get if they're in this course of therapy.
Yeah, I mean, obviously I can't speak to every case. I can speak to my own as an adult. I've been talking with my doctor about my gender dysphoria for 10 years. And throughout that time, we've explored multiple treatments, and at no point were those treatments offered to me on the first visit right away at all without trying other less invasive or easier treatments first, starting with psychotherapy.
Any other questions? Seeing none. Thank you.
Thank you.
Also signed up to speak is Nancy Brennan.
Good morning. My name is Nancy Brennan. I live in Ware. And I have been reading, studying, following, and testifying on issues like this for the past 8 years, ever since I worked with the Venerable Rennie Cushing to pass the first transgender non-discrimination bill. I think it's important. I did bring testimony. I have sent you testimony, and the testimony I sent you has a lot of reference material. And I have brought even more, but I know you're not giving me an hour. There is good information out there that tells what transgender care is and what it does. I would recommend a book called Free to Be, which is by a clinician and a researcher with loads and loads of schooling and experience working with transgender kids. We have heard stories today, both from people who want this care and, I think so far only secondhand, but we're going to hear some others, from people who themselves wound up detransitioning. This book gives the history, the science, and then representative stories of real children who went to gender clinics and who spent weeks, months, years being counseled before they were ever given puberty blockers. Some never given puberty blockers. Some left happy with who they are. Nobody that I read about was pushed into it. I'm not saying it can never happen, But I am saying that there's a lot of false information out there. The CAS review, which was mentioned, is seen as some kind of a, be all and end all of why we shouldn't do this. But the CAS review has been reviewed by real doctors, real endocrinologists, and they found a lot of problems with it. I can send it to you if you're interested, but there were, 15 or 20 doctors, gender care people, who had a total of 86 years of experience and published 278 peer-reviewed studies. And they came out with all the things wrong with the CAS review. There was a question, and it may or may not have gotten answered. There was a question about regret overall for trans care. And this is probably specifically more
You have
for
15 seconds, please wrap
more
up.
for adults. But the regret is only 1%, as opposed to knee surgery, which is 6 to 9%. At any rate, I have lots of information, and I hope you will listen to the stories of the people that need this care.
Thank you very much. Any questions? Seeing none. Oh, okay. All set. Thank you. Also signed up to speak is Peter Doyle.
Esteemed legislators of the House Health and Human Services and Elderly Affairs Committee, I'd like to begin by thanking you all for your hard work for the people of New Hampshire and for your concern for the health and well-being of gender-distressed children. I'm here to testify in favor of HB 377. Before I do, I'd like to tell you a little bit about my own experience. My name is Peter Doyle. I'm a lifelong Democrat and liberal, and let me be clear, I'm not anti-trans. Adults may do what they feel is best for them. Children, however, require a higher degree of safeguarding. I know this to be true because I was once a so-called trans child. As a child, I experienced what's now called gender dysphoria. From a young age up until puberty, I regularly told adults that I was a girl. This was the 1980s, so it was not taken seriously, and rightfully so. Gender dysphoria did not really exist then. We had not begun to pathologize gender nonconformity in youth. More importantly, I was not a girl. I was a boy. The idea that I could become a girl was seen as absurd because it is. It's tooth fairy wish only a child could believe. The adults in my life knew this, and they acted accordingly. Painful as it was at the time for me, I am better for it. Had I grown up today, what is a normal developmental phase would have been affirmed as real. I would have been shipped off to a gender clinic where so-called clinicians would have abandoned their Hippocratic oath and ignored the evidence to make my tooth fairy wish come true in the form of puberty blockers and cross-sex hormones. That would have been a grave mistake. I did not need blockers or hormones to be my so-called authentic self. I just needed to grow up. My experience is very common among same-sex attracted adults. I grew up to be a healthy, happy gay man who has lived a full life thus far, and I know many others with similar experience to my own. Given that childhood gender nonconformity is a common experience for most same-sex attracted adults, how can you tell the difference between someone like myself who would have been harmed by medicalization versus someone who wouldn't? The short answer is you cannot. Children do not know who they are. They are children. It is the duty of adults to orient them to reality. That's a normal part of growing up. Gender distress is no exception. Protect vulnerable kids like I was. Let kids be kids. Let them grow up just as I did. Gender transition is an adult decision that children are incapable of making. This is why I urge you to support HB 377. Thank you.
Thank you. Any questions? Seeing no questions, thank you. Also signed up to speak is Kathy Stratton from the New Hampshire Medical Society.
That's on, correct?
It's on, yes.
Thank you. Honorable Chairman and members of the Health and Human Services and Elderly Affairs Committee, my name is Kathy Stratton. I'm the CEO of the New Hampshire Medical Society. I'm here today representing the Medical Society in opposition of House Bill 377. The Society's members have serious concerns about how this proposed legislation would interfere with the doctor-patient relationship. As a society of physicians, New Hampshire Medical Society is opposing this bill based on some core principles and values. The legislature should not be in the business of regulating and licensing decisions that need to be made between the physician and the patient. The New Hampshire Medical Society has a long-standing history advocating for patient rights and the ability for patients to receive appropriate medical-based care based on their own unique mental and physical health needs. I want to spotlight 2 physician testimonies that will be submitted online. One is from Dr. Maria Boylan, who is a family practice physician. Unfortunately, these 2 physicians that I'll reference today are taking care of patients in New Hampshire, and they're unable to be here. And in the testimony of Dr. Maria Boylan, she states that this is part of a well-established process that each child's physical, mental, and emotional health needs are prioritized. Scientific and medical commitments, including organizations such as, scientific and medical communities, including organizations such as the American Academy of Pediatrics, the American Medical Association, and the American Psychiatric Association, strongly support gender-affirming care. I have with me today testimony from Dr. Frances Lim Liberty, who actively treats young patients with puberty blockers, and I will share that with you today. I won't be taking questions today, but I appreciate the opportunity to present to you and for you to consider our testimony. Thank you.
Thank you. Also signed up to speak is Jan Mertzler, I believe it is. Did I pronounce that correctly?
Too many consonants in a row. It's Jan Hertzler.
Oh, I'm sorry.
No worries. Everyone gets it wrong. Chairman McDonald and honorable members of the committee, I'm sitting before you as the parent of 2 trans boys, both of who started testosterone before age 18 in strong opposition to HB 337.
Yeah, could you move the microphone a little closer, please?
Sorry, should I start over? Or?
No, that's fine.
Okay. When my middle child told me he was trans, I was confused and even felt a little betrayed as a woman. What was wrong with being a girl? Had I not modeled womanhood effectively? Thankfully, those feelings faded quickly as I talked with my son and did more reading about what it's like to be trans, but I'm still ashamed of my first reactions. I'm telling you this so you can understand that, like all parents of trans kids, this was not something his father or I pushed upon him. Well, my husband and I were always open to the idea of our kids being gay. The idea that they might be transgender was never even a blip on our radar until our son came out. Sorry, I'm super nervous. Before coming out, my son was anxious and depressed, so we sought counseling for him. After he came out, his therapist was able to talk with him about what he was feeling regarding his gender. He was in therapy for at least 2 years before he seriously broached the idea of starting testosterone, which, like everything in his life, he had meticulously researched before asking if he could. He's a research kid. His therapists, his physicians, and we as his parents all talked with him extensively about what it would mean for him. Let me be clear, hormones are not given until there is no doubt that it is in an adolescent's best interest, and that can and usually does take years. To take this decision away from those who know the adolescent best, and worse, to make it a felony to do so, undermines not only the parent-child bond, but also what's recognized as best practice medically. None of these decisions are made lightly, and the interference of the state does nothing to help. The truly compassionate thing would be to trust parents, their child, and medical professionals to help make decisions that are in the child's best interest. I hope that you'll take our experience into consideration when voting on this bill and deem it inexpedient to legislate.
Thank you. Any question? Are you taking questions?
Yeah.
Any questions? Representative Weber.
I was just wondering, hear.
Oh, sorry.
I was just wondering the ages of your sons.
My middle child is 21 and my youngest is 17.
Thank you very much.
Thank you.
Representative DeLamus.
Thank you, Mr. Chair. This is actually more of a follow-up to the representative's question. When did they start their therapy?
My middle was, I believe, 13, and the youngest was 14.
Okay,
So it
thank
was-
you.
Yeah. And before that, there was no, like the hormone therapy was much, much, much later. Everything was social before that. And, you know, we had to wait until, I don't think that anyone will give hormone therapy before at least a year of therapy. And usually it's 2 or 3.
Other questions? Seeing none. Thank you. Also signed up to speak is Stephanie Colley.
Hello, everyone. Excuse me. My name is Stephanie Colley. I am from Center Conway, New Hampshire, and I'm here to oppose HB 377. As you probably can tell by my voice, I am a transgender woman, and so I have irreversible changes from having gone through puberty, male puberty specifically. So for those that have spoken about the fact that children who undergo cross-hormonal therapy will have irreversible changes, there will be changes regardless, I assure you. So a couple facts that I've heard many questions about was the how often people regret it. So I pulled up a couple of things while I was listening to the earlier testimony. And basically, according to a 2022 study, trans kids are almost always right about their transness. And so recent studies show that over 97.5 to 98% of the kids who declare their transness maintains that over time. In other words, detransitioning is quite rare. Yes, you will hear from people who considered it or even went through transition and later changed, but it is quite low. The other thing is that there was a very large study, in fact, I was part of that in 2022, called the U.S. Trans Survey, and they studied over 90,000 trans people, 90,000, okay? And out of that, almost no one regrets any sort of gender-affirming surgery, and 97% report that life satisfaction improved after gender affirming surgery. And again, kids are not getting gender affirming surgery. This is not Jiffy Lube. One kid doesn't come in as a boy and goes out as a girl or vice versa. It's not the way it happens. It takes years even for adults. In my own case, I was in counseling for, oh God, I can't even count, decades, and ultimately came out later in life. And I went into counseling for 2 years, and then I went to low-dose hormone therapy for about 4 to 5, and then finally went into higher levels of hormone therapy and transitioned 8 years after the whole process. So this is nothing that's done quickly and lightly. And I do not think, given the preponderance of evidence of that gender affirming care helps people, I don't think it's the position of the government to be, interceding against parents, the children, the patients, and the doctors. If there's evidence that comes out showing problems, certainly that's a different story. But they've been using these puberty blockers for 4 decades.
You have 15 seconds.
Okay, and that's pretty. So I just urge you to oppose. If anybody has any questions, I'm willing to answer.
Thank you. Any questions, Representative DeLamus?
Thank you, Mr. Chairman. I'm interested to know what age did you start the hormone therapy?
I was 53.
Okay.
I'm almost 70 now. I'm 69.
Okay.
Yeah, almost 70.
So as an adult,
Correct.
you've made this decision.
Yes, and I regret not having that option. I knew at age 4 which was 1959, if you want to do the math, that I was female. But back then, that was not an option. And I feel like we're trying to get pulled back into those bad old days.
Okay, thank you.
Representative Kesselring.
Thank you for the question. Thank you, Mr. Chair. I just have a question specific to your experience. You said you were 4. So my question would be, if you were to take those hormones then, would you have a concern of other, I mean, would you be concerned now that you would have had other issues and developmental and things like that that would have affected you negatively now in your later years, let's say?
Well, first of all, at age 4, you would never start hormonal therapy. Not then, certainly, but not now. When children at a young age present with gender dysphoria, they go through counseling for quite a while, and then they socially transition with the parent involvement, the psychiatrist, psychologist, therapist, whatever, the doctor. They go through social transition, meaning they just dress appropriately for whatever they feel comfortable, change their hairstyle, etc. It's not until I believe it's Tanner stage 2 puberty. I think that question was asked earlier, when they begin having puberty blockers, and it's at Tanner stage 2. At that point of puberty, they then consider the puberty blockers, because that allows the child and the family and the doctors and the therapist time to see if this transness maintains itself, if this child truly does want it, or if it's just a phase, or they're exploring. So you're not going to start any sort of drugs, surgery, or anything at age 4.
Follow up?
Follow up.
So then I guess I'll rephrase the
Okay.
question. If there were scientific proof that it would cause detrimental harm to a child, would you be opposed to us passing a bill that would make it to 18?
If there was scientific evidence of harm, the medical societies, which all support this, would be against it. They're the ones that study this. They do the follow-up studies. And when they come out with information that indicates a particular therapy is dangerous to in the preponderance of evidence, they're going to stop that as well. I was a healthcare professional for 41 years, as a nurse for 35, and I saw a lot of changes in those decades. And during that time, I saw things that were set in stone that then later changed. But again, these medicines have been studied for decades. They've been using that for precocious puberty for, I think, 40 years. So it's a long time. They've been looking at this stuff, and they'll continue to look at it. And again, people have said, well, there's potential health problems like bone density issues, etc., sterility. I will remind you that suicide is one of the leading causes of sterility. Okay? So, and suicide is quite high in our rate. And trust me, I know this from personal experience. Okay? So, thank you.
One more follow-up. I'll make it quick. So you mentioned you worked in the medical field. Did you see a large amount of money being made from this type of industry?
No, I did not. But I will, and honestly, I didn't work directly in that. I was primarily a cardiac intensive care nurse.
Okay, thank you for.
Yep.
Other questions? Seeing none. Thank you.
You're welcome. Thank you.
Also signed up to speak is Seth Hertzler, I believe it is.
Good morning. Oh. Is there anything I need to do with the, okay, microphone, okay.
Yeah, it's on, yeah.
My name is Seth Hertzler. I am a 21-year-old transgender man, and I vehemently oppose this bill. I was 13 when I first realized I was trans, and I had gone through an estrogen-fueled puberty long before then. I was 8 when I had my first period, and at that point, I had also started to grow breasts. I had all the hallmarks of a female body. I had never felt comfortable during or after puberty. I was told by family members at the time that I would get over it, but I never did. Doctors never took me seriously. Their priority was always making sure that I could bear children. Any push to maintain my own bodily autonomy was met with lectures about how it may negatively impact my ability to be a mother. I never wanted to be a mother. All of that pushback and incessant reminders of my worth as a reproductive vessel was amplified tenfold 2 years after coming out, when I sought a medical transition. Before I could even be considered for testosterone, I had to get a letter from a therapist stating that I had been consistent in a diagnosis of gender dysphoria for at least a year. I filled out form after form telling me the risks, and when I was 14, I finally got to go on testosterone. And just as medical literature from decades of research has confirmed time and again, it dramatically improved my mental and physical well-being, as any necessary medical treatment should. I am not exaggerating when I say that gender-affirming care is the reason I am alive and well today.
Okay, thank you. Any questions? Seeing none. Okay, thank you. Also signed up to speak is Donna Peterson. Is Donna Peterson here?
Could you tell us whether the person supported or opposed?
Donna Peterson supports the bill.
Thank you.
Okay, I'll put that to one side in case Donna Peterson should come back in. Also signed up to speak is Elias, I believe it's Lucre. Did I pronounce that correctly? Did I pronounce your name correctly?
It's Lucier.
Okay, sorry.
It's all right. Anyways, hello. Thank you for your time. As you just heard, my name's Elias Lucier, and I'm an 18-year-old trans man. I oppose this bill. I will be speaking about my personal experiences with HRT, hormone replacement therapy, and some pieces of important history. I started HRT when I was 15. I remember the excitement I felt with each change I experienced, and how truly confident I felt in my body for the first time in my life. Unfortunately, that came to an end all too soon, as at 16 I was diagnosed with stage 4 Hodgkin's lymphoma. For safety reasons, I could not be on HRT and chemo at the same time. So now, along with being stuck in a body that was slowly killing itself and being killed by chemo, I was stuck in a body that no longer aligned with how I saw myself, as once you stop HRT, most of the changes reverse. I was old enough to choose to start chemo, and my cancer-related scans that gave me large doses of radiation. If I was deemed old enough to choose those drugs that could have killed me, then I was old enough to decide what else I wanted to do with my body. Now I'm in complete remission, and I've been back on HRT for about a year. It has practically saved my mental health, and it saves the mental health of many other trans youth, many of which I know. With the introduction of all these anti-trans laws presented in just the last 2 months, along with the one being presented today, these laws and bills are trying to scare trans kids into compliance so that they can erase trans people. Do you know who else had tried to erase trans people in the past? The Nazis did. Just 3 months into Hitler's reign, the Nazis attacked the first queer and trans clinic and burned all papers and books retaining to trans people and their health care. We've already seen similar erasure in our own country, with the word transgender simply being erased from all government sites, among many other laws and executive orders attacking our community. It's been 2 months, and the law is already trying to erase us. How long until books start getting burned again? I assume not long, since books discussing trans people are already being banned from schools. A quote from Heinrich Heine, in which the book containing it was burned that day by the Nazis. Where they burn books, in the end, they will burn humans too. This bill is the stepping stones to do the same thing as the Nazis: erase trans people. Those who do not learn from history are destined to repeat it. If you do not learn from history and decide to pass this bill, you are doing the same thing as the Nazis all those years ago. All my sources are included with my statement, which was submitted online. I will not be taking questions, and thank you for your time.
Thank you. Also signed up to speak is Courtney Tanner from Dartmouth Health. Okay, will she be coming back or is she all?
I'll let her know that she'll that's
Okay. Also signed up to speak is Lauren Cole Johnson. And let me remind you, 3 minutes, please.
Thank you, committee members, for hearing my testimony. I will be quick. As an educator of high schoolers, as a parent, and as a resident of New Hampshire for more than 2 decades, I am distraught and saddened to continue to encounter horrendous legislation emerging from this body in response to unfounded fear. HB 377 FN is based on inaccurate assumptions by folks who know little about gender-affirming care. I speak with compassion and love for my family members and for the LGBTQI community. To quote an inspiring young person I heard testify in another committee regarding hateful bills that would harm her sibling, I'm not going to answer questions because there should not be any questions about what I say here. That young person said there should not be any questions because healthcare is a human right. This bill does nothing to help children. It does direct harm to children. The title of HB 377 is Vulnerable Children Compassion and Protection Act. We need a definition for compassion in this hearing. Compassion, a feeling of deep sympathy and sorrow for another who is stricken by misfortune, accompanied by a strong desire to alleviate suffering. This proposed act does not evoke deep sympathy for children, nor does it include a strong desire to alleviate the suffering of said children. In fact, this act promotes the criminalization of trained medical professionals whose years of training is backed by years of scientific research. In criminalizing professionals, this bill also does direct harm to their patients. The word protection means care, guardianship. Who are you trying to protect? If it is the patients you are trying to protect, then rip this bill up. It does nothing to protect children. I strongly urge you to oppose this bill and vote yes for compassion. Thank you.
Thank you. Also signed up to speak, I have the name Winter here. Is that your first name, last name?
Yeah, sorry. Winter is my first name. Winter Golden. I am 15 years old.
Last name Golden?
Yes, like the color. So
Thank you.
I strongly advise opposing this this bill because like I was once very suicidal, and that's mainly because I had a bad therapist and couldn't get the help I get. I've had trans friends and still have them that are really suicidal, and well, because they don't feel love, they're not getting the help and care they need. And that's very important because like coming from a trans person, if I didn't get the help eventually, such as hormones and blockers, I'm gonna be real, I don't even know if I'd be alive right now. But also, it's very important to support young kids instead of take away. And yeah, and I kind of lost my train of thought. Questions are welcome.
Okay. Hey, Representative Weber.
Huh?
Thank you.
Representative Weber.
Thank you, and thank you very much for taking my question. My question is, could you tell us a little more about your life before you started taking hormones and after, and what changes you saw?
Okay, so
If you're willing to discuss that, I don't want to be intrusive.
No, it's okay. I'm totally fine with it. So I would like cross dress in this Little Orphan Annie costume when I was about like, I don't know, 3 years old. I remember it vaguely, and I would wear this fairy costume constantly when I was like 4 after going trick-or-treating. And honestly, once, like, I had major depression beforehand because I don't think mom and dad knew what trans was. I didn't know what was. I didn't have the language to describe it. And so when I did, yeah, everything changed. When they started to raise me as a girl, I felt whole again. And before all that, that was basically it. I was happy and it was great until one day I hit a tiny bit of male puberty. I got the blockers and it really helped me out emotionally. And later on, in a nutshell, long story short, got the hormones, and I find it very important and very meaningful, and strongly recommend you oppose this bill.
Thank you very much.
Of course.
Okay, thank you. And Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. So you mentioned that you had changed therapists. I'm just curious if the new therapist that you have recommended the therapy that you're currently doing or the course of action that you're doing.
My old therapist was a jerk who honestly was unsupportive and wasn't very nice and wasn't really a good person. So I switched to a therapist I used to have when I was 9 who was actually trans himself, and it just kind of happened because my old therapist was uneducated and I couldn't get the care I needed. So no, they didn't set me up with a new therapist. I got this one myself.
Representative DeLamus.
Thank you, Mr. Chairman. How old were you when you started the actual therapy, the blocker?
10 years old.
You were 10.
Yeah.
Okay.
Any other questions? Okay, thank you. All set.
Of course.
Also signed up to speak is Dr. Deborah Warner. You've asked for 5 minutes. Again, please remember we're limiting testimony to 3.
I understand. Thank you so much for taking my testimony. It is, of course, an honor to be in front of your committee. Thank you, Mr. Chairman and members of this committee. I'm Dr. Deborah Warner from Littleton, and I came down the highway to testify in favor of this bill. I'm a psychologist. I've been in practice many years, and in the settings of private practice and in clinic devoted to recovery from violence. I worked for the state and the Children's Psychiatric Hospital, as well as the Department of Corrections, both adult and juvenile. I currently have a practice that's in private, and I see patients actually many times by telemedicine now. I was trained in child, family, and adult psychology. I trained in Bowling Green, Ohio, and then I did my residency in Rochester, New York, and my internship at the University of Rochester Medical School. I am well trained in child psychology. And one of the things I wanted to bring up is that when we have, what childhood is about is developing and growing. they're not just small size humans. There's a lot of work going on inside of their mental capacity and their emotional development. They do the obvious things like grow and have sports, and they learn things in school, facts and skills. But they also, inside of their mind, they are also working out many emotional things that they need to master in order to become adults. We develop our sense of identity. We develop our understanding of relationships, our sense of self, and how we relate to the world. We cover philosophical things. Who am I? What am I here for? And all of those things are covered for a minor while they're on their way to adulthood. And so you could look at what are the important tools of a child. Let's look. If many times they would take on roles in order to see, well, I'm going to be a pirate, I'm going to be a princess, I'm going to be a doctor, I'm going to be a firefighter, and they might live out those things for a while. What we do with our imagination is very important. And just as a carpenter's skills, their tools are a saw and hammers, a child's tools are their imagination and play. And in those processes, they need to have the ability in their formative years that the things they do are not permanent. They can play with this thing. They can play it through. They might become a firefighter. They might become the other gender later with the facility of medical
You have
science.
15 seconds left.
And so we need to make sure that the children remain in that protected state, that the things that they do are not permanent, that they can reverse them.
Thank you.
Thank you.
Any questions? Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. I have a question for you with your experience. Have you seen a lot of kids with, let's call it gender distress in their youth, change their mind when they?
Oh, yes.
Okay.
Oh,
Would you
yes.
say that's a large portion of it or a small portion?
Most. Most do.
Representative Lamontagne.
Thank you, Mr. Chair, and thank you for taking my question. But have you seen children that don't change their mind? From your testimony, it
Yes.
sounds as if you don't believe that there are trans children that.
Yes, indeed. We've heard many examples already today that there are people who have a very firmly consistent view of themselves in a particular role, in a particular gender. And it is unfortunate that in the current landscape of ideas in social society is that the idea of changing genders is right on the table with other options. And so it becomes a little too easy for children to look in that direction. However, they still may maintain that, and come adulthood, they could finish the procedure.
Yes, please. But would you not agree that puberty blockers, which this bill would prohibit, may give a child the option to really work things through, give them time to decide and figure out whether it's a passing phase or they are truly trans children? And would it not give them the option to transition later without having to go through puberty and the gender which they really do not
Yes, that
belong?
as long as it's reversible, it would make some sense. But quite unfortunately, the puberty blockers, once you pass the years of puberty, you cannot go back and have puberty. Thank goodness for most of us, puberty was a difficult time. And, we all have some sort of amnesia, various phases of repression of the things that were difficult then, but that we somehow or rather managed to get through. It is unfortunate that it's a med like that is not reversible, because then they can't just try it.
Follow up. I believe most of the testimony we have and the evidence online is that they are reversible puberty blockers.
If you go all the way to adulthood and you haven't had puberty, You can't go back and get it.
Other questions? Seeing none. Okay, thank you.
Thank you.
Also signed up to speak is Savannah Griffin. You've asked for 4 minutes. Again, please keep it to 3.
Will do. Hello. My name is Savannah Griffin. I'm from Bradford, New Hampshire, and I'm a trans woman. There's been a lot of talk about regret and permanent, irreversible decisions, and let me start by saying that my biggest regret is not transitioning sooner. And as for irreversible changes, suicide is an extremely irreversible change. When I was 17, before I had come out, I was suffering severe depression, and driving home from school one day, I drove my truck off the road, hoping I would not be alive at the end of it. Luckily, I survived, and I started counseling and antidepressants. The antidepressants weren't very effective, but I managed to survive, and through counseling, I was able to accept myself as who I was and start estrogen. I was 18 at the time, and it's the best decision I've ever made. 6.5 months after starting the estrogen, I was able to quit the antidepressants. I've been as happy as I've ever been, and I go months without having suicidal thoughts at all. Whereas before coming out, it was daily. Not just suicidal thoughts, but self-harm, drug abuse. It was not good. I'm lucky to have come out alive. This bill, which I am opposed to, I forgot to state, would have prevented me from starting the hormone replacement therapy that I desperately needed had I been able to accept myself as who I was before I tried to kill myself. And maybe that would have kept me from trying to kill myself, and yeah. We don't need any more suicide attempts. It's enough of an epidemic already. Please, just realize that...
You're down to 10 seconds.
Okay. Thank you for taking your time, and I will gladly answer any questions.
Thank you. Any questions? Representative Weber.
So just to be clear, is it your testimony that for you, the lost opportunity that we've been talking about in other directions, for you, the lost opportunity was not having the treatment that you needed earlier in your life when you needed it?
Precisely.
Other questions? Yes, Representative.
Thank you, Mr. Chair. Thank you for taking my question. At what age did you realize that you were not in the proper body, or what age did you realize you were not the gender that you were born as?
I started suffering from dysphoria at about the age of 15, although I didn't end up coming out until I was 18.
Representative Lucas, did you have your hand up? No? Oh, okay, sorry. Anyone else? Yes, Representative Hartnett.
Thank you, Mr. Chair. Thank you for your testimony, and thanks for taking the question.
appreciate that you're here in opposition to this bill. One of the things that would be helpful for us to understand a little more is what the process was like for you once you found a physician to work with. What the process was like, the discussions were like, how long it took before prescribing happened, what they explained to you about the risks of the medicines, the benefits, those kinds of things. We've sort of been missing a little bit of that today. It would be helpful if you could explain that.
I mean, my testimony might be slightly not, well, I guess not perfectly aligned, because I didn't come out till I was 18, so I underwent a slightly different process. But I started counseling shortly after my suicide attempt. And then through counseling, I discussed my dysphoria. We discussed options of, well, being trans or being some other sort of gender non-conforming. And I eventually came to the realization that I, in fact, very, very much needed to start estrogen and spironolactone, which is a testosterone blocker. And I was in college in the North Country of New York at the time. So I went to Planned Parenthood North Country and explained my situation to them with my, about how I had been seeing the therapist, and they gave me a very dense packet of information, and they ran some blood tests, and they started me. They said I could either start on estrogen or spironolactone, but I could only start one at a time to see if there were any side effects. And so I chose to start on estrogen, and after about 3 months of no negative side effects, I started on spironolactone after they ran some more tests to make sure that my levels were normal. Yeah.
Follow up?
Yeah, thank you. Did you feel like you could have stopped this at any point if you wanted?
Yes, I could have, but being honest, that thought never really crossed my mind because, I mean, I was happier than I'd ever been before.
Thank you.
Representative Kesselring.
Thank you, Mr. Chairman. Question for you on your, I don't know how to phrase this question. I'm trying to figure out how to do it. But so specifically, when it comes to, you mentioned that you had therapy after you had tried to commit suicide. Did you have any therapy prior to at all?
Very little, but I think if I had had some counseling, I might have been able to come to the conclusion that I was trans and maybe even start hormone replacement therapy before I had tried to kill myself.
Follow up.
So is there anything else that you would say going through your experience that you could help us understand that that could be done differently to help the suicide conversation?
I mean, there's still quite a social stigma around suicide. And I think it needs to be talked about. And if you are suffering those thoughts, please talk to somebody, and maybe you can work out your issues before you try to take your own life.
Other questions? Seeing none. Thank you.
Thank you.
Also signed up to speak is Grace Bonena. Bonena. And you've asked for 5 to 10 minutes. Again, we have to limit testimony to 3 today.
Yep, I understand. I just want to say that I just put my legal name down, given that this is a legal setting. I would prefer you refer to me as Oliver, and my last name is pronounced Bonema. I fully understand. No one pronounces it right the first time. So I just want to preface this with the fact that I am actually one of the people who would be impacted by this bill. I am currently 17 and seeking hormone replacement therapy. I've been in the process of seeking this treatment for about 3 years now, and prior to that I was in significant therapy for other unrelated reasons. I would like to say also, kind of where I would like to say here is that I find this bill to not only be abhorrent and contributing to the genocide of trans people, which I will get to, but also to be incredibly unnecessary. I actually am from Sutton, just kind of a similar area to our previous speaker, and I've actually experienced extreme bullying to the point of that I've been diagnosed with complex post-traumatic stress disorder. Excuse me, in relation to my gender expression and gender identity due to the bullying I experienced from 1st through 5th grade. Now, I experienced this bullying not because I considered myself trans or called myself as such, but instead because I asserted that I was neither a boy nor a girl because I am transmasculine, non-binary. I would like to say that the bullying that I experienced actually greatly discouraged me from coming out as transgender and in fact delayed my wanting to identify as such publicly for many years. And I would like to say that I find that this bill is only going to encourage that kind of bullying and that kind of fear in trans youth. I would also like to say how this fits into the definition of genocide. Excuse me. So the official definition of genocide as defined by the United Nations is as follows. Quote, genocide means any of the following acts committed with the intent to destroy in whole or in part a national, ethnical, racial, or religious group. As such, A, killing members of the group, B, causing serious bodily or mental harm to members of the group, C, deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part, and D, imposing measures intended to prevent births within the group, and E, forcibly transferring children of the group to another group. I use the term genocide here in no way meaning that this has reached the extent of the Holocaust or various ongoing genocides in Palestine and in the Congo, and in no way intend to delegitimize these fights, but instead to draw necessary attention to the cause. And anytime I'm going to cite a piece of legislation here, I may not name the bill number, but it is from the official legislation. I have done significant research into this. I would now address each one of these criteria one at a time. Some nuance is required because being transgender is not something that is passed down like through families or genetically like a religion or other ethnic thing is. It's similar, honestly, to the way disabilities are. Firstly, killing members of the group. 350 trans people were murdered because they were trans in 2024, an increase from last year by nearly 10%. These murders were motivated by the fact that they were trans, and this especially impacts Black trans women. And keep in mind that there are only a couple million trans people in the U.S. Trans people have about, I believe it's 3 times as likely to be murdered as their cisgender counterparts. Second is serious bodily or mental harm to the group. Numerous states have either put restrictions on or outright banned trans healthcare, as you were attempting to do. Yep, which is it proved to reduce rates of depression, anxiety, and self-harm, and suicidal ideation comparably to about 20% of people antidepressants working for people. Additionally, there is the shooting of queer and trans spaces and the attempts to eradicate these physical spaces, and the defining of gender-affirming care as child abuse, despite the fact that there is no evidence to as such, in the attempt to remove trans people from their families. I ask that you oppose this bill. Thank you.
Thank you very much. Any questions? Seeing none. Okay, thank you. Also signed up to speak is Linz Jakehouse.
Hello, members of the committee. My name is Linz Jakehouse, and I am a co-founder of 603 Equality, a statewide organization that advocates for LGBTQ+ people. While I myself have never accessed puberty blockers or hormone replacement therapy as a non-binary person, I've spoken with countless youth and adults across our state who have, and who have been able to grow and thrive into happy, healthy young adults due to being able to access this medical care. As with any type of healthcare, it is natural to have questions, but questions about healthcare should be answered by doctors and these decisions made by families, not politicians. Some opponents of this care have put forth the false idea that teenagers cannot consent to medical care. This is a false idea that seems to only ever be applied to accessing gender transition related care. If it was true that teenagers couldn't consent to medical care, childhood cancer wards wouldn't exist, and children and teens would have to wait until their 18th birthday to repair a broken bone. The best way to protect the health and well-being of transgender young people is to ensure that they can continue to have access to essential, age-appropriate medical care from licensed clinicians practicing according to the well-established standards of care. Studies have found that regret for transition-related care is quite rare, as low as 1 or 2%. Studies have shown 6 to 30% of patients are dissatisfied after knee surgery, yet no one is trying to pass laws to ban knee surgery. Transgender young people who meet criteria for gender dysphoria and who undergo social or medical transition are actually the least likely to regret their care. And those vast majority of transgender youth remain consistent and persistent in their gender identity over time. Many people who choose to stop a medical transition have complex, unique reasons like discrimination, feeling at home in a more non-binary identity, or not feeling like their transition requires medical assistance. I respect everyone's unique journey, but no one should seek to use the law to stop others from having the freedom to medically transition just because it wasn't right for them. Additionally, the largest doctors' union in the UK, the British Medical Association, voted in favor of a resolution to publicly critique the Cass review used to crack down on gender-affirming care for trans youth in the UK, calling its recommendations unsubstantiated. The organization also voted to oppose the implementation of the review's recommendations, and stating that gender identity services in the UK are inadequate, a claim well supported by the extreme wait times of 5 years or more, which have been linked to suicides among some trans patients. They assert that the Cass review engaged in unexplained study deviations and ambiguous eligibility criteria while excluding evidence supporting transgender care. Evidence-based standards of care exist to ensure that no one, regardless of their age, undergoes any permanent, irreversible changes without informed consent and careful consultation with medical and mental health professionals. Banning this medically necessary care puts transgender people at increased risk of serious harms, including depression, self-harm, and suicidal thoughts or behavior.
You have 15 seconds.
When transgender youth, like all youth, receive the medical care they need, they are able to thrive and have healthy, happy childhoods that set them up for success in life. Like gay people, many transgender people have a basic awareness of who they are from a young age. That's why families need the freedom to provide trans youth with the support and care that research shows helps them live happy, healthy lives. I'm happy to take questions.
Great, thank you. Any questions? Not seeing any. Okay, thank you. Also signed up to speak is Anne Marie Banfield. Okay, that's fine. Also signed up to speak is Jonah Sutton Morse.
Thank you, Mr. Chair, members of the committee. My name is Jonah Sutton Morse. I live in Canterbury, New Hampshire. I am here to testify against this bill. I want to start by affirming that trans boys are boys, trans girls are girls, trans non-binary people exist. I am the parent of a trans kid, but I actually want to tell you a story about my adolescence. My body was changing, I was getting hair in new places, and I felt a little lump in my chest. And at first I didn't think about it very much at all, and then I thought about it a lot. And then I went and talked to my mom about it, and that will tell you how nervous I was. And eventually we went and talked to my doctor, who said, yep, you're going through adolescence. Your body is changing, you're going through puberty, you're making and reacting to various hormones. You are developing breast tissue. And I said, wait, no, hang on, I get the beard one, not the breast one. And my doctor told me bodies are complicated, and we talked a bit about some of the complexities of puberty and hormones, and even with that conversation, it was really very confusing to have my body developing in a way that did not align at all with who I was. I did eventually go through a more typical male puberty development. I joined the swim team. That's basically what got me through high school. I went off to college, got married. We moved to New Hampshire. We're raising a family. Life is pretty good. If this bill becomes law, some kid in New Hampshire is going to notice his body changing and hair in new places, and he's going to feel a lump in his chest and not think about it very much, and then think about it a lot, and then go talk to a doctor who's going to say, yep, your body is changing, you're going through puberty, you're making and reacting to various hormones. Your breasts are going to get bigger, your hips are going to get rounder, you're going to start having periods. And that kid is going to say, wait, what? No, I want the beard one, not the breast one. And his doctor isn't going to say, well, that's not possible. His doctor is going to say, that's illegal here. I don't know how my story would have gone if that had been my experience. It definitely would not have continued with, I joined the high school swim team, and that's what got me through high school. I hope my story would still have ended with life is pretty good, or at least, I don't know, my story hasn't ended yet, but it would have been a much more traumatic experience along the way. Don't subject our kids to that. Let kids and parents and medical professionals make their own choices about their own bodies. Please vote ITL. And I would be happy not to share my family's personal experiences, but in general, the experience that I've had as the parent of a trans kid and some of the research we've done into options, if you would like.
Okay, thank you.
Thanks.
Any questions? Seeing none, thank you. We're not going to take a formal lunch break, but members of the committee can go to lunch at their leisure. We still have quite a few people left to testify on HB 377, and obviously at 1 o'clock, well, probably not at 1 o'clock, but this afternoon we have another bill to consider also. So there won't be a formal lunch break, but again, anyone who wants to go to lunch, please go as you wish. Also signed up to speak is Nancy Biederman.
Good afternoon.
It is afternoon.
Nancy Biederman. I'm reading testimony from a friend of mine, Danielle. Danielle holds a degree in social work and spent years as a mental health professional before walking away when treatment turned into a billing game driven by profit over care. She once dreamed of running a therapeutic farm for kids to give them purpose and self-esteem through hands-on work in agricultural setting. But she left that vision in the field behind as she watched the focus shift to money. Never in mental health history has treatment been built on a lie. Every approach from therapy to meds has aimed at helping patients face reality, childhood trauma or adult delusions, until we started lying to kids. She's not debating appearances. I'm not saying biology doesn't bend, but no one can change their sex, and prescribing anything under that pretense is unethical. Worse, it demands society to buy the lie, too. A 15-year study from the University of Groninger, published in the Archives of Sexual Behavior in 2024, tracked 2,772 kids from 11 to mid-20s. At the start, 11% felt gender discontent. By 25, only 4% did. Up to 83% moved past it naturally and without reality-based care. Brains don't fully develop until 25, so we've always leaned on minimal interventions for minors. That changed in 2013 with DSM-5 update, which retooled gender identity disorder from DSM-4 to providers to treat distressed, flipping care from reality to deception. It unleashed a $500 million industry. Pre-2013, puberty blockers for gender dysphoria barely registered in the U.S., maybe 200 kids top, pieced together from early clinics like Boston and San Francisco. Now nearly 5,000 U.S. kids started them between 2017 and 2021 alone, a surge tracked by insurance claims with numbers still climbing. Look at Lupron, approved in 1989 for prostate cancer. It's a hormone suppressor so strong it'll cause chemical castration. In 1999, Prison Journal studies showed it curbed pedophilia's urges with therapy. The ACLU backed it as a voluntary option for offenders, but flags it as dangerous as it's forced or permanent. We're handing it to kids to stall puberty, and the damage is clear. A 2015 clinical endocrinology study found lower bone density in treated kids, osteoporosis risk by their 20s. Women who took it reported brittle bones, joint pain, depression, seizures, lifelong scars. The FDA's 2022 warning cites brain swelling, but long-term bone effects still unknown, not enough studies. Cross-sex hormones hit harder.
You're down to 15 seconds.
She goes, I'll leave this for you. But again, this is a $1,500 million industry. Let them wait till they're 18 to weigh the stakes, and hopefully till 25 until their brain forms. Enough is enough. Stop this medical abuse.
Okay, thank you. Any questions? Representative Weber.
Thank you, and thank you for taking my question. So do you believe that all the people who testified here today that treatment helped them are wrong?
I'm not going to speak for them. And I don't think children should be taking these drugs. You cannot change your gender. You cannot change your biological sex, and you're being lied to.
Any other questions? Oh, Representative Miller.
The other side.
Too close, you couldn't see me. Thank you, Mr. Chairman. Thank you for taking my question. You brought up the financial side of this, implying that this is a money grab rather than actually providing health. And I'm curious, do you feel the same way about other drugs that have been developed and possibly used off label, such as Ozempic, which was developed for type 2 diabetes, or Viagra, which certainly has generated plenty of money for Pfizer over the years?
Pharmaceutical companies are in it to make money. And if they can provide or think they can provide some kind of benefit without thinking about all the side effects. I mean, all the people that are taking Ozempic that are not type 2 diabetics and are taking as a weight loss, they are suffering severe consequences and side effects to it. And so just because we can doesn't mean we should.
Following up on that, is your claim here that these side effects are not properly disclosed, not properly understood, or just being ignored?
I think people want a quick fix, and their quick fix is, here, let me take this pill, let me take this injection, and all of my problems are going to be solved. And that's not true.
One more follow-up?
One more
if I may, sorry. Given the duration described by all of the other people who have testified here saying that none of this was quick, you still believe that this is actually a quick fix, not a multi-year thing that is actually necessary for these people?
Not when I've heard stories of people going into Planned Parenthood or other facilities, and within 30 minutes of talking to someone, they're given a hormone drug.
Thank you.
No.
Other questions? Yes, Representative.
Thank you for, Mr. Chair, thank you for taking my question. On another thought, if my child is born deaf, I shouldn't give them a cochlear implant?
That's not the same thing. I'm not sure how you're equating that.
I think I guess I think it is, but if my child is, I know a child who has chromosomal issues, like the Turner syndrome, boy that spoke, and they had to choose their child's gender. So will this bill stop them from being able to do that?
I don't think that this bill is prohibiting those types of medical. It's geared towards doctors doing this gender affirming whatever care that they think it is. I don't think it is stopping someone that has a genetic abnormality and mutation from getting the treatment that has been standard care for years.
Other questions? Seeing none. Okay, thank you.
Okay.
I am told that Anne Marie Banfield has returned.
Yes, I have. Thank you for taking my testimony. And my name is Anne Marie Banfield. I'm a parental rights advocate in New Hampshire. I've been doing this for over 20 years. And I'm a parental rights advocate, but I don't advocate when something's going to hurt a child. I draw the line in the sand. And so on this particular bill, the first thing I did is I called a nurse, a pediatric nurse, and I said, what are some of the side effects? What are some of the things that can happen if you're put on these puberty blockers? Blood clots, infertility, cancer, depression, testosterone rage. She reported that girl put on testosterone to transition to a boy, destroyed a medical room. They were in the hospital, destroyed the medical room, and they attributed it to the testosterone. And earlier we heard about anorexic. If you're anorexic, do you give medication to an anorexic? Of course not. So there are limits that are placed on people all the time. If anybody here has high blood pressure, you're not going to be approved to donate an extra part in your body, a kidney. You can't. Mass General will not take you as a kidney donor for somebody you can save somebody's life, because somewhere down the road that could become a problem. So they're looking out for your best interest. This happens all the time. This is children. These are children who do not have the capacity to think long term. Once they become adult, there's nothing in this that prohibits them from taking this medication. They can wear different clothing. They can use different names. They can use different pronouns. Nobody's stopping them. But when you're talking about a child who does not have the capacity to make these decisions of lifelong harm, then yes, we can protect that child. We do it all the time. And we even protect children from their parents sometimes when they're doing something harmful. You cannot sell your kidney. The federal law will not allow you to sell your kidney, an extra part that you don't need. I can tell you, I've got a third kidney in here. I've got somebody who donated a kidney to me, so I know all about it. You can't sell it. So this body autonomy thing is not necessarily true in many cases. As I said, I'm a parental rights advocate, and one of the first calls I got on transitioning, which was years ago, was from a mother who adopted a 3 or 4-year-old twins, and that 3-year-old had grown into a 16-year-old. She had been physically and brutally abused as a young child. So she had adopted these 2 children. The girl, when she was 16, had started dressing as a boy, things like this. And it wasn't because she thought she was a boy. It was because she didn't want that male attention. And so she was seeing somebody, she was seeing a therapist, and they were working through that. And they were working through those things. And I can remember the person that called me is, if they had gone in that direction, permanent damage could have happened to her, but she was just simply trying to keep male attention off of her.
Thank you for your testimony. Any questions? Not seeing any. Thank you.
Thank you.
Also signed up to speak is Rockwell Cornell. Is Rockwell Cornell here? Oh, okay.
Hi, my name is Rockwell Cornell, and I oppose this bill because it does not protect anyone and will significantly increase harm to vulnerable children throughout the state. There are far greater risks to the safety and well-being of the children in this country, but today we are focusing on deciding if transgender children get to have medical treatment needed to accept their bodies as their own. Deciding if puberty blockers and hormones are needed for a child is a serious decision that should not be made lightly. But most importantly, this isn't a decision that should be made by the government. This is a decision that should be made by parents who listen carefully to their children and their doctors. Restricting puberty blockers and hormones from trans kids won't change who they are. It only makes it 72% more likely that they die before they reach adulthood. This bill poses children as political pawns to distract from the greater issues of independent freedoms at risk in this country. I oppose this bill because I want kids to stay alive, and I think all children, including trans children, should be given the resources they need to make it safely to adulthood.
Thank you. Any questions? Seeing none, thank you.
Thank you.
Also signed up to speak is Shannon Carey.
You said it right the first time. Most people don't get it right the way it's
Well,
spelled.
I had a little help.
So I hate public speaking, so I'm going to read because I'm not good at that. So I'm speaking today in support of HB 377. I was diagnosed with bipolar disorder when I was 18. I've spent 22 years living with mental illness and working to help erase the stigma and working hard to build a life that's fulfilling, meaningful, but also based in reality. Spending 2 decades deep in the mental health space, I can tell you that there are no other mental health conditions where we allow the patient to dictate the standard of care. Gender dysphoria, whether people like it or not, is a mental health condition and should be treated as such. I think back to the few times in my life I have been suicidal. What would have happened if I had gone into my doctor's office and said, I no longer want to live, this is my truth, I know my mind better than you, and this is the answer. And then said doctor gave me a prescription for lethal doses of medication. If my doctor allowed me to dictate my treatment plan. I know many people have come down on state reps saying they have no business legislating standards of care. But I would ask those people to realize this is something that's happened for decades and for good reason. Having been hospitalized, I am unable to purchase a firearm. Now, is that because you legislators think I'm cuckoo for Cocoa Puffs? Or is it because you understand that someone with my history of mental illness sometimes needs to be protected from the deception and the delusion that bipolar disorder creates in my mind? I personally believe it's the latter. Before 2014, the standard protocol for gender dysphoria was watchful waiting. And in over 60 to 80% of the cases, once puberty was established, and these kids were able to explore who they were through therapy and other means, the gender dysphoria resolved on its own. In the state of New Hampshire, we don't allow children to get tattoos, buy cigarettes, or alcohol. We have these laws because the adults know that children ultimately cannot process or fully comprehend the consequences of their actions. We have these laws in place to protect children. And HB 377, in my opinion, falls in line with New Hampshire's strong history on erring on the side of caution when it comes to the protection of children. With the findings of the CAS report and the WPATH files, every other country has paused this standard of care, and we have the medical evidence to back up the plethora of reasons that we need to be following suit. I would ask you to vote ought to pass on this bill so that we can follow the science and help protect these children. Thank you.
Thank you. Any questions? Seeing none, thank you. Also signed up to speak is Naomi Lovemore.
Hi, so I came back. My name is Donna Peterson. I had a brief appointment. I had to step out and come right back.
Okay, well, I've called Naomi up, Naomi at Lovemore. You can speak next.
No, after.
No, after. Yeah.
Folks only got one copy. If you in the record. Lovemore, that's these two are that. Someone else wants to speak. If you don't mind.
Hi there. Thank you for giving me the opportunity to speak today. My name is Naomi Lovemore. I'm a resident of Dover, New Hampshire, and I'm here to testify against HB 377. The Vulnerable Child Compassion and Protection Act offers neither compassion nor protection, and the name itself is derived from an inflammatory choice of words meant to create a false sense of danger when no threat exists. The title of the bill attempts to emotionally manipulate a valid precinct of thought when the only real precinct for this bill is intolerance and bigotry. Gender dysphoria, if identified and treated early, can only improve quality of life. Parents and families should have the option of pursuing hormonal treatments because that outcome can only and will always be reached by having a healthy dialogue with their children and acknowledging their feelings and experience, the sort of dynamic that should exist in every healthy household. Healthcare providers should be able to have the freedom to engage in conversation and educate families deciding to pursue this, and administer treatment if the family consents to it. It is a private, personal matter, and this litigation withholds access to life-saving care and fosters an environment of fear and misunderstanding. Healthcare providers are not prescribing this in a predatory fashion, and no danger exists in that regard. This should be a family decision with the power vested in them and not the state. Postponing puberty to address and discuss dysphoria does not cause harm and is reversible by ceasing the medication. Furthermore, being able to address those symptoms early through gender-affirming care changes lives for the better. The prevalence of suicide and self-harm, so often used to discredit people who are transgender, and the treatments they undertake only exists because of the ignorant and hurtful acts of others. Their learned intolerance stemming from pathologically maladaptive ideas of what normal should be. This litigation limits common access and knowledge about gender care and will propagate harassment because of this. Personally, I'm concerned this bill is primarily a stepping stone to try and block the same treatments in gender-affirming care for adults. It seeks to chisel a small foothold of constraint against transgender rights to use in the future to introduce laws targeting everyone for the purpose of banning hormonal replacement therapy. This bill only serves to answer problems that do not exist and to be intimidating. Please vote no on HB 377. It helps nothing.
Thank you. Any questions? Representative Kesselring.
So, thank you, Mr. Chair, and thank you for taking my question. If there were studies to prove that children are being harmed or there's possible long-term effects, would you change your stance and say that we should pass a bill that would stop these procedures from going forward?
Thank you for the question. I think that was still the decision would still have to lie with the medical professional administering the treatment and the family. All treatments and all medications come with side effects, and it would be a matter of weighing what those negatives versus positives would be based off how severe they would be, if that hypothetically were to happen.
Other questions? Seeing none. Thank you.
Thank you.
Okay, and also signed up to speak is Donna Peterson.
Thank you very much, Chair, Vice Chair, members of the committee, for allowing me to speak. I'm coming because I'm going to ask you to vote ought to pass on HB 377. I firmly believe it is for the protection of children. I have personally known young women who have transgendered as teenagers and have regretted it and have then gone on to detransition. And it is not true that the hormone blockers and the puberty blockers and the hormones do not have any long-lasting effect. They will attest to that. They will have to shave their face for the rest of their life. Their voice is deeper. And I know at least one of them is deeply distressed by the fact that if she ever decides to marry and wants to have children, she'll never be able to breastfeed her children. Children under the age of 18, young people do not have an adult brain. They cannot make and should not be expected to make life-altering decisions over their bodies that can never be reversed. These treatments sterilize children, and if they decide later on in life that they want to have a family, they will be prohibited from being able to do so. So you have a child, you have a 6-year-old child, a young boy, for example. You know, one day they want to be Batman. 2 days later, they want to be a girl. 5 years from now, they wish they didn't transgender and they wish they was still a boy. They need to be, I have friends who are transgender. I have relatives who are transgender and I love them dearly, but they had the benefit of making these decisions as adults with the ability, the cognitive thinking skills to look at all the issues and look at all the potential long-term consequences. And I think every person in the state of New Hampshire deserves the right to make a decision that they're capable of making. Just as has been said before, you can't, buy cigarettes if you're under 18. You can't buy alcohol. You can't get your ears pierced without a parent's permission. You can't get a tattoo. So why are we having them make life-altering permanent changes to their bodies that they might regret later? Granted, not all of them regret it, but they should be making these decisions as adults when they're 18. So this is my testimony, and I thank you very much for your consideration.
Thank you. Any questions? Seeing none. Thank you.
Okay, thank you.
Also signed up to speak is Jocelyn Seeger.
All right. Hello, my name is Jocelyn Seeger, lifelong straight cisgender New Hampshire resident. My connection to trans youth and their rights lie in the over 20 years I've spent working with New Hampshire youth through drug and alcohol misuse prevention. Representative Mazur, I watched your segment on Concord Conversations, and I wish I could say that I could accept what you said at face value, that I could believe that you introduced this bill with no hate or discrimination.
You're addressing the committee, ma'am, not just one individual.
Oh, my apologies. I can withdraw that.
Okay.
All right. You may actually believe that anyone who introduced this bill can believe that they have nothing against trans people, but that's all this bill is. If we actually thought that puberty blockers were dangerous, this would be a hearing about whether or not puberty blockers should be legal for all youth under 18 years old. It is not. This bill specifically outlines that this intervention should be denied specifically for youth seeking care for gender affirmation. I'm not hard-headed. I'm open to new and developing science and information. So far, I have yet to hear anything compelling enough to agree that a bill outlawing puberty blockers altogether should be pushed through. If these medications are as dangerous as you are implying, come back with a bill that supposedly protects all youth from these medications. And if you want to make these medications less necessary, may I recommend ceasing to use trans youth as political pawns of division. If you truly love all people, I implore you to do some self-reflection. How do you advocate for the protection, safety, and acceptance of trans youth, especially non-binary youth? Because take it from someone with decades of experience sharing community with both teens and adults who are trans and non-binary. Nothing is more destructive than watching people and politicians argue about your identity as if you know nothing of your own lived experience or that you have no understanding of yourself. When ignorant politicians and antagonists claim their pronouns are USA and kiss my ass, do you push back on their egregious misunderstanding of the English language or point out how offensive they're being to the valid expressions of gender that fall outside of our traditional understanding? Outside of outlawing these medications that help buy time for youth to explore and realize their identity, what else do you do to help these folks you claim to care so much about? One of the biggest causes of suicidal ideation and using drugs and alcohol as a coping mechanism come from isolation from the society and community you're surrounded by. Every time one of you introduces a bill targeting the trans identity, you validate those who look to dismiss, ridicule, and isolate youth, and adults for that matter, who don't conform or find
You have
comfort
15 seconds, please wrap up.
in the gender they were assigned at birth. I'm not here to say puberty blockers are for everyone figuring out their gender identity. I'm here to say that puberty blockers may be for some youth in some circumstances, and that's enough reason for me to oppose the passing of this bill.
Thank you. Any questions? Seeing none, thank you. Also signed up to speak is Kimberly Allen from Moms for Liberty. You've asked for 5 minutes. Again, please keep it to 3.
Thank you to the committee. My name is Kimberly Allen. I am the chairman of Moms for Liberty, Hillsborough County. I am here today in favor of House Bill 377. The urgent need to safeguard adolescents from puberty blockers and hormones. The rapid increase in the administration of puberty blockers and hormones to adolescents has raised significant concerns among parents. As responsible adults and caregivers, we must prioritize the well-being and safety of our children by taking a cautious approach to these powerful and potentially life-altering medical interventions. Several key factors underscore the urgency of protecting our children from puberty blockers and hormones. The long-term effect of puberty blockers and hormone treatments on adolescents' physical, mental, and emotional development. are still not fully understood. These treatments can lead to irreversible changes, including being sterile and loss of sexual function, which may cause distress and later regret in life. Puberty is a crucial phase of growth during which children experience significant physical and psychological changes. By interfering with this natural process, we risk disrupting essential development milestones and impeding the formation of a healthy self-identity. The complexity of the risks and consequences associated with puberty blockers and hormone treatments can be difficult for adolescents to fully comprehend. This raises questions about their ability to provide informed consent and increases the likelihood of regret or negative outcomes. Many adolescents experiencing gender dysphoria may be struggling with occurring mental health challenges. It is crucial to address these underlying issues before considering invasive, irreversible treatments, ensuring that we are promoting long-term psychological well-being. That being said, I don't think there's a person in this room who is that doesn't possess compassion for these children. I think there's some sense that we all want what is best for these kids. It is our job as adults to protect our children. Our children cannot give consent for medical procedures. Why would we go ahead and give that consent for them? Thank you.
Thank you. Any questions? Seeing none, thank you.
Thank you.
Also signed up to speak is Sarah Smith.
Good afternoon, members. Thank you for taking my testimony. My name is Sarah Smith. I live in Pembroke, New Hampshire. And have been a New Hampshire resident for well over 40 years. I want to talk about the medical interventions that we're talking about, and some people brought up the CAS report, and also the fact that it's been debunked a lot. So I was looking up some things, and I came across a report from France that was their medical team and what they thought would be appropriate treatments. And it did debunk a lot of the CAS report. But to tell you the truth, when I read through that report, I couldn't really understand it because there were medical terms in there that I didn't know about. And even if I got a definition of those terms, I didn't have the background in medicine to really understand. So this is why I think that the medical experts who have given testimony should be the ones who are making these kind of decisions. I think that when a parent brings their child to a medical professional and they have a discussion, that should be respected. I don't think that a political should be making these decisions. This is a fundamental disagreement with this whole process and why I oppose this. And I've heard a lot of testimony, very interesting, which I frankly disagree with. At one point, people have kept talking about how this is irreversible. I know a lot of trans people. I know a trans non-binary person who has gone back and forth, you might say. She's taken male hormones. Then they decided to have children. They have 2 lovely children now. So the idea that things are irreversible is not actually true. And in other aspects of this, I know someone who came out to their parents that they were transgender, and their mother, who happened to be an OBGYN, simply said, well, this person was male. Well, I think you should bank your sperm. in case you want to have your biological children later.
You have
That
15
was it.
You have 15 seconds.
Thank you very much. That's my main point. Let's listen to the doctors.
Thank you. Any questions? Representative Kesselring.
Just have a quick one. Thank you, Mr. Chair. And when it comes to the other states that have passed laws, I believe it's around 26 that have passed different types of laws, and all the other countries.
I'm sorry, I'm hard of hearing. I can't hear what you're saying. Could you speak louder?
Yes, I can.
Trying to get this.
So the other, believe it's 26 states that have passed laws to block puberty blockers and things like that, including the other countries. Have you done any research on what their findings were? Because you said you disagree with a lot of what was said today.
Yes, I think this is basically a political climate that we're in, and these are political decisions that are targeting a small minority of people as somebody that they can control, and then that control then it starts to extend to the rest of us. That's what I think is what is happening here, and it's people. And I do think there's prejudice. I think people in their mind have been brought up to fear people who are different. And then that makes them want to say, I've got to eliminate them. They're scared of them.
Follow up.
So the question specifically would be, have you researched any of their findings?
Have I well, I'm not a medical doctor, so I can't research that. But there are medical doctors who will answer those questions, and so I will defer to them. And I hope you ask that when a medical doctor stands up here, please ask that question, because it's a very important question.
Yeah. Thank you. Another follow-up? Okay. Anyone else? Any other questions? Okay, thank you. Also signed up to speak is Patricia Hughes. I believe it's Patricia Hughes. Did they have to leave? I'll put it aside for now. Also signed up to speak is Brianna Hankel from New Futures.
Good afternoon, members of the committee. My name is Emma Savini. I'm from New Futures. Brianna was initially covering for me, but luckily I made it in time. So,
did you fill out a pink card?
I didn't, but I can.
Yeah, but after you get done, please fill one out.
Absolutely. And I just want to thank you for hearing my testimony today. New Futures is a nonpartisan, nonprofit organization that supports change through policy change. Or supports health through policy change. Sorry. New Future is here in strong opposition to House Bill 377 because it attacks a minor's ability to feel supported by their families and communities, and it is governmental overreach that will limit transgender youth and their families' ability to seek necessary care. Trans youth face higher rates of discrimination in bills like this and in their daily lives and communities. That feeling of rejection contributes to higher rates of anxiety, depression, and poor mental health outcomes. They are not inherently more subject to poor mental health outcomes. It's because of instances of discrimination. Prohibiting gender-affirming care such as this eliminates the privacy rights of those minors and their families to choose the most effective level of care for their needs. These feelings of rejection and lack of privacy are also contributors to poor mental health outcomes. This goes against recommendations from the American Academy of Pediatrics, the American Medical Association, and other major bodies of medical professionals. Early intervention and treatment using gender-affirming approaches may alleviate some of the mental health consequences that are associated with these feelings of rejection and discrimination. And so for those reasons, New Futures asks the committee to ITL House Bill 377. Happy to take any questions.
Thank you. Any questions? Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. I want to pose the same question in a different way that I just asked the last time. There's approximately 26 states and several countries that have banned the use of puberty blockers in minors. Do you agree that they are on the wrong side of this issue, or are they completely making laws and rules that are not right for the country?
I haven't had the chance to review those laws, so I can't say whether or not they are right or wrong, but I can say that discriminatory laws that prohibit medical care for or necessary medical care for individuals who face discrimination and have been shown to increase poor mental health outcomes are not an appropriate use of time.
Follow up.
Thank you. As a follow-up, you said necessary care. Could you define how this would be necessary care for a minor?
I think that is between a minor, a family, and their provider, what is necessary and what isn't.
Other questions? Seeing none, thank you.
Thank you.
Also signed up to speak is Heidi Carrington Heath, New Hampshire outright.
Honorable members of the committee, thank you for hearing our testimony today. I'm Heidi Carrington Heath, and I serve as the Executive Director of New Hampshire Outright. We are New Hampshire's oldest LGBTQ+ organization, and our work focuses on serving, supporting, and advocating for LGBTQ+ youth and their families. We're here today to ask you to vote ITL on HB 377. We are deeply concerned about the loss of access to evidence-based best practice medicine for the young people we serve. This is proven care that has allowed transgender young people to thrive and to succeed. One of the best ways to protect health and well-being for trans young people is to ensure that they can continue to access essential, age-appropriate, rigorously vetted medical care from licensed clinicians who are practicing according to well-established standards of care, and this is done in close collaboration with their parents. Banning this medically necessary care puts transgender youth at increased risk of serious harm, including depression, self-harm, suicidal thoughts or behavior, and more. When trans youth, like all youth, receive the medical care they need, they are able to thrive and have access to a happy, healthy childhood that sets them up to go on for success. Our outright young people have grown up to go to medical school, serve in the military, serve our communities, and more, in part because of access to this kind of care. It can be hard to understand what it is like for parents and families to have a transgender child. Our parents and caregivers, like all parents and caregivers, want their children to have access to the best possible medical and health care and the spaces and places that their children need to thrive. They want their children to grow up into healthy and well-supported adults. When I sit in a room with our parents and caregivers right now, I can feel their fear that these life-saving, well-vetted supports for their children will be lost. No parent or caregiver should have to fear losing their child due to a loss of appropriate health care. We appreciate that you might have questions. We encourage you to ask for clarity from the medical experts that you will hear from today and via email. If a conversation with one of our parents or caregivers would be helpful, we're happy to connect you. Please join us in the work of supporting this vulnerable population of Granite Staters and vote ITL on HB 377. Thank you.
Thank you. Are you taking questions, or I don't know if
I'm
we
happy
have
to take
any,
questions if there are any.
but any questions? Yeah, I guess. Oh, Representative DeLamus.
Thank you, Mr. Chairman. Just, I know you had said age appropriate. Do you have a definition of what you feel is age appropriate?
I'm not a medical professional, so I'll defer that question to those folks.
Okay, thank you.
Thank you.
Other questions? Seeing none,
Thank you very much.
Also signed up to speak is Stephen Scare.
Good afternoon, Chairman and distinguished committee members. I'm speaking in favor of this bill. The state already interferes with medical care with its conversion therapy ban, which makes it a crime for a therapist to question a gender identity, even though gender identities are entirely imaginary. Also, medical decisions that are made out of coercion with suicide threats aren't informed decisions, and parents are emotionally blackmailed. Any of you could check this quickly. The 1% regret rate doesn't even measure regret. The main feeder into this group of studies measures regret or detransition as someone who went ahead and went on the hormones of the opposite sex, then reapplied to be the other sex and went ahead and changes their name. I know a lot of detransitioners, but not one would qualify under these conditions. And even by those standards, we don't know the regret rates because the dropout rates was about 30%. The follow-up rates were as short as less than 1 year for these studies. And some of them have nothing to do with actual regret. Like one was a choice of surgeries. And did you regret your choice of surgeries? Also, these were done on adults who were heavily vetted, not under the affirmation. And it has nothing to do with this puberty blocker cross-sex hormones protocol that we have now. And the goal of healthcare isn't lack of regret, it's health. And right now what we're seeing on social media is media influencers identify as the opposite sex who are letting clinicians torture them to death without ever expressing regret. These don't measure health. As far as asking for the data, no one's been keeping it. In 2009, when the GEMS clinic in Boston started this, letting kids say, I've got this gender identity and let's affirm with puberty blockers and hormones, right away they should have been enrolled in clinical studies. They aren't. Dartmouth Health is a clinical hospital. Why aren't they showing you their data? So we have absolutely nothing. WPATH started, who regulates this or sets the standards, started a systematic study. They didn't like the results. So they told Johns Hopkins, who's conducting it, don't release these results at all. More recently, researcher Olson Kennedy took $10 million from the federal government, and then after she looked at her results, decided they would be weaponized in situations like this and refused to release them. So what we have are the European studies, not only the CAS review, but also from Finland and Sweden, and we know the drill. If it doesn't support this ideology, then of course someone puts something on paper saying they're discredited. The suicide stats people quote, by the way, are meaningless. Suicide ideation.
So you have 15 seconds.
Suicide ideation is very common among teens. 30% of all high school girls seriously contemplated suicide in the last year. So thank you.
Thank you. Any questions, Representative Kesselring?
Thank you, Mr. Chair. I have a question. I'm reading testimony of a previous person that spoke, and it says, in 2024, 46% of all transgender and non-binary youth seriously considered attempting suicide. As you said, the statistics are not really taken well or not given information. They don't really cite the statistics here. So what would you say about that?
My guess is that's the Trevor Project statistics. The Trevor Project is, like the transgender survey, they solicit these online through social media from young people. And what we have for all high school students is the CDC's Youth Risk Survey. And what that tells us is that about 30%, as I said, of all teens, of all high school girls seriously contemplate suicide. 12% of all high school girls will report they attempted suicide in the previous years. The good news is if you look at the CDC's suicide completion rate, it's only 0.014%. People that have actually studied the suicide rate for transgender youth find it again to be extremely rare. And if someone mentioned that people at Tavistock dying while they were waiting for care, people studied the youth at the Tavistock, whether they're waiting or not. Out of 15,000 people, 4 people died of suicide. And what they concluded is that people are dying of suicide not because they're transgender, but because of the coexisting conditions that lead to their confusion about their gender, especially autism and PTSD.
Other questions? I'm seeing none. Thank you. Also signed up to speak is Chris Urkel from Glad Law, I guess.
Thank you, Chairman, members of the committee. My name is Chris Urchel. I'm a New Hampshire licensed attorney. I have a lot of experience litigating about barriers to access to healthcare for transgender people. I was on the litigation team that challenged Florida's ban on medical care for transgender adolescents, and I'm here on behalf of GLBTQ legal advocates and defenders, also known as GLAD Law. Denying people access to medical care that they need is unconscionable, but it's also unconstitutional. And I'm just going to tell you 3 reasons why the bill that you're considering today is unconstitutional. Number 1, it singles out transgender people for different treatment. Number 2, it deprives parents of their fundamental right to consult with medical experts and make decisions about their children's health care. Number 3, it targets the speech of not only healthcare providers, but everyone else by criminalizing the mere suggestion that an adolescent with gender dysphoria might need medical treatment. As you probably know, the Supreme Court is currently considering a constitutional challenge to Tennessee's ban on medical care for transgender adolescents, and I'll admit that I don't know what the outcome of that case will be. Nobody does. But what you may not know is that this bill will be challenged regardless, and it'll be depending on the outcome of that case in the Supreme Court, it could be challenged on a different basis. It is never ever a legitimate or compelling government interest to stop people from living as a different sex, and that's really what's motivating this bill, to stop people from living as a different sex. And how do I know that that's what's the real motivation here? It's because there are other bills that could be introduced that would address some of the justifications that people are raising here, including concerns about access to quality care for young people. For several decades, the Supreme Court has been clear that discrimination on the basis of sex is anathema to our Constitution. Yet this legislation does exactly that. The basis for denying medication to an individual under this bill is that individual's sex, whether you define it based on their birth sex or based on the sex in which they live. The Supreme Court has also said that it's impossible to discriminate against a person for being transgender without also discriminating against them based on sex. That is why this bill is a violation of every transgender person's right to equal protection of the laws. The parental rights, the right to direct the upbringing of your children is enshrined in the 14th Amendment and is deeply rooted in this nation's constitutional history. And this bill clearly takes away parents' rights to make medical decisions on behalf of their children. All right, I'll just leave it at that, and I'll let you know that I'm open to taking any questions that the committee might have.
Thank you. Representative Weber, and then Representative Kesselring.
Thank you so much. I'm wondering if you could elaborate a little bit more. What are the issues with speech, both for medical providers and others that you have concerns about?
Yeah, let's look directly at thank you so much for the question, Representative. Let's look directly at the text of the bill where on line 17 of page 1, it says no person, and of course person is defined as any individual above, no person shall engage in, counsel, make a referral for, or cause any of the following practices to be performed. And then it goes on to list, prescription of puberty blocking medication or prescription of cross-sex hormones. And so that is a pretty broad swath that encompasses, on its face, the language says, the words counsel and make a referral for aren't defined, but on its face, it would appear that having a conversation with somebody who you think, who any individual thinks might need access to medical care would violate the plain terms, and it would be a felony.
Can I have a follow-up? Could that also be construed to prohibit somebody counseling, for example, a parent to have a child do social transitioning, living in the clothing and under the names and pronouns of the other gender, as opposed to something which is actual hormonal changes?
Well, what I will say is that the language is pretty vague and undefined, right? I mean, we don't know what it means to engage in counsel or make a referral for medication that could lead to gender transition, and so I would just say that the text is unclear.
Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. I'm hoping that you being a lawyer and dealing with this can answer a lot of my questions and I can stop asking so many of them. First, you outlined here in this first paragraph, but I want to bring you to paragraph 28 where it breaks in, it basically adds a provision so that certain people don't fall under this category or certain health conditions do not. Would you say removing that or leaving that changes the bill in any way because you're citing issues of constitutionality?
Well, so yeah, I mean that's a really good point, right? So you're making the point that there's an exception to prescribing this kind of medication if it's to treat a disorder of sex development, and a disorder of sex development is defined in a different subsection of the same chapter in the RSAs, and I think I have it here. Let me see if I can find it. It's happens to be in the bill text of a bill that's being considered this afternoon. Anyway, regardless, yes, it makes an exception for certain kinds of care. So it shows that this bill is in fact targeting one class of people, and that class of people is transgender people. And so the very fact that it carves out an exception for people who are not transgender shows that, yes, this is in fact a discriminatory piece of legislation.
Follow
up. So I guess the legal question that I'd ask you, what would the legal clarification of what a gender is? Because that would be your argument here. Is there a legal classification of what a gender is?
I'm not sure that I understand the question,
Is there a
Representative.
differentiation in the legal side for a gender versus male or female?
Oh, your question is there a legal difference between the word sex and the word gender?
Well, just how it's clarified under law.
Okay. Legally, the terms have historically been considered interchangeable in court decisions and other places, and the way that they've been used in statutes has been inconsistent. So there's not really a clear answer to the question of what the difference between gender and sex is.
Okay. One last question.
One last
Promise. Okay, so comparing this to the Florida law that you said you spoke against, how is this, where current bill is, differ from that?
That's a really good question. I mean, the differences are extensive, right? I mean, we could talk about the differences between the plain text of the bills, but I don't think that's really significant because they block the same essential set of medications. I mean, one difference in the Florida bill the Florida law is that it included a grandfather provision that allowed people to continue care. This bill does not have such a provision. Another issue with the legislation in Florida was that it also impeded access to medical care for transgender adults in some respects, which this bill does not. But there are many other differences as well. They're just and the legislative history behind the two bills is completely different, and so it's comparable in that it's also a piece of legislation that singles out a class of people to deny them access to medical care that they need solely because of a characteristic that's protected under the Constitution.
Other questions? Representative Weber and then Representative DeLamus.
Thank you. Thank you for taking another question from me that arrives out of your answer to an earlier one. So on line 28 and 29, it says paragraph 1 of the section shall not apply to a procedure undertaken to treat a minor born with a medically verifiable disorder of sex development as defined in RSA 332 M2, (2). So am I right in thinking that if that section does not manage to completely capture every possible verifiable disorder of sex development, that the people who don't fall under that definition would also be forbidden treatment even though they have a verifiable disorder?
Thank you for the question. For sure, I would be concerned about access to care for people who have disorders of sexual development that aren't enumerated in the other statute that's referenced in here.
Thank you.
How's that?
One more.
okay.
If you know, because this may not be your bailiwick, do you have any indication from other jurisdictions that have proposed bans that pediatric endocrinologists are not necessarily as willing to practice there? Is there any kind of information on that? If there isn't, that's fine.
I'll answer that by explaining that many pediatric endocrinologists have had to close their practices and leave states where they were previously providing care because of laws that prohibit them from prescribing medication to transgender adolescents.
Representative Bidlamus.
Thank you, Mr. Chairman. As I read this, intended new chapter prohibiting medical procedures and treatments intended to alter a minor's gender, and you had said that it was all about sex. I'm just thinking that your sex meaning male, female, whatever. But isn't it really more about age? This bill is, I believe, isn't it supposed to be addressing age?
Thank you for the question, Representative. I'll just bring up a Supreme Court case from the 1950s, Brown versus Board of Education, which was about segregation of school children based on race. And of course, the people who were being segregated were all children, yet the Supreme Court looked at their race as the cause for the discrimination. In this case, it is the sex of the children that is the cause for the constitutional infirmity that I'm talking about here today.
Thank you.
Any other questions? Okay. All right, I'm seeing none. Thank you.
Thank you to the committee.
Thank you. Next up is Mackenzie, and I believe it's W-E-H-T. Not going to try to pronounce it. How do you pronounce that?
West.
Oh, West. Oh, that's an S. Okay, I'm sorry. I have bad handwriting. I should be able to read it better. So.
To the members of the committee, my name is Mackenzie West, and I am here to testify in opposition against HB 377. Ignoring the simple and reductive definition of sex and the rudimentary understanding of biology that is put forth in this bill to make the definition that it does, and ignoring the fact that medical consensus is overwhelmingly in support of gender-affirming care for minors, from the American Psychological Association to the American Academy of Pediatrics and the World Professional Association for Transgender Health. We know that treatment is safe and effective in lowering rates of suicide and depression while providing better outcomes for trans youth. But what message does this send to the people of New Hampshire and beyond? It tells families that they are not welcome here, that trans children will not be able to find care in this state, and that families looking to flee these laws elsewhere in this country, that they should keep looking, because this is not a state for them. I was recently doubting my future as a trans woman in the state when testifying against HB 148, and as the daughter of a trans woman, when I think about starting a family of my own, bills like HB 377 further my doubt that this state is worth staying in. If I am to have children and start a family, what would I tell them? That you can be who you are and you can be anything, just maybe not here. It leaves me sad in seeing how the state I've long wanted to call home may be closing the door to bright futures for already marginalized people like me and the families that thrive with resilience and hope through the attacks of the state. Live free or die is the motto of the state, but now, is this not increasingly an illusion when we put the state in decisions that should be between families and medical professionals dedicated to doing the right thing?
Thank you. Any questions? No? Good. All right. I see no questions. Thank you. Also signed up to speak is Doug Pounds. You've written 4 minutes. I would remind you, please keep it to 3.
Yeah, thank you. Thank you, Mr. Chair, and thank you, committee. Appreciate being able to do this. First, I'm going to be candid. I think surgery and hormones to people, minors, is child abuse, in my opinion. I have a friend who has lifelong damage from hormone treatment. He had surgery and hormone treatments. He had suffered childhood trauma that led him down this path. When he got correct psychological counseling, the gender issues just fell away. Now, he tried to commit suicide twice. He kind of jokes about it. He said, you know, I almost succeeded the second time, like he was proud of it. And he was told me that it wasn't because of the issues, the transgender issues. It's that it didn't, you know, going down the path didn't solve the trauma, and it was the underlying conditions that led him down there, and that's what led him. He's cried on my shoulder as a result of, you know, realizing now that after going through surgery, it cannot be undone. And in hormones, it's well understood that depending on how long and how many and what kind, it will do permanent damage. Also, I've heard the story, you know, parents are told that if you don't allow your child to go down that path, they'll commit suicide. It's, and they say, psychologists are trained to say, would you rather have, let's say, a dead son or a live daughter? And my wife and I have experienced that firsthand. Also, I'd like to note, it's well established from Dr. Ken Zucker that 90% of youth grow out of their gender dysphoria if they're just left alone. So that's a pretty significant number. And I think if they're allowed to or push towards the transition, it can do irreparable harm when they would have been grown out of it. There's a high-profile psychologist, Dr. Keith Ablow, I've talked to, and oftentimes when people are given the cross-sex hormones, it brings them out of the depression, and I think that falsely leads them to believe that they actually may be the opposite sex. And he said that's because they're a steroid, and those will do that, and it's only a temporary effect. And he said, he was kind of candid. He said, I can do the same thing with cocaine. So,
You have 15 seconds, please wrap
yeah,
up.
thank you. Well, I'm just wrapping it up. So anyways, these are some of the things dealt with personally, and from what I understand from a medical perspective. And so I'm in favor of passing this bill to protect our youth. Thank you.
Thank you. Any questions? Representative Miller.
Thank you, Mr. Chair, and thank you for taking my question.
Yes.
You cited Dr. Ablow. Are you aware that his medical practice license has been revoked?
I'm not aware of that, no.
Would you be surprised if I told you it was true?
No, I wouldn't be surprised, but I'm just not aware of it. So I'd take your word on that. But
Thank you.
Yeah, thank you.
Any other questions? Seeing none, thank you. Also signed up to speak is Parker Terrell. Is Parker Terrell here? Parker Terrell?
Thank you, Mr. Chair, and members of the committee for hearing my testimony today. My name is Parker Terrell. I'm a 16-year-old sophomore at Plymouth Regional High School.
Yeah, could you move a little closer to the microphone, please?
Sorry.
I'll move the microphone closer to, yeah.
Oh, okay. Lost my spot. My name is Parker Terrell. I'm 16 years old, a sophomore at Plymouth Regional High School, and a lifelong resident of New Hampshire. Like every other teenager, I worry about school, grades, and what my future will look like after graduation. I work, I spend time with my friends, and I try to navigate the ups and downs of being a teenager in almost every way. I'm just a normal kid, except for one thing. I'm transgender. I've always known that I was different. My family has always supported me no matter what. As I grew older, I realized the truth. I'm transgender, and that's okay. I can live a full, productive, and happy life exactly as I am, just like any other person. But I can only do that if I have access to medically necessary care that allows me to be myself. I believe that much of the fear and misinformation surrounding transgender people, especially transgender youth, comes from the lack of understanding. I would bet that many of the people writing bills like HB 377 have never met or spoken with a transgender person. So let me say this clearly. There is nothing wrong with me. I am not a danger to anyone. I just want to live my life in peace like every other person in this room. I'm here to ask you today, why am I not worthy of the same medical care as any other teenager? My family supports me. My friends support me. My doctors, coaches, and therapists all support me. So why can't my government do the same? Why am I being singled out? Every other teenager in this state is trusted to make medical decisions with their parents and doctors. Why am I treated differently? Why don't I deserve the same level of respect? Can you look me in the eye and tell me that I don't deserve the same rights, the same medical freedom, the same chances at a healthy future as any other citizen of New Hampshire? I exist, I'm here, and I deserve the same rights and freedoms as everyone else. Please vote ITL on HB 377. Help me stay safe, help me stay healthy, and help me live.
Thank you. Any questions? Representative Kesselring.
Thank you, Mr. Chair. Just, I want to be clear, you're actually taking hormone replacement medication?
Yes.
Okay. Follow up.
Follow up.
So were you told the side effects or the potential side effects of what could happen by taking those? Just
Before
correct,
the even thought of taking any kind of hormones, I had to go through years of therapy. They told me every symptom multiple times, many times, time again, after every single consultation. They told me that if I didn't want certain effects to happen, there were ways that they could prevent that and different things I could do to pursue my right to be a girl in this state.
Follow up.
Is there any specific side effects you'd tell me? I'm just curious because I don't know. I've not researched it for myself.
I don't think I could think of any side effects that I'm comfortable with sharing. Yep.
Thank you. Anyone else? Seeing no one. Thank you.
Thank you.
Also signed up to speak is Corinna Cohn. Corey?
Good afternoon. Thank you for having me here. My name is Corey Cohn. At the age of 15, I was diagnosed with what today would be called gender dysphoria, or in a previous generation, gender identity disorder. At age 18, I undertook estrogen hormone replacement therapy, and at the age of 19, I had what is colloquially known as sex reassignment surgery. As a result of these treatments, particularly the surgery, I've never been able to be sexually functional. And nevertheless, immediately after commencing these treatments, I went from being a lonely, isolated boy to a much more confident and outgoing woman, or so I thought. So over the course of the years, one of the things that I realized is that it's impossible to change sex. And unless we understand that as a fundamental truth, that your sex is innate and immutable, and that the only thing that these treatments can do is change your sex characteristics, then we can't even create rational policy. And that's part of what you are here to do. Before I gave my testimony, I engaged with some of the people who have come here with different opinions, and many of them had never even heard of WPATH, which is the organization which sets the guidelines for this. But I wanted to address something very important, because the term medical necessity has been spoken about again and again in this committee. I am a witness in the Alabama lawsuit, which surfaced some of the internal communications from WPATH. Among those communications is a discussion that medical necessity is only for insurance companies to have the justification to cover these procedures under their policies. There is no evidence of medical necessity. I also want to point out a logical fallacy that I've heard a number of times, which is, do we really need this regulation barring evidence that this is a harmful treatment? This is not the standard for medical research. The standard of medical research is, are these treatments helpful? I have heard a number of people from the other opinion come up and present to you outdated evidence and outdated talking points. But every single day we're finding more and more evidence that these treatments are not beneficial
You have 15 seconds left.
to the health or to the mental health. And they're not means to find out who we truly are. The only way to do that is to live your life and experience the world.
Thank you. Any questions? Representative Kesselring?
Thank you, Mr. Chair. So it sounds like you speak with a little bit of regret. Could you maybe give us a little bit of your history and where you got, and if there's any regret you have?
Thank you, Representative. That's such an interesting word to use, regret. It's difficult for me to understand this as regret, because it would be like if you were a child and you had accidentally knocked over a candle and burned down your house. It would be difficult to experience that as regret, even though a tragedy happened because of something that involved your actions. But there are so many, for these children, and as was the case when I was 15 and a teenager, there are so many people, adults in these children's lives, who are providing affirmation, but when all of this is happening to you, even though you may be traumatized by it, even though it may be confusing to sort out, even though it may cause challenges that are unique to the situation, it's difficult to understand something this large and mind-bending as a form of regret. So I regret offending friends. I regret attending law school for a year. It's a lot harder for me to regret this because it's the enormity of it is too much to formulate in that sense.
All set?
All set.
Yes, Representative Drew.
Thank you, Mr. Chairman. How thoroughly did you understand the long-term medical impact? You said you were diagnosed when you were 15, and at 18 you undertook HRT. Did you understand then what you know now about the procedures that you went through?
From my own experience and from listening to the other testimony today, I can tell you I don't think very much has changed in the last 30 years. As you get involved in these communities of affirming individuals, what you will hear 99% of the time are the benefits, and what you hear about 1% of the time are the drawbacks or the damages. And in fact, and I know that this is true today, whenever there are people who express regret or talk about the side effects that are medically harmful to any of these treatments, those individuals are told not to talk about their experiences because it causes anxiety to other people, or they are told not to talk about it because it could threaten their ability to gain access to what they consider to be health care. Because although the information was presented to me, it was not something that I was able to adequately develop informed consent to understand, because I was in a state of basically obsession on my target for transition. So in my opinion, medical providers have a higher duty than to simply present a form to patients or a packet. I think one person said that they received a large packet of information. I don't understand how anybody can take that packet and synthesize it and turn that into an input for their decision. It's too much. And in my opinion, talking with other people who've been through these procedures, doctors do not tend to develop to their own assurance an understanding that the patient that they're treating has received the benefit of informed consent.
Follow up?
Okay. And during this process, where were your parents or caregivers? Were they able to do that?
That is a great question. Although I've seen today, there are very passionate parents that are involved, and I think that there's some great upsides to that. In my case, my parents were not involved, but in either case, one of the things that was part of my experience learning more and more about being trans is to be inculcated with the idea that parents are going to try to stop you or interfere with your abilities to be able to access these types of care. I have seen from forums and talk channels like Discord where young people are coached on what to say to their parents. I've heard stories of parents who receive notes that are coming out notes that are basically matched to online templates that they can use. So it's, in some cases, there may be enough clear communication between the parent and the child that the child knows what's happening. My belief is that particularly the social aspects of this issue cause there to be a lot of division and lack of alignment between children who identify as trans and their parents.
Any other questions? Seeing none, thank you.
Thank you.
Has Courtney Tanner come back? Or is she oh, there she is. That's okay.
Still working on that 2 places in once thing.
If you perfect it, let me know.
Yeah, as a mom, I'm working on it. It's getting better. So for the record, Courtney Tanner, I'm the Senior Director of Government Relations at Dartmouth Health, and we oppose this bill. We have some concerns. We have a lot of concerns about the prohibition of access to care, the implications that this would mean for our providers and their ability to practice care within their license. And you've heard today, I know this hearing was scheduled for 90 minutes and we're well into your lunch hour. So you've heard a lot of testimony today about concerns about access to care. I want to just highlight a couple of those pieces that have not been raised up. To put a finer point on concerns about recruitment and retention of our workforce, we are the largest health system in the state of New Hampshire. We're also the largest provider of psychiatric services here in New Hampshire, including we just now have taken operational control of the Hampstead facility, which is the youth psychiatric facility in the southern state of New Hampshire. And we have concerns about the implications for our patients that are receiving psychiatric and behavioral health services, and also those who are accessing pediatric these are big words, sorry, endocrinology services too. When we think about what a pediatric endocrinologist does, they are not just treating patients who are seeking gender affirming care. They may be treating patients who have adrenal disorders, diabetes, calcium metabolism, other genetic syndromes. And so when we as an institution have to recruit and retain specialty providers, it's not just for providers that are going to provide gender affirming care, but we need to make sure we're providing services for our young patients across the state that need access to other services like diabetes care. I do have some questions about the bill as drafted. There is an effective date of January, I believe, January 1st, 2026. And so what would this mean for patients who are receiving puberty blockers today and would potentially need to be titrated down from their care? I am not a clinician, I'm an attorney, so would have some grave concerns about a quick stop in care and what the implications of that would mean clinically. There's been a lot of talk today about parental rights and informed consent and pediatric assent. And I just want to underscore that informed consent is something that is not only important to Dartmouth Health, it's a principle and a value, but also the law, and something that we take very seriously, so that all of our practices, all of our policies and procedures contemplate informed consent, both with parents and also for those adolescents that are engaged in this treatment. We also engage in assent too, so that patients, parents, and their provider are working collaboratively as they engage in this care.
You're down to 15 seconds.
Sure. One other point, just to put a finer point on this, questions around clinical corroboration and whether or not providers are exploring innovative treatments. We see this outside of the gender affirming care spaces. We see this in rare disease states. We see this in oncology. And without access to care and without access to research, we're not going to see medical innovation. So I
Thank
just
you.
want to underscore that too. I am happy to take questions.
Any questions? Representative Kesselring.
Thank you, Mr. Chair. So I know you're not a medical professional,
I am
you're
not.
a lawyer, so I'm going to ask you this in a legal term. So on Dartmouth-Hitchcock's website, it specifically says, for most transgender patients, hormone therapy is the first step. So we've heard different things about requiring, therapies and different things ahead of time. But why would Dartmouth-Hitchcock on their website take the approach that that's the first step?
I wish I had the website up in front of me because I don't. Okay. That's not our first step. For this patient population, I have learned a lot about gender affirming care because we've contemplated it in this state house in the last couple of years. For children, young families who are accessing this care, it's a multidisciplined team that's working with these families, and there's a lot more social transition that's happening even before puberty blockers, which puberty blockers is the only thing contemplated in this bill. And that social supports is a child that is supported by a multidisciplinary team. The provider is only one person. There are social workers, there are psychologists that are supporting the patient and their family as they navigate what is this next step for us as a family. So that's number one, that social piece. Then there's questions around puberty blockers. You've heard from families today that have shared their journey with great courage, and so I'm not going to reiterate their stories, but that would be, puberty blockers would be that next step. And then hormone therapy. And patients are going to navigate that with their providers. They're going to be very unique. I was listening to the testimony with a young man who has Turner syndrome, and talk about a very unique patient who's going to be navigating some medical complexities with their provider, who's not a state provider, not Dartmouth Health, and their parents.
Okay. Follow up?
Quick follow-up.
Okay, so Trump had an executive order that blocked or changed this. How does that affect because your legal side of things, how does that affect what's happening in the state when it comes to that?
Yeah, it's my understanding there's a stay on that executive order to date.
Okay.
All set?
I got one quick follow-up.
Quick,
Okay.
quick.
So does the Dartmouth-Hitchcock I've asked this several times, do you take a stance that puberty blockers are safe and effective?
Dartmouth-Hitchcock has concerns with this bill because it prohibits access to care for a specific patient population.
Anyone else? Yes, Representative Ryan.
Thank you, Mr. Chair. Thank you for taking my question. How many children are we talking about?
So I've asked this question it's very small. Of our patient population, the amount of children that are receiving puberty blockers after much careful consideration with their parents and their providers is extremely small, a percentage of a small percent. I'm going to, Representative Ryan, if it's okay, I'm going to circle back with you because I don't want to give definitive numbers here, but it's a small percent of patients who need puberty blockers and an even smaller percent who even walk to that next step. And so I want to be really careful about protecting this patient population.
Representative Lucas.
Thank you, Mr. Chair, and thanks for taking my question. Is it true that pediatric endocrinologists also care for children with type 1 and type 2 diabetes, thyroid disorders, adrenal diseases, and pituitary abnormalities?
Yes, absolutely. Along with Turner syndrome, calcium metabolism disorders. Yes.
Follow up.
Follow up.
And do you have any idea how many of those different disorders, maybe total, are attended by Dartmouth pediatric endocrinologists?
Yeah, I'm happy to get numbers for patient volumes for this committee.
Thank you.
Okay. Anyone else? I'm almost afraid to ask. Okay, Representative Drew.
Sorry. So my question, thank you, Mr. Chairman. Do you, as an organization, track statistics and outcomes for the patients who go through this care? And if you do, how long do you do so? Is this a lifelong process?
I am gonna have to take that, Representative Drew, I'm gonna have to take that question back to our team. So I think you're asking about clinical trials. And it's not, I don't have my finger on the pulse of what clinical trials we're engaged in. But I'm happy to take that back to the team, the clinical team.
I'm specifically not talking about clinical trials. I'm talking about the work that Dartmouth Hitchcock is doing with specific patients.
So I guess I'm not understanding the detail of the question. I'm sorry.
Okay, I'll try to explain it better.
Sure.
Does Dartmouth Hitchcock, after these treatments are performed, do you have an understanding of what the outcomes of those treatments are? For example, if you have someone who goes through these treatments and then regrets it or detransitions, or you have someone who goes through the treatment and is happy with it and continues on with their life, do you have any idea of how those outcomes turn out?
I think that information would be contemplated in clinical trials. I'm happy to ask our team that, but I think that type of information that you're seeking would have to be contemplated in a clinical trial. And I also am very concerned about treating this patient population different from other patient populations. For example, if there's a peds GI patient who has a rare esophageal disorder and is engaged in an FDA, a not yet FDA approved clinical trial, we're not looking to follow that patient for the life of the patient. So I would take concern if we're going to be talking about treating one patient population in a different way. But I will take the question back to the team. I'm happy to do that. Yes.
Representative Kesselman.
I'm going to ask one targeted
Sure,
question.
sure.
Do you know the number of children that have transitioned through Dartmouth Hitchcock Medical Center?
I will take the question back to the team.
Thank you.
Okay, let's move on. Thank you very much. Oh, Representative DeLamus,
Thank you, Mr. Chair.
you may never leave today.
Oh, just
Well, I am hungry. We need lunch at some point. So
I may have missed some of the information that you imparted.
Sure.
What are the ages of the children that you treat?
Sure.
Roughly.
Yeah, so as I was explaining, we have a gender affirming care clinic. And so there are patients and their families that come to us that are seeking gender affirming care that would start with a social transition and then they may navigate to puberty blockers, they may navigate to hormone treatment and beyond. And so children can come to us at a very young age and are supported by a multidisciplinary team. You've heard today from patients, so I don't want to, their stories are much more important than the testimony that I'm giving.
Well,
What's the youngest patient that you have who is on blockers?
Oh, Representative DeLamus, I'd have to get that back to you. And I have to be very careful too, because this
understand.
is sensitive patient information, and none of us would want our patient information to be public, and so I have to be very mindful about that too.
okay, Representative Tejas.
Thank you, Mr. Chairman. Thank you for taking my question, and then you can run to lunch. We heard previously, and I apologize if we grabbed lunch if you mentioned this, but we heard previously that there's workforce impacts in places where these kinds of laws are enacted.
Yeah.
And you mentioned how you have a team of pediatric endocrinologists. We know that you are the premier tertiary care academic center for our state. What is sort of the and how much the pediatric endocrinologists care for children with many other conditions as well? Can you paint for us a picture of like what kind of impact this would have on the workforce, if at all possible?
This would have a significant impact on our workforce, particularly it's really challenging for us in New Hampshire. We're a very rural state. Our patient volumes are pretty low. It's very hard for us to attract specialty providers. And it's even more hard to attract pediatric specialty providers. And so we would have grave concerns about our ability to attract and retain the peds endocrinology workforce here in New Hampshire. We've actually been the recipients of other types of providers that have come to New Hampshire because they don't want to practice in certain states that have other restrictions. And so we are seeing that patients are deciding where they live based on their ability to practice.
The final question on this subject, with this witness.
And I'm here as long as you all are, so.
Final question.
Thank you, Mr. Chair. Oh dear, now I've lost the question. Are you federally funded?
Yes.
You are? Okay.
We, well, there's some nuances there. Dartmouth Health has, we are a public institution that has patients who have Medicaid coverage, Medicare coverage. We take all patients regardless of their ability to pay. We also are a research institution, very proud of the work that our facilities are doing. And so, yes, we do receive federal funds for research as well. I believe that was the question.
Let's move on, okay? Thank you very much. Did Patricia Hughes ever come back? No, apparently not. Okay. Also signed up to speak is Simon Price. Oh, I'm sorry?
Simon Amaya Price.
That's Simon Amaya Price. I have two last names.
Okay, sorry.
No worries. It happens. Database breaker. Good afternoon. Thank you for introducing this bill and allowing me to testify. My name is Simon Amaya Price. Today I had sit in front of you as a 20-year-old man, but for 3 years I thought I was a girl. I received my bachelor's degree in music last December with additional coursework at Harvard University in statistics. I remember being 14. I was sitting in my pediatrician's office explaining to him that I was transgender and that my father wasn't affirming my new identity. So my pediatrician asked my father, "Would you like a dead son or a living daughter?" I was in the room when he asked this question. There is no other situation when a doctor is allowed to suggest suicide like this to a patient, and quite frankly, it's medical malpractice. If you ask parents of trans-identified kids and other detransitioners, you'll discover that this is a common line used to manipulate parents into consenting to these procedures. Despite being referred to my local gender clinic 3 times by 3 separate doctors, the emotional blackmail, and my gender dysphoria diagnosis, my father refused to take me to be medicalized. And I hated him for it at the time. But now, I am deeply grateful. And it's not just me. 3% of my generation identifies as transgender. Between the time I left my high school in 10th grade and my class graduated, 1/6 of the boys in my class started identifying as trans, many of whom medicalized. My girlfriend is a detransitioner. And I can't do much more than pray that if and when we decide to have kids, that despite the double mastectomy, which precludes her from ever breastfeeding, and the 4 years of cross-sex hormones she was given starting from when she was a minor, that she is able to carry a pregnancy to term. The other side believes that if you don't give trans-identified kids puberty blockers, cross-sex hormones, and surgeries, they will kill themselves. That is a damned lie. I am living proof of that fact. I was not put on hormones, I was not operated on, and I have grown up to be a healthy and happy 20-year-old man. I have also talked to parents with detransitioner children who killed themselves after realizing they regretted what they had done to their bodies. What would you say to those parents? The other side of this issue has both psychological and economic incentives to oppose this bill. Imagine, if you will, having administered cross-sex hormones or puberty blockers or referred children to have such procedures. What would you do if you were presented with the evidence that what you were doing wasn't helping your patients, but indeed permanently harming your patients? I know I would have a very hard time accepting that. Transgender healthcare is a multi-billion-dollar industry. Though estimates vary, the lifetime cost of providing a trans-identified individual with hormones and surgeries exceeds $100,000 on average. What would you do if you were a hospital administrator or a doctor who made $1 million for every 10 patients you treated? If you are serious about protecting families and the health of children, you must vote for this bill. Thank you very much.
Thank you. Representative Tejas.
Thank you, Mr. Chairman, and thank you for taking my question. I apologize. Where did you say you were from? Where do you
Massachusetts.
live? Okay, thank you. Follow. Were you paid to give this testimony today?
I wish.
Anyone else? Representative DeLamus.
Thank you, Mr. Chair. Thank you for taking my question. What influenced your transgender identification?
I experienced 2 years of near daily homophobic bullying in 7th and 8th grade. I was called the F slur, which I will not repeat, on a near daily basis by my classmates, and I received little to no sympathy from the administration. I moved to a new school in 9th grade. Shortly after, my friend group left me, and I was sexually assaulted by an older boy who was 18 at the time on a school trip. I started looking for answers. I didn't understand what I was going through. This distress I was feeling was real. I joined the Gay Straight Alliance, or the Gender and Sexuality Alliance, and we watched this trans YouTuber called ContraPoints, who is a male to female transitioner. This is where I learned about the concept of gender dysphoria and the fact that there is a clear pathway to solve what I thought I was feeling. I was uncomfortable with my secondary sexual characteristics. I was uncomfortable with being a man, and I was dissociated from my body. It didn't help that in my health class, I was taught about the gender unicorn, and the teacher asked me and my classmates to place our identities of sex, gender identity, gender expression, romantic attraction, and sexual attraction on these spectra. And I think that sums it up pretty well. Additionally, I am bisexual and I am autistic, and I suffered from a lot of internalized homophobia, obviously, and difficulties pertaining to socialization due to the fact that I am autistic.
Just actually a second question. With kind of coattailing off of Representative Tejas, so why are you here today to testify to us then?
I am here today because I have lost 2 of my friends to suicide. In my generation, and in my age group rather, suicide is the second leading cause of death. This is a large population level problem, and it sickens me that trans rights activists are using my dead friends as bargaining chips. My girlfriend has been permanently harmed by these medical treatments. My friend Corey over there has been permanently harmed by these medical treatments. Kids are being lied to, parents are being emotionally manipulated, and I personally think that this is the worst medical experimentation we have seen since World War II. The same hormones we are giving young boys were the same hormones we administered to Alan Turing in Britain to cure his homosexuality. This is unforgivable. Additionally, I take deep offense with those who compare people like me advocating for my side to Nazis. I'm Jewish. People have called me a Nazi for speaking up about this. Yesterday, somebody tried to dox me. The other side doesn't want people like me to exist because I invalidate a central tenet of their ideology. That's why I'm here today.
Thank you so much.
Representative Kesselring.
Thank you, Mr. Chair. I'm going to ask you a question specific to like other people that have testified today. Is there anything that you had for therapies or anything else that you have dealt with over the years that helped you through the process of anything?
I was extremely lucky to my dad actually helped me a lot. He was able to find me a better therapist compared to my previous gender affirming therapist, who was able to deal with my underlying problems, my sexual trauma, my depression, my anxiety, my PTSD-like symptoms, and learning to accept the fact that I'm autistic. I also found joining a sexual assault survivor support group my second year of college very helpful. At the end of the day, 75% of it was luck, 25% of it was maybe my dad saying no, he did not affirm me, and 5% of it was my own critical thinking skills. The more I talked to other detransitioners, the more I realized just how close I was to doing irreparable harm to my body. And I've had nightmares for years about waking up paralyzed, on a surgeon's table, looking down at my genitalia and seeing the penile inversion surgeries which are done on boys like me.
All set? One final question, yeah?
Thank you, Mr. Chairman. So what would you say to young trans boys?
It might be hard to understand right now, but if you don't do anything to permanently alter your body, you'll be healthier in the long run. You won't risk regretting the permanent harm you've done to your body. And someday, somebody will love you for who and what you are. I didn't believe it when I was 14. I didn't believe that for years. But I have been lucky to meet some very special people, you know, my girlfriend, not least of which, whom rather, have loved me for me and accepted the fact that I am a man. It was very difficult for me growing up because I felt like masculinity and being a man was villainized. I grew up in Boston, which is a very liberal city, and I felt like I was the kind of the subject of this collective guilt, that all of the crimes that men commit, people would talk about how men commit all of the murders, all of the rape, all of the sexual assault, and that all men were somehow guilty of that. That weighed very hardly on me. And you're loved, you will be loved regardless of the fact that you are a man. We need men. There are many ways to be a man. You don't have to be a gun-toting, southern, cowboy hat, yeehaw type of guy. You can be feminine, you can be pretty, you can love other men, and none of that makes you any less of a man.
Okay, thank you. All right, with that, thank you very much.
Thank you.
Sure, go ahead. Just going to take a quick 5-minute recess. Okay, thank you everyone for your patience and that indulgence. The clerk and I had been sitting here continuously since 9:30 this morning, and Mother Nature just wasn't willing to give us any more forgiveness or tolerance. So anyway, moving on. Next up to testify is Katerina Moreau.
Can you spell your last name, please?
It's MERCAU.
Did I pronounce it correctly?
Close enough, Maru.
Okay, Moreau, okay.
Push the button on your mic.
I just want to preface this by saying that I have done an online testimony already, and I just wanted to make a few comments to clarify some things that people have been asking about gender affirming care. I am the parent of a trans child, and I have seen them through their transition. And I want to clear up some misconceptions about how of the availability and the ease of getting transgender affirming care. Because my child started showing signs of being trans right around 4. By the time they were in 5th grade, they were referring to themselves as a male and a male name also. And by the time they were 14, they decided that they wanted to, besides socially transitioning all this time, it was a long process, they wanted to do hormones. Now, the process is not very easy. First, you need to call your doctor and you need to get a referral. And those referrals take at least 6 months to get an appointment. And when you get there, you have to be psychologically evaluated. You have to have a physical exam. You have to state out why and how long you have been transitioning and how you feel about it. And then after all of that, which takes months, it could take up to 6 months or more, then the child decides if and when they're going to take puberty blockers or hormones. My child, they gave them a choice. How would you like to proceed in your gender affirming care? And my child says, I would like to take hormone blockers and hormones. And they said, okay, make sure all of the health things and all of the psychological things are in place. Between all that time, from the very beginning to the journey of getting that referral to getting hormones, was over 2 years. Now, my child has already spoken today. My child was on hormones, like he said, for a year, and then he got cancer. And he made the choice to get off of hormone therapy because he didn't want it to interrupt. He was given a choice to stay on hormone therapy if he wanted to. He chose not to. And during that time, while he was going through cancer treatments, he reverted back to having menstruation, being more feminine-like. There were no effects that were not reversible. And then after he finally became, cancer-free, thank goodness, stage 4 cancer, he went back onto hormone treatment to continue.
Just about 10 seconds.
Okay. And I just wanted you to know that I'm here to answer questions that you may have about timelines and how long this process takes. Thank you.
Okay, thank you. Questions? No questions? Wow. Okay.
All right.
Thank you.
Thank you.
Also signed up to speak is Sarah Terrell.
Sarah asked me to read her testimony.
We need a pink card from you.
I spoke as myself. Sarah Lynn's Jakehouse. Sarah asked me to read her testimony.
Oh, you had already spoken yourself?
Yes.
Well, is there written testimony you can just give us then?
Sarah wanted her testimony.
Well, if you've already spoken, though, we only usually allow one person to speak.
Does anyone else want to read Sarah's testimony?
Usually no one testifies twice. Oh, well, And we will need a pink card from you also.
Thank you. This testimony is on behalf of Sarah Terrell. My name is Laura Carizzi. I'm not just speaking to you today as a concerned citizen. I'm speaking to you as a mother who loves her child more than anything in the world. A mother who, like every parent, wants nothing more than for her child to be safe, healthy, and happy. And yet, I find myself here, once again, pleading for my right to provide my daughter with the life-saving medical care she needs. In every other circumstance, our state trusts parents to make medical decisions for their own children. Parents decide when their child needs therapy, when they need surgery, and when they need medication. But with this bill, the government is telling me that I, as a mother, am incapable of making the right medical decisions for my child, that I don't know what is best for her, that my daughter's life, her very existence, is a political issue rather than a deeply personal medical one. Let me be clear, this bill does not protect children, it puts them in danger. I strongly oppose this bill. The risks to transgender youth are not hypothetical, they are real. Studies by the American Academy of Pediatrics have found that more than half of transgender male adolescents attempt suicide. For non-binary youth, the number is 41%. For transgender female adolescents, it is 30%. These are not just numbers, these are real children, children like my daughter who are crying out for help, and we have the power to help them. I am not willing to gamble with my daughter's life. I am not willing to sit by while politicians who have never met her, who do not know her heart or her struggles, make medical decisions on her behalf. I refuse to let my government strip me of my right and my responsibility to protect her. Every time I come before a committee like this, I look each of you in the eye and beg you to help me keep my daughter alive. I am doing that again today. Please, please let me care for my child. Let me do what every loving parent strives to do. Keep my child safe. I promise you, she is worth it. Thank you.
Thank you. Representative Drew.
I was just going to say, ma'am, could you let me have that written testimony so I can enter it into the record?
Oh, sure.
Thank you.
Do you want me to put in the pink card?
We need the pink card too. Okay, also signed up to speak is Eric Golden. You've asked for 5 minutes. Again, we're limiting testimony to
I'll
3,
be as quick
please.
as I can. Guys, thank you so much for allowing me to be here in front of you today. My name is Eric Golden. I'm a resident of Belmont, and I'll try to get through this as speedy as I can. I just want to start with a few relevant points here that came up during the course of conversation that, as a father of a transgender child, that I would like to give my my insight on. I've been doing this for quite some time now, since about 2017. So our growing international consensus that was brought up during here today of some European countries that are trying to outlaw this sort of practice. I don't know anything about that, but I'm just wondering when New Hampshire started caring about what other people did. Right. I also want to say that the result of transgender suicide is not the fact that people are transgender. The result is federal, state, and local governments, social problems, and unsupportive family members drive people to feel like there's nowhere else for them to go. So suicide is not a byproduct of being transgender. No support system in place is really the cause, and that's what this bill will only serve to do. Regarding long-term effects, this bill flies in the face of the trusted relationship between mental health care providers and medical providers and the ability of families to be able to navigate this issue with their children in their homes. People talk about, well, we outlaw tattoos, we outlaw cigarettes, we outlaw tobacco, but these things are publicly available over the counter. My child has to go through mental health evaluations. She's been going through this for years. It's not something we just walked into the doctor's office and decided that, hey, let's do this. Oh, you're transgender. Great. Let's get you on hormones. It doesn't work like that. And if anyone's telling you that it does, they're lying to you, or they don't know what they're talking about. So thank you for that. I would just leave it with one more thing. In rhetorical question, to our cisgender people in this room, when you were 4, when you were 3, when you were 5, did you question at all what you were? And if not, which probably the answer is no, why is that opinion any less relevant than a child who does question who they are? It's absolutely relevant. I'm going to read something that I wrote in 2017 as a Father's Day piece, and I've rewritten it here to fit this scenario. So please bear with me. When my family began this journey, I was given advice by someone I was close with. They told me to continue insisting that my daughter was
you
my
are down
son.
to 15 seconds, sir. So, please.
All right. I have 6 copies of this, and it's one page. If I can just get through it.
Well, again, I can't extend it beyond the 15 seconds. I'm sorry.
That's unfortunate, but
please distribute it.
The bill
We'll definitely read it.
is inexpedient to legislate clearly.
But please pass it out. We do want to see it. Sure.
I need a copy.
Any questions for this
I'm happy to
gentleman?
take questions.
Any questions? Representative Lucas.
Thank you, Mr. Chair, and thanks for answering my question. You said something about something you wrote for Father's Day, and this is a subject that's very important to you. I'd like to know why.
I'm just an average American white cisgender guy, and I didn't have the language before I had children that taught me the language. And for me to, we talk about experimental drugs, right? I'm not going to experiment or gamble with who my child says that they are just because I don't believe it. I'm not going to do that. Because somebody mentioned, oh, well, would you rather have a son that's alive or a daughter that's alive or as the case may be, or a son or a daughter that's dead? I'm not even asking myself that question. The answer is my children know who they are. And it's my job. It's my job to follow their lead and help them navigate this minefield. How can a governing body come in and try to get between the relationship of mental health experts, medical experts, and family dynamics? It does not belong. Thank you for your question, Representative.
Okay, thank you. Anyone else? Seeing no one. Okay, thank you, sir.
Thank you.
Also signed up to speak is AJ Khalidi from Goffstown.
I didn't really prepare for this bill, honestly, but I just have something to say anyway.
Could I just ask, do you spell your last name Coliti?
It's Coletti.
Okay, great, thank you.
Yeah. These kinds of legislative proposals are rooted in nothing other than prejudice and therefore fallacy. I haven't heard a bit of reason or legitimate evidence to prove why this kind of stuff should be codified by law, only the spewing of personal fears and opinions from both sides. The difference between the queer community's fears and opinions is that we aren't asking for them to be made superior or necessary for anyone else to believe through the binding force of law. All we want is to exist without being afraid of who we are, not be anointed righteous by Her Majesty Elon Musk. I don't know why I wrote that. I was just sitting right there. We could easily agree to disagree if those who disagreed with us would end there instead of further persecuting us by making our livelihoods illegal. Our lives, us people, were only as harmful or harmless as anyone else, as a person's worth or moral goodness has nothing to do with physicality. There's a fundamental problem with having to argue about this type of stuff, and it's one of extremes. You can't sit up here saying all trans people are this, and I can't sit up here saying all Republicans or whoever are that, because we don't live in a world, nor have we ever lived in a world where it is reasonable or intelligent to generalize anything. Since the dawn of time, all that's happened is a bunch of natural exceptions. Quite literally, the reason we're standing here today is because something wildly unexpected happened and a tiny concentration of immeasurable energy randomly started to expand. The point is, some of us desperately need to reevaluate what we believe to be true, because the world is not black and white, never has been, and never will be. Stop making it so hard to just be okay with being gray. Making it illegal won't change the laws of nature. I would also like to address the thing that guy said. He asked the question, he was like, did they tell you the side effects before you got on hormones? Yeah, they did. You know when they didn't tell me the side effects of things? When I took birth control, they gave me the pill, they didn't tell me the side effects of those, and those are the same as the hormones I'm taking to be trans. Same thing. Same with antidepressants. They didn't tell me those side effects. Like, you know, when you hear the end of a commercial on TV and it's all those horrible things, they told me that for testosterone, not for other things. So I just want to make that abundantly clear. And then the 99% of the time thing, someone said 99% of the time you hear about how people are all happy about it and not that they were like upset by their decision to transition. Probably because 99% of the time people are happy about it. And I'm genuinely sorry for the people who have had terrible experiences, but how many times are we going to treat the symptom and not the cause? Because someone who literally told us why they thought that they were trans in the first place was not because of the woke liberals. It was because they were already being persecuted for being effeminate as a man. So, like, isn't the cause here a little bit different than what we're trying to get at with this bill?
Seconds.
Actually, let me just make sure. Yeah, I don't know. It is life-saving for some people. What are we defining life-saving or safe by? Is something safe completely harmless and never has hurt anyone in the world? Because then safe doesn't exist. Everything on this God green earth can hurt you. Anyway, okay, that's it.
Thank you.
Yeah. Oh, well, did you have questions? Probably not. You guys want to get out of here. So.
We're gonna be here for a while. We got another bill yet, so.
I have something to say later too, so I'll see you.
Okay.
Just save it for later. Save it for later. Yeah.
Okay, thank you. Also signed up to speak is Diana George. We did get to you.
Yeah, after a bunch of Massachusetts people testified. But thank you for
People of
listening.
people.
Yeah, I'm a New Hampshire resident. So I'm not going to read this whole thing. You have a copy, and a lot of it's been reiterated. But I will tell you that as a parent of a transgender, now 24-year-old, or almost 24-year-old, who came out as transgender at age 15, he's still transgender. He will always be transgender. He knows who he is, and so do we as parents. And I believe in science. I'm a registered nurse, and I find it deeply offensive that some people in here accuse me of doing things like allowing me to mutilate my child. Excuse me, I work with a population that terrorizes and abuses their children. Do not, how dare you, do not compare me to one of those people. How dare you? I've been doing this since 2018. My child is transgender. He's not going to change his mind. We went through, like everybody else said, multiple sessions of therapy with psychologist, therapist, psychiatrist, endocrinologist, primary care doctors. We've been through it all. And you don't just walk in nilly-willy and say, oh, I'm transgender. Give me some testosterone today. It's stupid. And I'll tell you something else. The Republicans are the ones that always seem to have a problem with transgender people. Stop using my child and other transgender people as political pawns. We've had it. done.
Thank you. Also signed up to speak is Dr. Michael Leon.
I'll take less than 2 hours. Kidding. I think we're almost done. Mr. Chairman, members of the committee, thank you for allowing me the 3 minutes to testify. Hearing previous testimony, I want to call out that my testimony will be limited to normal physiology and specifically to pediatric and adolescent young adults under the age of 18 years of age, as that's how the bill is written. Going through, I'm going to go kind of fast here. I'm going to start by going back 3,000 years. I think everyone in here has heard someone named Hippocrates. Primum non nocere. First, do no harm. For those of you who have actually read the Hippocratic Oath, literally the very next sentence is a promise by physicians not to offer poison to their patients, even if the patients ask for it. Slightly past Hippocrates, a man named Aristotle came up with the term sexual dimorphism and actually pondered how not only humans but other animals are sexually dimorphic. That is, there are two sexes. Skipping forward, just a little bit of history because I think we are here to understand, are we actually doing harm or potentially doing harm to children? Normal physiology. I have heard people say sex assigned at birth. That is absolutely asinine. It does not follow science. After conception, whether you are XX or XY, whether you have testes and a penis is determined by a gene called SRY. It's actually normally found on the Y chromosome. People who have things such as Turner syndrome, which would be not covered by this law, they're actually accepted by this, can be explained by the SRY gene actually being transcribed. Instead of being on the Y chromosome, it can be found on the X chromosome. This was found in 1990. That particular gene, if we're looking at development, normal physiology, at 6 weeks begins to be expressed. At that point, normal human fetus developing has both male and female genitalia. As soon as SRY is expressed, at 8 weeks of development, if the person is going to become a male, all of the female tracts have already degraded. It takes a little longer in women. It's actually out to about 12 weeks, at which point the Wolffian ducts in women would have degraded. At 6 months, baby's still in the womb. Testosterone reaches a level in the developing fetus that rivals that of an adult 20-year-old male, which I'm far past. But when males have really their peak conditioning around the 20-year age range. I think it's important to understand when we're talking about normal physiology that hormones are responsible for long-term remodeling of the human body.
Seconds,
okay. If you want to look whether drugs are reversible, please don't look to me, don't look to anyone in this. Pull up the drugs which have been approved by the FDA. Every one of them carries the strongest warning possible for suicide. Thank you.
Thank you. Are you taking questions? sir?
Happy to take questions.
Any questions for Dr. Lane? Representative DeLamus.
Thank you, Mr. Chairman. Do you have experience in hormone research?
Thank you for the question. I'm a nerd. I actually started doing biomedical research when I was in high school. After college, I had studied both biochemistry, chemistry. I was offered an opportunity to join a lab, which I never thought I would do. It was a wonderful opportunity, and I studied female hormone biosynthesis for over a year before I went to Dartmouth Medical School. I have a PhD, not an MD. That was wonderful. I learned their hormones. It's like a chorus. My mentor there, hormones in the human body are a chorus. It's an orchestra, if you will. You can't simply change out one tenor. You can't change out one person and think you've changed the whole orchestra.
Representative Kesselring.
Thank you, Mr. Chair. Question was asked before about if puberty blocking hormones are FDA approved. Are any of them FDA approved?
Are they FDA? So yes, with a caveat. Are they approved and how they're used? Physicians can use, anyone who can prescribe a drug in the state of New Hampshire, and I don't remember where the line is drawn between NPs and other qualified healthcare providers, can prescribe drugs beyond their intended use. It happens all the time. I work in oncology cancer medicine. We very regularly use that. If you look at the GnHR agonists, if you look at the drugs that are called puberty blockers now, they're used in other things. Are they approved as intended? Have they been researched there? I would encourage you and other members of this committee, they're called the package insert. You can literally, if you go to one of them, it's called Lupron. I'm not biased towards any, I have no financial interest in this. Add.com at the end, lie and say you're a healthcare provider. Right at the top, it'll say prescribing information. It's very easy to read what's on there. You don't need to understand the doses, etc. All of the warnings are provided right there. The most strong warnings that the FDA issues are called black box warning. There's a thin black line around it. As I remember, Lupron actually has some pretty strong warnings on it that if you're going to give the drugs to children, it's up to this committee to take a look at and see.
Follow up.
So as a follow-up, in your extensive research, it sounds like you've done research on this, on hormone stuff. Would you say that changing hormone makeup at an adolescent age definitely changes a lot of different things and not just one specific thing that we can point to could cause other issues?
So the impact of hormones is absolutely multifactorial. It goes through a whole list of body processes, the brain, the muscles, the volume that you're able to take into your lungs, the endurance that you have. Psychosocial. There are many, many things that the hormones can do. Have there been formal studies evaluating this to say if I give someone a hormone, what specific, and we start at childhood, what specific changes are done? There are not many well-controlled studies describing that. So I can't say because the data is not there.
Other questions? Representative Lamontagne.
Thank you, Mr. Chair, and thank you for taking my question. But it seems like you're saying that there's a whole mix of hormones in our bodies, and that all of us are born with testosterone and estrogen, and it manifests in to different degrees. Correct? We all have some, both.
So that is true. There are males have the sex-related hormones. Testosterone is dominant there. It generally is formed in the testes. It can also be formed in other tissues, fatty tissues. The research is still ongoing in that. This has been a big curiosity. And interestingly, men, you may want to know, without estrogen, you wouldn't have the same bone density that you have now. Similarly, in women, the estrogens, which is actually a class of steroids, are the dominant hormone that are there. Yes, they generally come from the ovaries. They can also be produced in other tissues as well. And this whole cycle, actually, when we were talking about puberty blockers, I call those out specifically, they actually target the pituitary gland to stop two hormones there. A different class of hormones, they're not steroidal hormones, but those are signals that come down and actually directly impact the gonads in both male and females.
So,
Hopefully I answered the question. We could spend hours on this.
Just a brief follow-up.
Follow-up.
It's okay. I believe it's 0.5% and possibly more babies are born with ambiguous sexual genitalia, and also their hormones may also not fit in what we normally would see as male or female. And do you think it's possible that it's harder to identify individuals who are male or female because they lack having something so visible as ambiguous genitalia, and that perhaps for a certain percent of the population, they truly feel that they're not male or female, or perhaps have the wrong manifestation of what in their body they feel is something else. Do you believe that's possible?
So that's an excellent question. That was actually the topic of a plenary talk. I believe it was 2017 at the American Urology Association. Back in 1973, the United States passed legislation. I believe it was DDT that had been the hot topic at the time. Drugs called estrogen mimetics. If you think of soybeans, these are one of the classic ones. You can have drugs that mimic estrogen. And if they happen at the right point in development, you can absolutely get androgynous genitalia Falling in that same class are also a condition called hypospadias and micropenis. While micropenis is obvious what it is, hypospadias, don't Google it around lunch. It's also a devastating condition. Are these people potentially confused? Absolutely. They require medical care and compassion. Does it mean they're trans? Not necessarily. But they absolutely need care. This has been something that has been brewing for quite a while, and it's multifactorial how that arises.
Anyone else? Seeing no one else, thank you.
Thank you. Thanks for staying so long.
Oh, thanks for your patience. Also signed up to speak is Stephen LaFond. Stephen has the lead. Okay, thank you. Also signed up to speak is Natalie Bucks. Bucks, okay. Backus, I'm sorry.
Thank you. Thank you for hearing my testimony. The direct harm that this bill would do has been thoroughly stated today. I'm going to talk a little bit about the secondary effects. The bill's short title is the Vulnerable Child Compassion and Protection Act. Transgender children exist. They are at risk, but what they need is understanding and compassion, and most importantly, belief from the important people in their lives. They exist, and this bill further stigmatizes something that is already incredibly hard to deal with for the person going through it. Researchers at the Trevor Project, the leading suicide prevention and crisis intervention organization for LGBTQ+ people, published a study in a peer-reviewed journal, Nature Human Behavior, that found anti-transgender state-level laws have a significant and causal impact on suicide risk among transgender and non-binary young people across the United States. Laws like this one increase rates of suicide attempts by LGBTQIA+ youth by as much as 72%, and that's among a group that is already more than 4 times more likely to attempt suicide than the general population. Previous testimony that cited outdated and debunked studies would have you believe that suicidality in transgender people isn't a real problem. I would encourage you to do your own research. There have been accounts today related to people being pushed into transition. I'm not here to advocate for that, and you've heard from parents today who've told you that that's not what happened with their kids. The medication should be prescribed along with therapy and only after long and careful consideration together with the child and their parents. The aim of these medications in regard to transgender health is to reduce harm, and banning their use is not the answer. The decision of whether or not to use puberty blockers ought to rest with the physician, their parents, and the child, and not with the government. This bill would deny access to medication that can save lives and, in all likelihood, lead to an increase of suicide attempts by vulnerable children in New Hampshire. I oppose this bill.
Okay. Thank you. Any questions? Seeing none, thank you.
Thanks for your time.
Okay, one last call, Patricia Hughes. Did Patricia Hughes ever come back? I don't see her. Apparently not. Okay, thank you. And the final person that, as far as I know at least, who signed up to speak, Jamie Reed from the Courage Coalition. Please put your microphone on.
Good afternoon. My name is Jamie Reed. I hold a Master's of Science in Clinical Research Management. I am a lifelong Democrat, a mom of 5 boys, 3 of whom were adopted out of the foster care system, and I am a lesbian. I am also the public whistleblower from a pediatric gender center where I worked, where I saw patients from the age of 3 until the age of 26, and I worked with nearly 1,500 unique patients. I worked in pediatric gender medicine for nearly 5 years, and I was once a true believer. What I learned is that these are interventions based on poor research, with poor evidence and poor outcomes. I believe that my time best today will be used simply explaining how a puberty blocker is clinically used and how it came to be used in children. 3 mental health providers in the Netherlands hypothesized that the reason why transsexual adults were not doing well was because they could not pass. Primarily, men could not pass as women. They hypothesized that they could intervene in early childhood to cosmetically help them look better as adults. So they devised a study giving a puberty blocker when children reach Tanner stage 2. They believed that the puberty blocker could be part of a diagnostic determination giving children, quote, a time to think. It did not work that way. It became a one-way pathway, and nearly every child ever put on a puberty blocker has gone on to cross-sex hormones. They tested this 3-part protocol. Step 1, a puberty blocker. Step 2, cross-sex hormones. Step 3, surgery. They tried this first on 70 children. So-called patient X is a young lesbian. In fact, 68 of the 70 young people admitted that they were same-sex attracted. As a lesbian, this concerns me because most of us experience profound questioning of our sexed bodies in childhood and adolescence. In the first study, one young person died. They died because the pubertal blockade meant that their penis never developed and they were unable to have the type of vaginoplasty that would invert a penis. Instead, the surgeons had to use a portion of their colon. They developed a massive infection and this young person died. The first study concluded that these patients might be feeling better because they actually completely switched the measurement scales. The British then tried to repeat the puberty blocker study in 2011. The outcomes were so poor, they refused to publish the results. The researchers found, quote, puberty blockers had not changed subjects' well-being, including rates of self-harm. Within the United States, a puberty blocker study has been completed. In a New York Times article on October 23rd, the reason why we have not yet read it was finally explained. Quote, U.S. study on puberty blockers goes unpublished because of politics, doctors said.
Seconds.
The leaders of this long-running study said the drugs do not improve mental health in children with gender distress.
Thank you. Representative Kessel, I mean.
Thank you, Mr. Chair. So I've heard a lot today about statistics and different information, and it sounds like there's a growing concern there's not enough research. Is there any other specific research that you can cite? Because I haven't heard anything else that says that it could be, to follow up to my question, safe and effective.
Absolutely. So when we look at research, we have to look at something called the pyramid of evidence. At the very top of that pyramid is something called a systematic review of evidence. Basically, it looks at every single study that's published, and they systematically review all of those studies to find out what the weight of the evidence is. Is it good evidence? Is it bad evidence? We have had multiple nations across the world complete systematic reviews of evidence. They've reviewed puberty blockers, cross-sex hormones, surgeries. They've reviewed everything, even binding and tucking. What they have found is systematically the reviews of evidence show that there is little to no statistical support that these interventions treat what they are intended to treat. That does not mean that individuals will not say, I, quote, feel better. We do not judge a medical intervention based, unfortunately, on an individual's response. We have to look at it from a systematic level. The countries that have completed systematic reviews of evidence are almost all primarily liberal northern countries in Europe. Finland, Sweden, the UK. The UK's systematic review of evidence took 4 years. The outcome of that study was to ban puberty blockers in a bipartisan manner from the use in England. Canada released 2 more systematic reviews of evidence just last month. They reviewed puberty blockers and cross-sex hormones. Both of those systematic reviews of evidence show little to no support for these treatments. When you have poor support for the treatment, you have to then look at how bad are the possible bad outcomes. So if we can't prove that it works well, we then have to make a decision, could it really hurt? And what we know is that we don't have evidence that they work well. And what they really hurt is that they sterilize children, They remove sexual function and they destroy functioning endocrine systems.
All set? Any other questions? Representative Drew.
Do you know of any other models where people treat based on a patient's self-diagnosis?
No. And what's so challenging with this is that so many people today said things like this takes so long, that the diagnostic process is very, in depth, that they had to see a therapist. What I can tell you is that this diagnostic process, which is based on something called the DSM-5, so this is considered a mental health condition. The reason why we pay for this with our insurance is because it's in the DSM-5. The way that people actually diagnose this is based on written criteria. That criteria includes things like a strong desire to be of the other gender or insist that one is the other gender. Most gays and lesbians do this in childhood. The other elements to this diagnosis include a strong preference for cross-gender roles in make-believe. So if a child wants to play the prince or the princess, that is how the DSM-5 is diagnosing gender dysphoria in childhood. In addition, if you prefer to play with toys of the, quote, other gender, if a woman, a girl, grew up wanting to play with Legos instead of Barbie dolls, she would meet the criteria in the DSM-5 for gender dysphoria. In boys, if a boy rejects typical masculine toys, games, activities, or prefers to play with girls, they would meet criteria for gender dysphoria in the DSM-5. When I have read all of the criteria in the DSM-5 to gay and lesbian adults, they meet every single diagnostic determination. This is the most homophobic protocol I have ever seen devised, and we were once forcibly raped to make us straight, and we were once chemically treated to make us straight. And we are now using the current DSM-5 to say if you are not a stereotypical boy or girl, you meet criteria for gender dysphoria.
Other questions? Yes, Representative Miller.
Thank you, Mr. Chairman. Does meeting those criteria force one onto these hormones?
No.
Thank you.
No. So what happened?
You answered the question. Thank you.
She can speak.
Did you want to elaborate? Or?
Yes, absolutely.
Okay, go ahead.
So what happens is when we have young people, children, who do not fit the stereotypical role of their early childhood, what used to happen is those sissy boys or those masculine little girls would be brought to a therapist, and that therapist would tell the parents whether or not they should socially transition the child. What's happening now is that older adolescents, we see this as a true social contagion as well. Older adolescents are identifying and stating that they meet this criteria. They will come in to a therapist, and the therapist does not do anything else but say, "Do you identify as trans?" The young person says, "Yes, I do." And then in my own center, that was enough. And yes, children were receiving cross-sex hormones and puberty blockers after one meeting with the child therapist and one meeting with the pediatric endocrinologist. It was a very rapid protocol. So yes, you can essentially walk yourself right in and get yourself on hormones.
Anyone else? One follow-up? One question? Yeah,
Thank you,
go
Mr.
ahead.
Chair. So that brought up a really good point. I mentioned before that Dartmouth had it on their website that it was the first thing that they do when it comes to it was the hormone and the first step in their medical step. In your professional experience, how is it broken out in most other places, or in your experience, what is it? How is that process done?
Thank you for your question. I was really appalled that Dartmouth could not answer the question how many children they have medically transitioned. I can let you know that between 2019 and 2023, they medically transitioned 76 patients at the Dartmouth Hitchcock Medical Center. At the Dartmouth Hitchcock Clinic, they medicalized 3 patients. They wrote 353 prescriptions. They billed close to $100,000 in submitted charges. This is over a 4-year period, and this is only the patients that they correctly billed to insurance. So this data is there. I cannot believe that they would not answer the question on how many people that they have done this to. However, in a center like that, I also worked in a multidisciplinary center exactly like they have set up at Dartmouth. The WPATH guidelines themselves essentially state if a child states that they are trans and at least one parent or legal guardian agrees with that assertion, then that child can be medically transitioned, no questions asked.
Okay, any final questions? Representative DeLamus.
Thank you, Mr. Chairman. You referenced the cross-sex hormones. Do puberty blockers, does a puberty blocker followed by sex hormones result in eventual permanent sterility?
Absolutely. If you follow the protocol correctly as it was created by the Dutch, you start a puberty blockade at Tanner stage 2. At Tanner stage 2, the penis is not developed, the testicles have not dropped, and the testicles do not have the pathways to create sperm. So women are born with all of our eggs that we're ever going to have and ever be able to use for our fertility. Boys actually have to grow the pathways into their fertility. If you block at Tanner stage 2 and go on to cross-sex hormones, infertility and sterility is 100% guaranteed. In clinical theory, we were hypothesizing that if we go in and harvest a portion of that testicular tissue and freeze it, if that young person later decides that they want to have biological children of their own, what the hypothesized clinical idea is that we could actually implant that testicular tissue into a pouch on the abdomen, let that testicular tissue revascularize and grow, and see if it could later go through the process to create sperm. We have no protocol to do that. It is guaranteed that if you follow this protocol correctly, a young male at Tanner 2 cross-sex hormones will be sterile. It is a true human rights question in my mind if proto-gay young people, I believe it's a human rights violation to take away from my community, from proto-gay boys, the right to their future fertility. I think it's a human rights violation against them.
Follow up. Is it a quick one?
Yeah, thank you.
Okay.
At what age does this sterility occur? I mean, is it later? Is it earlier than I would imagine? I don't know.
So Tanner stage 2 is not an age. Tanner staging is how we determine how far along someone is in puberty. Tanner stage 2 in boys, I think we actually even heard a young man was started at the age of 10. Most girls start puberty earlier, boys start puberty later. We actually have a whole chemical question right now. Younger and younger ages are being seen in girls. There's an issue here that does need to be looked at. Most girls will start puberty earlier than boys. If you catch the boy at Tanner stage 2 and we give that puberty blocker, as soon as we start dosing with that cross-sex hormone, that fertility is essentially damaged for life. In my center, we were putting boys on a puberty blockade and leaving them on that. I think also you heard from some older trans identified men.
Yes.
Seems to me that the answer is going way beyond the question, which was at what age, and we are now talking about theoretical treatments. And I'm a little concerned about those people who have been waiting for almost 2 hours to get to the next bill.
Point of order, she can speak. She has a right to speak.
Well, she does, but
Yes,
yeah.
sorry, age is just not the
again,
answer. It's
please
based
focus
on
the
clinical.
question that was
Yeah.
offered.
Yes, the answer is basically there is not an age. This is based on clinical guidelines for when Tanner stage 2 occurs.
Any final questions? I would like to move on. Okay, thank you.
Thank you.
Okay, I hopefully have not missed anyone. We had a huge stack of people testifying, huge stack of the pink cards. Hopefully I have not missed anyone. I don't think I did. All right, so at this point, I'm going to close the public hearing on HB 377 FN. I am going to open the public hearing on HB 712 FN and recognize once again the prime sponsor, who is once again Representative Mazur from Goffstown. We are going to be changing the sign to reflect the hearing that we will be, the bill that we will be hearing. And we will proceed in a moment. Thank you. Sit down. Thank you.
Like that's something that needs to be worked on.
Yeah, you guys go eat.
Thanks for coming.
Too many, I'm just making sure. We're not going to get out of here by 5 o'clock. There's a problem for the staff, but there's nothing we can do about it.
So with that being said, though, like what I'm going to look at is revisit.
Skip lunch, we've done everything we can to expedite things, so.
Find out what the Bill of Rights are.
It is what it is.
I know when I researched the Bill of Rights before, it was not specific. It was kind of like, this is what you're allowed to do. There was some provision talk about why like, you have the right to know and the right to know. So like all of it's very big. So it's almost like making sure that they
Yeah, sorry to put you through all this.
it sounds like a bipartisan issue. You would want to know.
I just got one quick question. Sorry.
Sorry.
No, that's okay.
Does anybody mind if I open the window?
No, not at all. I may jump out though.
Yeah.
It doesn't open.
I mean, I'd have to leave with it. I mean, for like me, I'm not coach or medication. If my doctor doesn't catch it, I could catch that. I wouldn't want to create another issue after with my dad. He's having status or something. And he was just,
Thanks for coming.
I was appreciated. I did come early. I
Yeah.
for my Pilates class.
Oh, good.
To do this.
Good, good.
It was a very good hearing. I
Yeah.
think you did very well. It's a well-written bill.
I think so.
sounds like you, if you don't know the information.
Okay.
You don't have enough
Send me what that is.
Maybe,
Yeah, because I can amend it still before we vote on it. Okay.
As great as it is.
Okay. Thank you. Thank you.
I'm a serial entrepreneur.
Just for a second, I think. Yeah. Yeah.
But that's basically what I do.
Yeah.
I stay in the natural health and aromatherapy space is where I've been, and I've done it fitness equipment companies to I've helped with furniture companies, I've helped with every sector pretty much. Now restaurants, all of it. But so
Okay, thank you, everyone. Thank you for that brief indulgence. We want to move on to the second bill of the day, HB 712 FN. And once again, recognize the prime sponsor, who is once again Representative Lisa Mazur. Representative Mazur.
Can we shut that door? So we'll play. Thank
To
you.
both of them, yeah, please.
Thank you. Thank you, Mr. Chair and members of the committee. Again, for the record, my name is Lisa Mazur. I represent District 44, the towns of Goffstown and Ware. I am here today to represent legislation that limits gender surgeries for minors while allowing breast surgery exceptions for cases of medical necessity. Minors undergo significant physical and psychological changes during adolescence. Medical experts acknowledge that breast development continues into the late teens, and surgical interventions at a young age may carry unnecessary risks.
It is essential to ensure that minors have the maturity and informed consent capacity to make such life-altering decisions. You will hear many compelling stories today, and although an individual story can be very compelling, and we've heard many of them today, it is not a basis for an experimental medical protocol carrying a heavy medical burden. Gender surgeries, whether for augmentation, reduction, or other non-medically necessary purposes, carry potential complications, including surgical risks such as infection, scarring, and complications from anesthesia, the possibility of future medical or psychological regret, impacts on future breastfeeding ability and sensation. Medical ethics emphasize the principle of do no harm. In cases where a minor's physical health is not at risk, postponing surgery until adulthood allows for fully informed decision-making. My testimony this morning applies to this bill as well. While restricting elective procedures, this legislation appropriately provides exceptions for medical necessity, including severe cases of juvenile macromastia, which is excessive breast overdevelopment, that causes chronic pain or posture issues, cases of significant asymmetry that result in physical or psychological distress, reconstructive surgery due to trauma, congenital conditions, or other medically justified needs, and more. These exceptions ensure that minors who truly need surgical intervention for health reasons can still receive appropriate care. As I mentioned earlier today, you will hear today that if these children don't go through these procedures, they are more likely to commit suicide. I referenced it this morning, but page 195 of the CAS report showed that, again, child sex procedures don't actually prevent suicide. And the ACLU attorney admitted that as well. Just last year, a young autistic woman in New Hampshire filed a lawsuit against her former endocrinologist and other medical providers, saying she was misled into inappropriate gender-affirming surgeries and treatments that left her in pain and have ruined her life. According to the lawsuit, she cannot get back the life that was stolen from her. She will never be able to conceive and bear a child. Even if she could conceive a child, she would never be able to breastfeed her child. She lives in daily pain from the effects of the unnecessary surgeries and years of taking enormous amount of cross-sex hormones. She will never look the same and has to deal daily with severe alterations to her female body, such as bone structure and unwanted body and facial hair. She cannot get back the life that was stolen from her as a child. Under Dartmouth-Hitchcock's care, they performed a double mastectomy, as well as removed her uterus, ovaries, and fallopian tubes. She also had a procedure to close her vagina, according to the lawsuit. Already, hospitals and medical facilities across the world and our country. And yes, someone mentioned earlier that why are we paying attention to all these other countries? Because they are doing studies that we are not. And they are going through way more protocols than we are here, and we need to pay attention to that. Yes, even Boston, they're curtailing and ending minors' access to these harmful procedures. So this is nationwide and global. The Journal of Sexual Medicine, and I mentioned this study this morning, just put out a new study last week, very recent. Of 100,000 plus patients, they found that those with surgery had significantly higher rates of depression, anxiety, suicidal ideation, and substance use disorder versus matched controls without surgery. This study found that gender-affirming surgery is associated with increased risk of mental health issues. This legislation strikes a necessary balance between safeguarding minors from premature elective procedures and ensuring that those with legitimate medical needs can access care. I urge the committee to support this measure to protect the well-being of young individuals while allowing room for appropriate medical discretion.
Thank you. Questions? Representative Woods.
Thank you, Mr. Chair, and thank you. I just perhaps these are sort of technical issues with the bill. On page 2 line 21, it refers to surgery as defined in 329:53X. There's been an addition by the bill, but there's no section 10.
I'm not seeing the line number that you mentioning.
Line 21 on page 2.
Yeah, mine aren't meant numbered the way yours are, so
Right,
I've got
maybe
mine.
I've got a,
Mine's taken right from the site, so.
It's right under chapter 332M. It's about 2 sentences.
Okay, yep. Yep, okay.
under 3 colon, or Roman 3 dash A.
Mm-hmm.
The second line down, it says RSA 329:53, comma X.
Mm-hmm.
That refers to what was added above, but there's no section 10.
Okay.
Also on same page, line 34, it says breast surgery subject to the conditions of 329:54 Roman 2A through F. And that refers to also what's been added, but there's an E but no F.
Okay. We can make those changes. If,
Yeah,
I'll go back and look at them. Thank you.
Right, I just,
Yep. Thank
technical
you.
issues.
Sure. Thank you for pointing that out.
Other questions? Representative Weber.
So this prohibits all surgeries with the exception of specific procedures referred to here and specific conditions referred to here. Can you guarantee that there are no other conditions that occur in minors that might require surgery?
We went through, when this bill was drafted, we had a discussion with medical providers and encompassed every possible aspect of it that they thought would be applicable to this. So, yes.
Follow up?
And is there a concern, when you testified, you talked about medical necessity and you talked about major needs for these surgeries. How are providers supposed to figure out where the line is between something that isn't bad enough for surgery or something that is bad enough for surgery?
Thank you. I believe the bill kind of takes that into consideration in the exceptions. I mean, it maps those out, I believe, very well in here. So.
Representative Lucas has a question.
Okay, Representative Lucas, sorry.
Thank you,
I was
Mr.
thinking-
Chair.
We're waiting for an answer still to your question, Representative Weber.
She answered it.
Okay.
Go ahead, Representative
Thank you
Lucas.
for taking my question. Just also was a kind of a point similar to what Representative Woods made. In the last portion of the section above Chapter 332-M, under Roman numeral 2B, the procedure is needed to remove malignant tissue and an appropriate margin. Do you see that?
Mm-hmm.
There's no mention of lymph nodes.
Lymph nodes.
Okay.
Lymph nodes are not breast tissue, but they're often removed as part of a surgery for breast malignancy.
If we feel that that needs to be part of amendment, we can add that once we
Yeah,
discuss it.
I'm just pointing out
Yep.
that.
Thank you.
Thank you.
Yep.
Anyone else? Seeing no one else, thank you. Also signed up to speak is Courtney Reed from the ACLU of New Hampshire.
Sorry, just one moment.
Sure.
Thank you, honorable members of the committee, for taking the time to hear my testimony. For the record, my name is Courtney Reed. I serve as policy advocate with the ACLU of New Hampshire, speaking in opposition to House Bill 712. The bottom line of this bill is that, like the earlier bill that we considered today, this bill would subject a class of people, transgender adolescents, to differential treatment by restricting healthcare to treat gender dysphoria, with a specific carve out for treatments for gynecomastia and macromastia, permitting the same treatment for cisgender adolescents experiencing different disorders of sex development, but barring these same procedures for transgender adolescents. This is unjust and unconstitutional sex classification. And again, this bill raises constitutional First Amendment concerns by prohibiting referrals for these procedures in other states. This bill would prohibit families from making private healthcare decisions, and it puts the legislature in the middle of medical decisions. Despite that surgery for transgender minors is extremely uncommon, this language sends a message that the healthcare needs of trans people are less valid than those of other people. It suggests that the judgment of trans physicians and care teams can be dismissed and tossed to the wayside. It also disregards associations like WPATH, the American Academy of Pediatrics, and the Endocrine Society. Further, the criminal liabilities hovering over the heads of physicians is also concerning. It is unclear how bills like this will affect access to care should it remain legal. After Dobbs, we know that bans on care affect physician recruitment and retention, and within these criminalized practice areas. So the bottom line, to keep this brief, is that this bill singles out transgender youth. And again, if safety and regret are really at the forefront of concern for this committee, there are different avenues to address these, like continued studies or considering guardrails in care. So with that in mind, I urge you to oppose House Bill 712 to protect the rights and well-being of transgender youth and their families, and to keep medical decisions between doctors, parents, and adolescents. Thank you, and I'm open to any questions.
Thank you. Any questions? Seeing none. Thank you. Also signed up to speak is Representative Erica Leon.
Thank you, Mr. Chairman and members of the committee. For the record, my name is Erica Leon. I represent Rockingham 13, which is the town of Derry. When it comes to medical procedures, they get to be pretty complex. You know, I grew up in Southern California. When I've gone back to visit, I've actually been shocked at the number of young high school age women who have had implants during sophomore, junior year of school. That was never acceptable. That was never normal when I was a kid. But today, that's happening. And today, there are young minor girls who are receiving breast augmentations in this country with doctors performing that. Having a breast augmentation with implants means that you will be having surgeries and replacing them because they have health risks. This is a health risk no matter how you were born, but to have an augmentation and add an implant is a major risk. There's also the issues of removing breast tissue. There's a young woman who was not able to join us today because it's really difficult to testify on this. She's a detransitioner. She had a double mastectomy. She's had a child. There's still stranded tissue in there that's still creating milk that was causing her pain, but she wasn't able to feed that baby that she was holding to her chest. There's real and true consequences here. So it's important to make sure that any of these procedures are because we're treating a physical medical need. Now, this language, we went through, we tried to figure out all of the details and all the specifics on when breast surgery is indicated. It is possible that in the future we may have some new indication for breast surgery for young girls. If that happens and that emerges in the medical literature, we'd be able to add those exemptions. But I have a hard time seeing how that wouldn't be covered by malignancy or infection or damage, because if there's malignancy, infection, or damage, that breast tissue can be removed and that can be treated. Right now, when you talk about what it talks about when you need to know whether or not it's allowed, the specific definition of symptomatic macromastia is the definition of when you have such large breasts that they cause nerve problems, they cause back problems, and they symptomatically have a reason why you need to have a breast reduction regardless of your age, because it can be quite shocking. It can be quite significant. And that is specifically protected in this bill. The point is to allow you to develop, to figure out who you're going to be and learn how to become comfortable with that, because watching the kids who grew up in the area where I did, who instead of deciding that they need to figure out if they're comfortable with how they are and how they're developing, instead they have the peer pressure to go and get implants.
Down to 15 seconds.
Yeah, they go and get implants because there's a peer pressure because they're allowed to do it. Let's protect childhood and hold off on these procedures unless there's cancer or an infection or trauma, physical trauma.
Thank you. Any questions? Seeing none. Okay, thank you.
I could have gotten into all the details if you'd had questions.
Also signed up to speak is Representative Alessandra Murray.
Hello again, Mr. Chair and my colleagues. For the record, I am Representative Alessandra Murray from Manchester Ward 9, and I'm here testifying in opposition to this bill. Similar to my testimony on the other bill this morning, at the end of the day, I do not believe the legislature should be making healthcare decisions for any individual, especially for children who are involving their doctors and parents in these decisions already. I will share some data on the topic, but I also wanted to share my own experiences with accessing gender-affirming surgery. I've been considering top surgery for the past decade, but have faced barrier after barrier in actually getting this care. Only 2 surgeons in the state are covered by my insurance policy, and for different logistical reasons that I won't get into for the sake of time, I'm not able to go to either of these surgeons. My only option is to pursue out-of-network care. Considering these surgeries cost thousands of dollars and will likely put me out of work for weeks, I have been at a standstill for years where I am literally unable to get health care that I need, that my doctor knows I need. And this is my experience as a 30-year-old. Now imagine how much harder it is to access these surgeries as a minor. All of this is to say that not only are these surgeries uncommon, but they are actually inaccessible to many people with gender dysphoria, especially since trans individuals are more likely to experience poverty and less likely to have health insurance coverage. You must intentionally seek this care out, and you must be able to afford it. Those are 2 huge hurdles. Gender-affirming surgeries are rare in minors, with 282 mastectomies performed in 2021. By contrast, 20,000 people a year undergo treatment for male breast growth. A study published in JAMA Pediatrics Medical Journal researched the effects of female-to-male top surgery on chest dysphoria among transmasculine and non-binary adolescents and young adults. It included 70 patients, half of which underwent surgery and half of which did not. This study found that gender-affirming top surgery across the board improved feelings of dysphoria, gender congruence, and body image in young trans adults, and that surgery complications were extremely minimal. Data has demonstrably proven that gender-affirming surgeries not only have a low rate of regret, but also one of the lowest rates of regret amongst all surgeries. A total of 27 studies conducted by the American Society of Plastic Surgeons, polling 7,928 transgender patients who underwent any type of gender-affirming surgery, concluded that the prevalence of regret after surgery was less than 1%. In other words, 99.7% of trans individuals were satisfied with surgery. Meanwhile, up to 30% of individuals who undergo knee surgery experience regret. Up to 25% of people regret getting heart surgery. 30% report regret after a prostatectomy, and 19.5% express regret after a bariatric surgery. Yet all of these procedures are still legal. When it comes to detransition, according to 2022 statistics, only around 3% of trans people
You're down to
experience
15 seconds.
some form of regret but may not detransition. Conversely, 97% of people who transition are happy with their decision. I'll send more of these data points later to ensure you can understand them, but only 5% of people who detransitioned did so because they felt transition was not right for them. That's 0.4% of all trans people. We should not be changing laws based on the opinions of 0.4% of a 1% of the population.
Okay, thank you. Any questions? Representative Weber.
Thank you. I wasn't writing fast enough, so thank you for taking my question. Thank you, Mr. Chairman. You talked about 282 mastectomies for gender transition. Was that in-state or is that nationally?
That was nationally.
Okay, and if I may have a follow-up?
Follow-up.
And what was the statistic for reduction for, is it macromastia?
For male breast growth?
Yes.
Yes, 20,000 people a year.
20. Okay. Thank you very much.
Representative Kesselring.
Thank you, Mr. Chair. So I didn't hear it specifically. Did you say that these numbers were for people under the age of 18?
For the mastectomies, yes. For male surgery, I'm not positive if that one was specific, but I'm going to send all of the data I'm talking about in my testimony to the committee afterwards.
Other questions? Seeing none. Thank you.
Thank you.
Also signed up to speak is Representative Catherine Prudhomme O'Brien.
Thank you. There's a lot of testimony from Dartmouth Health when we go through these bills. And they say a lot of things. Sometimes they say things don't happen. Well, I wanted to just talk about something that I have seen myself with someone who is personally known to me. And that would be a girl who was about 16 years old at the time, and she had a double mastectomy. It was, I considered elective surgery myself because she had it in the process of transitioning. She has detransitioned and has a child. She would not be able to breastfeed. When I was a first-time mom, every penny had to be watched very closely. One thing that made life a lot better for myself and my child was my ability to breastfeed. It was much cheaper than using formula. And there were a lot of times when I was working full-time, and a lot of times when I traveled for business and you couldn't pump, you were on the convention floor all day. That was extremely painful. And that's because you're used to nursing or pumping at a certain time, and when you can't do that, it's very painful. I can only imagine what it's like for someone who has no way to relieve that no matter what. After you have a child, your body does naturally produce milk. I would not like that. I would not wish that on anyone. I had some breast surgeries between my two children to remove tumors. They turned out to be benign, thankfully, and then other times some other tumor that may not have been benign. But I wasn't able to nurse on one side. It made a big difference in my life and my ability to take care of my child. There are tremendous health benefits in breastfeeding. I think that teenagers are too young to make these decisions. I mean, we as a legislator have made decisions about teenagers. We do it all the time. That they're not allowed to buy scratch tickets. They can't go to a tanning bed. Scratch tickets. Okay, so if they're not allowed to buy scratch tickets, this kind of surgery is also something that I think they're not mature enough for. Give it some time. Let them grow up. Thank you. That's my testimony.
Thank you. Any questions?
Yeah, any questions?
Seeing none. Thank you. Also signed up to speak is Laura. Laura from Bradford, New Hampshire. I'm not. Peruti, is it? Looks like Kirutsy. Karitzi? Oh, okay, I'm sorry. Okay, I'm sorry. Okay, also signed up to speak is Representative Sarah DeVito. She out in the hall perhaps, or? She comes, give her a moment. May have had to leave. Is she out there? No, okay. All right, next up to speak is Diana George.
Hello again. Thank you for taking the time to listen to me. I'm, again, not going to read my whole thing again because it's very similar to the last one, but I will tell you that after my son started testosterone, well, first of all, I'm going to tell you that I have permission from my 23-year-old son, almost 24, to testify about this very, very personal matter that is none of your businesses. None. But I will, since you're forcing me to. When my son, after being on testosterone and puberty blockers for a couple of years, he wanted to have what the transgender community refers to as top surgery, a double mastectomy, if you want to be medical about it. At first, we were very hesitant. It's a very, very difficult decision to make as a parent for your child, and it includes a lot of medical research in talking to your the medical doctors, the therapists, the psychiatrist, and so on. And at first, we tried to assuage him by allowing him to wear what's called a breast binder. I don't know if you guys have ever put one of those on. It's similar to a sports bra, but even more tighter. It's extremely uncomfortable. And it's hot. So we did this for a while, and it did start to irritate his skin. So eventually, deciding that he knows who he is, we've been doing this for several years now, we're going to allow him to do this. And so we did. He is now almost 24 years old. He just graduated a couple years ago from NYU Tisch. He's a successful, thriving person. And yes, he doesn't have female breasts anymore because he is not a female. He is male. And he goes to the beach and he takes his shirt off. And yes, he might have a few scars. Big deal. He's happy. He's thriving. Mind your own business. And as for the person talking about breastfeeding, not being able to breastfeed, how stupid. I'm a woman. I tried to breastfeed, it didn't work out, so I switched to formula. Being able to breastfeed is not all about being a woman or female. Thank you.
Okay, moving on. Also signed up to speak is Nancy Biederman. She left? Okay. Also signed up to speak is Courtney Tanner from Dartmouth Health.
Good afternoon. For the record, Courtney Tanner, Senior Director of Government Relations at Dartmouth Health. And we are here to oppose House Bill 712. As testified earlier, we are concerned about the interference with the patient-provider relationship. Also have concerns about access to medical care, necessary medical care, when we take a bill and codify the practice of medicine. There was assertions made that if there are exceptions that need to be added to the bill later in time, we can do that. But we have concerns in a broad brush way of when we codify medicine writ large, there could be gaps in time where this legislative process takes time. Patients might need to access care in that time, and so always think that it's very dangerous to legislate medicine writ large. We also have concerns about the inability for a provider to refer this type of care. Here in New Hampshire, we actually don't provide top surgery for minors. So while the vast majority of the bill wouldn't impact access to care for patients in New Hampshire right now, we do have referrals for this patient population that are referred to out of state. So we would be concerned about access to care for the very, very, very small number of patients who need referrals for this type of care, that receive this type of care outside of New Hampshire. I am happy to take questions. That's a simple testimony, Chairman McDonald.
Okay, thank you very much. Anyone have any questions? Representative Weber.
Thank you very much, and thank you for taking my question. Harking back to the workforce concerns that we had in the earlier bill, can you see anything in this bill which might impact the decision of somebody who provides this kind of surgery that might deter them from coming to the state, and thus providing surgery not to the very few, but to the many who need them?
Right. So I think you're referring to patients who are over 18 and older. So yeah, we would have concerns about providers who are providing gender affirming care for the adult population, who may be concerned about providing that type of care here in New Hampshire. We also would have concerns about, again, that peds and endocrinologist specialty care providers who would have concerns about their ability to provide their patients with a warm handoff for care that they needed outside the state of New Hampshire. This is, it's scary when the legislature starts to criminalize and penalize practice of medicine, even a referral thereof.
Other questions? Seeing none, thank you. Also signed up to speak is Catherine Saris. I said Saris this time.
Listening to my testimony. Thank you, honorable committee members, for sticking around all day here.
Can you just turn on your mic?
There we go.
There we go.
Okay. Honorable members of the committee, my name is Catherine Saris, and I am a performing artist and educator. I urge you today to pass this bill, HB 712. During my early puberty, I would often lie on my chest, hoping and praying that I could keep my breasts from growing or forming. As a survivor of childhood sexual assault, I was terrified of becoming a woman. I viewed being a woman as making me vulnerable to further sexual assault. Moreover, because I had a dream of becoming a dancer, I was convinced that I needed to lose weight and have a flat chest, because within the classical dance world, emaciated, prepubescent-looking dancers were, and still mostly are, the ideal. As a 10-year-old, I managed to lose 20 pounds in 10 weeks through self-starvation. And I experienced routine suicidal ideation. I've already expressed in my previous testimony how I weathered the storm of puberty and was able to heal from the trauma and the childhood sexual assault that I experienced. The reason that you don't see more detransitioners and desisters coming forward isn't because they don't exist. It's because standing up here in front of you is really hard. Every time any of us come and tell you a part of our story, we have to relive part of that trauma. It's absolutely impossible for many of these people because I tell you, I'm from the dance community, right? And it's a hotbed of LGBTQIA+ ideology. I have listened for over 15 years to the stories of my colleagues and coworkers, many of them my dearest friends. So many heartrending stories of childhood trauma, sometimes inflicted by their parents. It's really, really important that you guys don't allow this kind of mutilation of the body to continue to minors. When people are adults, they have their own ideas. They can change their bodies however they want. But when we are children, we should be protected. And we're looking to you. The state of New Hampshire is looking to you. The next generation is looking to you. Are you going to protect these girls? Or are they just going to be a casualty again? We've fought so hard to get to having equality in sports, to being able to be the women that we are, to having women serving here in this room. Are you really ready to now rob us? I can't tell you how many times I go into an audition and the boys get like 7 times that they're shown the combination, and I'm shown the combination 1 time, and then there's a guy who wants to do my part and put on my point shoes. And like, I'm already 103 girls to 7 boys.
Down to 15 seconds.
So, in short, I just really want you to rethink this. Please vote for this bill, pass this bill. Thank you so much for listening to my testimony.
Thank you. Any questions? Seeing none. Thank you. Also signed up to speak is Peter Doyle. Is Peter Doyle still here?
I think you can go ahead.
Okay, thank you. Also signed up to speak is Seth Hertzler.
Good afternoon. My name is Seth Hertzler, and as I said before, I am a 21-year-old transgender man, and I I oppose this bill. I understand, Lisa Mazer, that you are the primary sponsor of this bill. I request
Well, again,
that you and
please
your...
address your comments to the committee as a whole.
Okay, yes, but I request that you listen to what the people that would be affected by this bill have to say. Like, genuinely listen. I had a double mastectomy when I was 16. We paid for it out of pocket after losing a year-long battle with insurance. I assure you that I was told at every possible juncture about the risks. I was not pushed into getting surgery. In fact, it was an uphill battle the entire time. But when I woke up tired and in pain after my surgery, I did not regret it, and I have not regretted it in the 5 years since. You are not proposing protections for children with this bill. You are simply harming them. Your exception to the rule written out in Chapter 332 M makes this painfully clear. You allow for male circumcision, surgery for gynecomastia, and surgery on minors with disorders of sex development, among others. These are all gender-affirming care. Fathers choose to circumcise their babies because it conforms to their perception of what a man's body ought to look like. Men and boys with gynecomastia remove excess breast tissue for the same reason. Parents consent to surgeries for their intersex newborns because they want their baby to conform to the expectations about the conflation of sex and gender. These are surgeries. Why are these surgeries often done without the child's consent? Okay, but a trans adolescent deciding to get top surgery is not. Thank you for your time and have a good day.
Thank you. Any questions? Seeing none, thank you. Also signed up to speak is Corey Cohn.
Good afternoon again. I've been testifying in a number of states, including that in my home state of Indiana. And so I wanted to make the committee aware of this anecdote, which is not only in Indiana, because I've heard similar cases from many different states, and Jamie might be able to validate this as well. When I was giving testimony on a similar bill in Indiana that prohibited all clinicians from doing these types of procedures on children, one of the heads, the co-heads of the Riley Children's Medical Center in Indianapolis gave testimony that none of these surgeries were happening in the state. I had independently been told, I had no evidence, but I'd been independently told by other sources that they were doing these surgeries in the state. So after testimony, and we went into the hallway, I approached the other doctor who was the co-head of the clinic at the time. And I said, I've heard other evidence that they are doing double mastectomies on girls in this state. Can you tell me why I've heard that? And he said, well, you know, we're not doing gender affirming care, but if these girls get referrals to surgeons and they do a little breast reduction, that really has nothing to do with us. In my own history, I have had doctors, before this was considered a field, transgender medicine, and what I was doing was considered a lot more subversive. I had endocrinologists who would use false ICD codes to describe my care so as to avoid any problems with the insurance companies. So my ICD code would have been listed as other endocrine condition. Likewise, these girls who are being referred to breast reduction surgery, coincidentally that they are patients of gender-affirming care clinics, are very likely being coded to have breast reductions when in fact they are having gender-affirming double mastectomies. So I wanted to make you aware of that because the people who are providing these types of procedures know they have a playbook on how to hide the ball so that they can either get around legislation or that they can get around regulators. If it's happening in Indiana, Midwest, flyover country, it's not a surprise to me at all if it's happening in a state that is the neighbor of one of the largest child gender clinics in the country. Thank you.
Thank you. Representative Drew.
Thank you, Mr. Chairman. Corey, as an adult who clearly has transitioned as far as one can go, would you tell a young child that they can successfully transition?
Representative, transition to what, please?
Transitioned from male to female.
From male to female. One cannot change sex. One can have a number of procedures to create the appearance, the superficial appearance of changing sex. Although, as we're seeing more and more, some of these procedures for the double mastectomies have additional modifications. I saw a photo of a girl recently who had her nipples fashioned into hearts. So I wouldn't call that to try to transition to the other sex. I would call that extreme body modification.
Other questions? Seeing none, thank you. Oh, sorry, Representative DeLamas.
Thank you, Mr. Chairman. Do you believe minors should be allowed to have surgical interventions related to their gender?
Surgical interventions for gender. This is one of the weirdest conundrums for all of us to face, which is that if you believe that your authentic self is more feminine and you're male or masculine and you're woman, then for some reason these surgeries are supposed to somehow confirm that. So if you are already authentically, suppose we take the presumption that somebody does really identify as the opposite gender, let's just take that sincerely. There shouldn't be a need for additional surgical modifications to make that any truer or more factual than the assertion. It doesn't build on the assertion. So really what we're doing is providing surgical affirmations to somebody's identity. And I don't know of any other use of medicine where we affirm somebody's identity medically.
Other questions? Okay, I think it's safe this time. Thank you. Also signed up to speak is Grace Bonema.
Hello, once again, I'd just like to say that I had to write my legal name just because this is the legal setting, but I would prefer that it to be referred to by Oliver in future questions. I understand you just reading what I put. I have no issue with that. So I'd just like to start by the people who are saying that sex is binary. It's actually not. It's a bimodal distribution, which essentially means that there are, it's on a spectrum, and there are two main categories. People tend to fall into one certain range that we consider male and one certain range that we consider female. The range in hormone levels, the difference in various secondary sex characteristics are all examples of the fact that sex is in fact not a strict binary. I'd like to just address real quick the kind of people we're talking about. So we're talking about people. So the median age for these surgeries, this is according to the National Institute of Health, by the way. The median age of these people is 17.1 and the mean age is 16.9. So these people are very well close to adulthood. They also have had to have prevalence of dysphoria and diagnosis for 4 years, as well as significant counseling. For those who are saying this is experimental, this surgery has existed since the 1930s. And this is only a surgery that's happening to 0.02%, not even, children who are trans. There is a 0% rate of people attempting to reverse these surgeries, and they have a 90% success rate in reducing suicidality and depression, compared to 20% for antidepressants. The decrease in depression, specifically diagnoses, went from 68 to 44, and anxiety from 70 to 44%. The median regret rate on the 100-point scale was 0. And additionally, according to the American Society of Plastic Surgeons, in order to access these surgeries, they must have persistent documented distress, informed consent, and these surgeries are only performed under the age of majority when delaying surgery would cause notable harm to the patient. So I'd like to just note that these are happening on an extremely rare basis, as in the case where this child very often will not survive or will not survive very well to the age of adulthood when they would typically get these surgeries. I'd also like to bring up earlier how the treatment of intersex children and circumcision is not brought up this would more be relevant to previous genitalia bills that have attempted to be passed, but those are not excluded in this bill, which I find intriguing, given it specifically seems to be transgender youth that you were targeting, rather than the larger issue of, for example, cis girls getting breast augmentation, which actually has a much higher regret rate, again, which has already been stated. And I'd also like to bring up the fact that the majority of people who are trans and go through these surgeries, again, have very low regret rates. And I'd also like to bring up the descriptions of such treatment as child abuse. I will be quoting my mother here, who has a doctorate in psychology and does trauma-informed trainings and did her dissertation on gender and child abuse. So this is going by the state definition of child abuse. It is harm inflicted upon a child. It does psychological harm to the welfare of that child. The research will show that transgender children who receive support from their caregivers, including medical transition, have better psychological outcomes, contrary to the definition of psychological abuse. And I'd also just like to add one last thing. The people who were saying the DSM-5 just involved how you perform gender and the toys you play with, that's just not true. It's a marketing congruence between one's experienced gender and primary and secondary sex characteristics and a desire to move against those. Thank you very much. Does anyone have any questions?
Thank you. Any questions? Representative Weber.
I just wanted to be sure, thank you for taking my question, and thank you, Mr. Chairman. I just wanted to be sure that I understood the statistics you were quoting on the median age of 17.1 and the mean of 16.9. That is the median and the mean.
Yes, mathematically.
Among that very small percentage of minors who have breast surgery.
Yes, who specifically gender affirming care. That is the mean and median age, mathematically.
Okay, thank you.
Yeah.
Representative Kesselring.
Thank you, Mr. Chair. So I was trying to follow you just to make sure I understood everything. So you specified in there that about death for people so you said something about death that doesn't happen based on getting care. I don't know if you remember what you said.
I don't believe I mentioned death. Can you put the context around it for me?
I'd have to go back and watch the video, but there was a specific part where you said something about that causes death. So just curious.
Let me read through my notes real quick and just double check, okay? Oh, are you referring to the part where people who would typically either attempt, are notable? I was referring to death in the sense that these children would typically attempt or possibly successfully attempt suicide by the time they reached 18 if they were not to acquire these surgeries? Okay, yes. Yeah, so it's specifically death usually related to extreme psychological distress that is being caused in part by gender dysphoria. and this is the acknowledged course of treatment by pretty much every major medical association. In my previous written testimony, there's a whole list that's about this long.
Anyone else? Saying no one else, thank you.
Thanks so much.
Also signed up to speak is Stephen Scare.
Good afternoon, distinguished chairman and members of the committee. I urge you to support this bill. Claire, a 20-year-old detransitioner, said of her mastectomy at 14, if a 14-year-old girl comes to you and says, this isn't just teenage angst, I actually have a magical male gender spirit and you need to cut parts of my body off or I'm going to kill myself, your response shouldn't be right away, sir. Our bodies are real, gender identities are imaginary, based on stereotypes, discomfort, and fantasy. If health experts think I'm mistaken, I defy them to define gender identity without relying on circular reasoning. But we teach girls the opposite. Troubled girls, especially those with autism or trauma, are taught that their bodies are mistakes that stand in the way of them being their authentic selves. My friend Prisha Mosley was going to come here and testify. She had a breakdown when she was on the flight and couldn't make it. She sent me this. I had complications as a result of the double mastectomy I was prescribed to cure my mental distress. Years after the surgery, I detransitioned. My detransition led to a pregnancy, and complications arose as a result of giving birth. My milk came in, but because of the nature of my surgery, my nipples are decorative. They were removed, reshaped, and reattached in the wrong spot. I had no way to feed my baby. The pain was like none I've ever felt before and changed my whole perception of pain as a whole. No girl should have her breasts removed because she is sad. No child should be deprived of his mother's milk because a surgeon made money from someone's pain. I urge you to protect girls from this destructive ideology and let them reach adulthood with their bodies intact. Girls are wonderful as they are, and they don't need to remove body parts in order to mature into happy adults. I also remind you of my testimony about these regret rates and how they're entirely concocted with irrelevant data, high dropout rates, and short-term follow-ups.
Thank you. Any questions? Seeing none? Thank you. Also signed up to speak is Brady Barry.
Good afternoon. Thank you for taking the time to hear my testimony. My name is Brady Barry. I'm a resident of Rochester, and I'm here to testify in opposition of HB 712. This bill would take away the rights of transgender and non-binary kids and take away their autonomy to make healthcare decisions with their caregivers and doctors. I personally got gender-affirming top surgery on June 29th, 2023. I was lucky to have my mom at my side as I woke up from the anesthesia, and the first thing I remember saying is, "This is the best day of my life." I can confidently say that getting surgery changed my life. At the time, I was 22, so while this bill would not have stopped me from receiving care, there are many youth who deserve access to gender-affirming care, which includes these surgeries. Getting surgery and before that, starting hormone replacement therapy saved my life. I say that confidently and without exaggeration. I'm part of the statistics you hear so often and you've heard today about LGBTQ+ youth and suicide, and I spent years struggling with my mental health. I was hospitalized twice after attempting to end my own life. But let me be clear, the problem was never my gender or the fact that I'm transgender. The problem was lack of access to care and the hate for the LGBTQ+ community that I'm a part of. This bill would put young people at risk of mental health struggles that can be potentially fatal. There's an easy to see impact on my own mental health from before and after I received gender affirming care, meaning that after I started hormones, I stopped hurting myself and have not been hospitalized again. After my top surgery, this trend only continued, and I've never been happier. As a trans kid just a few years ago, I was a trans kid just a few years ago, and having access to gender affirming care ensured that I could grow into a happy trans adult. I urge you not to take this opportunity away from youth. In a state where we so proudly tell our residents to live free or die, why are we not giving this vulnerable group, transgender and non-binary youth, the opportunity to live free? Please consider opposing HB 712 to help ensure safe access to gender affirming surgery for youth. Thank you for your time.
Thank you. Any questions? Seeing none, thank you. Also signed up to speak is Doug Pounds.
Mr. Chairman and committee, thank you again. Round two. I'll make this brief. I just want to make what I believe are some, my understanding for some clear distinctions in the bill, which I support. One is surgery for physical pathologies. Those exceptions, I think, are pretty clear. And I think from the transgender perspective, it's a psychological pathology, and you don't treat psychological pathologies with physical surgical responses in general. So I think the bill's pretty clear on that and affords good protections. I just want to relate a quick story. My wife and I have had Dartmouth Hitchcock as a provider at one point, and my bride was talking with her provider, and the provider was kind of a little bit beside himself. Of course, not violating any of the HIPAA laws or anything, but had a patient who was 16 and confided that the reason she was there was because she was dealing with female changes as an adolescent, and lied about being transgendered to be able to have surgeries to get rid of her female parts, to not have to deal with the tribulations of menstruation and whatnot. So I just find it odd, that a 16-year-old, what's going through their mind, when, at those times, and lied about it. So I think our young minors need to be protected against things like that, because that could be a very disastrous decision, I think, if she was allowed to go through that and later had serious regrets. That's all I have to say on this topic for now. Thank you very much. And any questions?
Thank you. Any questions?
Okay, thank you.
Seeing none, thanks. Also signed up to speak is Elias Lucier.
Hello again. I'm speaking in opposition of this bill, and I'm going to go right into discussing the process of getting top surgery. To start, this surgery cannot be performed while the individual's breasts are still developing. This is only performed on older teenagers. Now, to even get access to this surgery, you must get a referral to an endocrinologist. These doctors are not the ones who perform any surgery, they prescribe HRT. After waiting several months to get an appointment, the individual must be evaluated by one, sometimes two therapists. Before this surgery is even considered, most surgeons require that the individual has been on HRT for 1 or sometimes 2 years, as there are changes to muscle mass and fat distribution in those first 2 years. After the work with the therapist or therapists, the individual will either start HRT, or in those very rare cases, they will get a referral to a surgeon. For that process, they are first going to be evaluated by a therapist again. to have a statement written deeming this person ready for this surgery. That letter deeming them ready will be sent to the surgeon's office, and the individual will again wait months for this consultation appointment. That appointment, the surgeon will also assess if they believe this individual is ready for this surgery and tell them all the side effects of it. If they then pass that evaluation, they will move on to health tests to make sure they are even capable of handling any sort of surgery. Only if those tests come back clear can they actually prepare for any surgical procedures. This process takes several months, sometimes years. Personally, I've waited 3 years to even get into the process of this surgery. This is not a procedure being done on a whim. Minors are not getting this surgery in schools or in their primary care physician's offices. They are going through years of preparation to get to this point. This bill aims to take away top surgery for only those born female, not those born male who develop excess breast tissue. If you don't want people to change the body that they were born with because they aren't old enough to make that decision, then cis male minors shouldn't receive gender-affirming care either. It's no one or everyone. You don't get to pick and choose. I would like to add, this bill targets, once again, only people born female, and the arguments I have heard are all about reproductive health. Do not tiptoe around what you are saying. Say it outright. You only see people born female as reproductive stock. My sources are included with my
15 seconds.
statement online. I will not be taking questions, and thank you for your time.
Thank you. Also signed up to speak is Dr. Deborah Warner. Did Dr. Warner left? Okay. Also signed up to speak is Jacqueline Pounds.
I thought he was going to steal my thunder. Anyhow, thank you to the chair and to all of the distinguished committee members for hearing my testimony today in front of you. Can you hear me?
Yes.
I am Jacqueline Pounds, currently residing in Goffstown, New Hampshire. As a four-time cancer survivor, I am well acquainted with the pain of multiple surgeries. In 2008, at 47, I was diagnosed with breast cancer. Upon my doctor's advice, I chose to undergo a radical mastectomy with hormone suppression to give me the best chances of a 5-year survival rate. Faced with that decision, you can imagine I was under much duress. I can personally attest that this surgery was extremely painful and extremely disfiguring. My choice seemed obvious. Just get rid of it, I was told. We will build you a new breast mound. I noted that my surgeon, my plastic surgeon, refused to use the word new breast. Promises, promises. My plastics, oh, I got that. Sorry. Also, consider the emotional pain of losing such an intimate part of your body. I was a very anxious young woman making a very difficult decision. Today, I live with a hard mound, which no longer even looks like a breast. I have no nipple, and I have encapsulation. I must not have been listening when they mentioned that part. I must now pay close attention to everything my doctors tell me, or I am threatened with the return of cancer. These young girls I'm sorry, I can't speak from this anymore. These young girls depend on us, their parents, to make decisions for them. I was not ready at 47 years old to lose a breast. And we're letting 18-year-olds, 17-year-olds, I'm sorry, but even younger, lose theirs. When I was a young girl, I hated my breasts. They hurt. I hated menstruation.
You're done in
It
15
hurt.
seconds.
Thank you. Thank you for your time.
Thank you. Also signed up to speak is Chris Urkel from Glad Law.
Chris Urchel from Glad Law. I am not going to reiterate everything I said previously, but I oppose this bill because of the same constitutional infirmities as the other bill we were discussing this morning. But I would like to talk specifically about the referral provision in this bill. Surgery is very serious. And it's very rarely indicated for people under the age of 18 when it comes to gender transition. But I just want to draw attention to the fact that this bill prohibits referrals. And, you know, free speech is a concept that is cherished in both our state and federal constitutions. And the right to free speech doesn't just include the right to communicate information, to express yourself, even if you're a medical care provider, but also it encompasses the right to receive information, the right to receive information and advice from people who have expertise to help you figure out what the best path forward is for you and for your family. I'm drawing attention to this because I really think it's important for everybody to imagine the situation in which if it's possible that there's one 17-year-old who might need surgery maybe once they reach the age of 18, one 17-year-old whose distress is so severe and they're being blocked from getting information from doctors about possible courses of care that could relieve their distress. If there's one person who could experience that level of distress that could reach you, then please consider amending this bill to eliminate the provision on referrals. I'm happy to take questions.
Thank you. Any questions? Representative Kesselring.
Thank you, Mr. Chair. So I had to look it up because I wanted to know after the last hearing. You mentioned the constitutionality, so I wanted to get your opinion on something. Article 4 of the New Hampshire Constitution gives us the right under the law and all the challenges that have happened on specific cases where the legislature has enacted laws for health and safety. I'm just curious how you would say that this Article 4, let's say, how that affects this, because you're talking about the constitutionality of both of these bills.
Okay, so referring back to what I was talking about, the constitutional infirmities of the bill this morning, I was referring to the 14th Amendment of the U.S. Constitution, which protects the right of individuals to be freed from discrimination and the rights of parents to make decisions on behalf of their children, to direct the upbringing of their children. So when the New Hampshire Constitution allows for the right for the state legislature to govern for safety and health, which in fact is, assumed or presumed to be the right of state legislatures under the U.S. Constitution as well, under the principles of federalism, there are limitations on what that when it comes to discriminating against people and when it comes to interfering with the right to raise your children. Right? I mean, the question when it comes to the right to access medical care for your children, it's who gets to decide. Do parents get to decide, or does the state get to decide? And I understand that the state is responsible for governing health and safety, but the fundamental question about who gets to decide, I think our federal and state constitutions have long said that it's up to parents. It's up to parents to decide what's best for their children because it's not the role of states to do that.
Yeah, I was just curious if you had any reference, because I know the U.S. Constitution, but Article 4 is a little different than other states because a lot of them don't have the same rules that we have. And that's in court, that's how the provisions have different lawsuits have been put aside, let's say. So I'm just curious on that. But
Oh, so to clarify, the 14th Amendment of the United States Constitution applies uniformly to every state in the in every state in the country, regardless of what the state constitution says.
Anyone else? Seeing no one. Thank you.
Thank you.
Also signed up to speak is Beth Scare.
Hi, I'm Beth Scare. I'm a grandmother from Nashua, and I'm here to testify my strong support for HB 712 to protect girls from double mastectomies. Detransitioners Katie Anderson and Prisha Mosley had their breasts removed. Katie also had a hysterectomy and had her ovaries removed. Katie was married in Nashua a few months ago, and because of these missing body parts, she can never have children. Prisha had a baby last year, and she can't breastfeed him and suffered terrible pain because of the milk trapped in her milk ducts. Too many girls are having this done at a young age. What is the rush to have their breasts amputated? Why is it so critical to have this done when these vulnerable girls are 13, 14, 15, 16? Many of those who support medical transition protest loudly that kids aren't having these operations. Even they are horrified that it's happening. These girls are suffering from anxiety, depression, PTSD from sexual abuse, or the difficulties of ADHD or autism. They are promised that when their breasts are gone, their problems will be solved. For a short time, some feel the euphoria of getting rid of the supposed source of pain, but then the reality hits that it didn't fix anything. They have the same problems they had before, compounded by the pain and trauma of losing healthy body parts. Vote ought to pass on HB 712 to protect vulnerable girls from losing healthy body parts.
Thank you. Any questions? Seeing none, thank you. Also signed up to speak is Nancy Brennan.
I had his testimony. I also have testimony. Why don't you take this? You want to fill out a card? And
Yeah,
so
I do need.
still want to give testimony, but I was going to read his as well.
Okay, well, it's good because I prefer one person testify at a time. So
Well, you want me to go first?
yeah, go ahead. While he's doing his card.
Okay. Gee, and I had yours all. I was going to do it so well. Nancy Brennan, I live in Ware, and I appreciate all of you sharing this very long, very tough day with us. There's not a lot I can say. I agreed with the transgender youth and those who support their care. I do not feel like this is a good bill, but I would be remiss if I didn't say at some point today that this bill, the one we heard this morning, the one that just passed out of executive committee on bathrooms, et cetera, et cetera, et cetera, are part of a larger program to other and even eliminate the transgender community. We have a president who spent $222 million in hate ads before he got elected. And he said on several occasions, the little boys are going to school, and when they come home, they're little girls. And I think you, as legislators, when you go to vote on these, you need to do a couple of things. One, you need to make sure that all the so-called reviews and whistleblower reports and so forth, that those are accurate. You need to do your own research. The other thing I'd ask is that pretend this bill exists on its own here in New Hampshire. We're not seeing this kind of thing happening across the country, mostly in red states, where people have decided, politicians have decided, that this group of people is one that we can go after. You know, there's a musical called Wicked, and in it the wizard says nothing brings people together like a common enemy. And for the transgender community and their supporters, as well as for the immigrants, we have found those. And I really hope you will look at the health, what the experts say. There are a lot of experts, and I hope you will look at what they have to say when you vote for these bills.
Thank you. Any questions? Okay, also signed up to speak is Representative Heath Howard.
Thank you, Mr. Chairman. Sorry about my tardiness and getting in the car a little bit late. Thank you, Honorable Chair and committee members. My name is Representative Heath Howard. I represent the towns of Stratford and Barrington in Stratford District 4. It is my opinion that as legislators, we should always be searching to do the most good and do the least harm. But this legislation prevents access to a surgery that can benefit the day-to-day lives of its patients. As someone who has had multiple surgeries unrelated to this topic, it provides a perspective of how someone feels when they're in pain. I had to wait 4 months with a broken back to get surgery during COVID because it was, quote, an elective procedure. While it is a different situation, I understand what it's like to suffer after being denied more immediate treatment. I see my situation no differently than any other individual seeking any treatment of any kind. If you are suffering, you should be allowed to discuss treatment options with your physician and pursue whatever works best for that patient's needs. This tramples all over the individual liberties that we pride ourselves on and ultimately removes access to our right to bodily autonomy. This is no different than access to an abortion or back surgery. Please leave medical decisions up to their patients and their medical providers. Thank you.
Thank you. Any questions? Seeing none, thank you. Also signed up to speak is Simon Amaya Price.
Good afternoon. My name is Simon Amaya Price. Thank you for introducing this bill and allowing me to speak. As I mentioned earlier today, my girlfriend is a detransitioner. Her name is Luca Hein. You can look her up. It's spelled Lukahein. She has told her story on many podcasts, and she is currently involved in a lawsuit against her healthcare provider. She was given a double mastectomy when she was 17, I believe, and she was placed on cross-sex hormones for 4 years, starting from when she was a minor. Today, she regrets those decisions and has had to pay out of pocket for detransition procedures, including hair electrolysis and a tracheal shave to remove her Adam's apple induced by testosterone. She is one of the many detransitioners and regretters and larger group of young women who have had their breasts removed in the name of what has essentially become a death cult. They say that if we are not given these elective surgeries, we will kill ourselves. This sounds very familiar to me, to Scientology, for example, and there are many people who have talked about these comparisons. I will also venture to add that my friend Prisha, who unfortunately couldn't be here, is another detransitioner who had her breast removed, now has a child and is unable to breastfeed. When I was 16, I was in my first year of college. I went to college 2 years early, and I went to college specifically for people who want to go to college early. My first week was the first time I saw a mastectomy scar. It was on a 16-year-old girl who had gotten it the year before when she was 15. She was deeply distressed, and knowing her and being close to her, she was not in the right mind. I could not imagine how she could have been in the right mind to make that decision. I had many other friends growing up and recently who underwent double mastectomies and these gender-affirming surgeries. On February 25th, a study came out with the biggest sample size of American patients we've seen yet. 107,000 published in the Oxford Press of taking from NIH data. This is a matched cohort. So we compared gender dysphoric children, or people, generally speaking, it's not just children, who did gender affirming surgery and those who did not do gender affirming surgery. And those who did do gender affirming surgery, rates of depression and anxiety were twice as high. All of the research we've had up to this point is not longitudinal, suffers from high dropout rates, and essentially is statistically insignificant. My girlfriend didn't realize that what she did was wrong until she was 4 or 5 years into identifying as trans.
You're down to 15 seconds.
Yeah. If you pull those from the detransitioner subreddit, how long they identified as trans, it averages 6, 7, 8 years. None of these studies account for that. WPATH recently admitted that the detransition rate is at least 30%. They're an activist organization, so that's going to be a conservative estimate. I am happy and willing to answer any and all questions you may have of me.
Okay, thank you. Any questions? Representative Delamus.
Thank you, Mr. Chairman. You mentioned that you know quite a few people who've had the double mastectomy and regret it. Were most of them below the age of 18?
All of them were below the age of 18. All of them were survivors of sexual assault as well.
Oh my God. Thank you.
Anyone else? Representative Kesselring.
Thank you, Mr. Chairman. I was just curious, with the experience that your girlfriend has gone through, has there been any other adverse side effects and issues that you've had to deal with seeing it from the other side?
The reason she can't be here today is because she suffers from chronic joint pain related to the fact that she was put on the wrong sex hormones for 4 years of her life. Traveling is very difficult for her, and it makes her joint problems worse. She would have liked to be an EMT. She can't. She can't stand for that long. She physically can't because these so-called gender-affirming procedures have robbed her body's functional ability to do a job which she's dreamed of doing since she was a child. So yes.
Other questions? Representative Delamus.
Thank you, Mr. Chairman. Now, tagging onto this question, was she informed? Was your girlfriend informed that this would possibly keep her from doing the thing that she wanted to do the most in life?
No, not at all. And the reason for this is poor research into the side effects of these surgeries and these cross-sex hormones, and the fact that in a lot of cases, contrary to what others have said, the evaluation period is very short. There was an article recently about the Boston Children's Gender Clinic, which I'm sure many people in New Hampshire have gone to. They recently lowered their intake period from about like some multiple meetings over a month or two to get hormones down to just 2 hours.
Other questions? Okay. Representative Drew.
Why didn't you do this? You were on track to get hormones and to get top surgery and possibly bottom surgery. Why didn't you do it?
My father said, no way in hell. He cussed out my pediatrician. He cussed out every single doctor who referred me to a gender clinic. My pediatrician quit a year later. So I think that has something to do with it. If not for him, if he were affirming, I wouldn't be sitting here today. Maybe I would be dead. Maybe I would have osteoporosis. Maybe my genitalia wouldn't be intact. Maybe I would have one of the many complications that so many of my friends have to live with for the rest of their life. For example, my friend Richie, who has to do dialysis on a daily or weekly basis for his neovagina for the rest of his life due to the penile inversion surgery.
Other questions? Okay, thank you.
Thank you.
Also signed up to speak is Jan Hertzler. Jan Hertzler still here? Okay. Also signed up to speak is Jennifer Black.
Thank you. I appreciate you allowing me to speak, Chairman. I submitted my testimony online. I also have this one written copy. My name's Jennifer Black. I'm from Windham, New Hampshire. I would have given anything to not have breasts. When I was 2, I started screaming whenever my mother tried to put me in a dress. And frankly, if someone tried to put me in a dress now, I might scream. I despise dolls. My favorite toy was a truck. I wanted to be one of the guys, and for a long time I was. I played baseball, climbed trees, split wood, jumped bikes, and hung out with the boys. Everything was great. But then puberty reared its ugly head. I watched in utter dismay as my body transformed. The identity I had created for myself was upended. I was no longer one of the guys. They looked at me differently, talked to me differently. I felt like I was in no man's land. No pun intended. Girls were not my friends. I didn't relate to them at all. Boys were treating me like an alien. I became reclusive and shy. If only I could have been born a boy. If only I could stop the growth of these breasts that were a symbol that everyone could see that I was what I absolutely did not want to be, a woman. That was then. I am now a happily married mom of 6 children, all of whom I nursed, including twins. I stand here today grateful that I grew up in the 70s and 80s and not today. I stand here today with my heart breaking for the girls who are not given the privilege I had to grow up without chemicals and surgery. I shudder to think where I would be if I grew up in today's environment of quick fixes and instant gratification. I shudder to think what would have happened if the trans industry existed back then and offered me the opportunity to become a boy, to remove my breasts. I have no doubt that I would have leapt at that opportunity and I would have faced a lifetime of regret. My heart aches for the young girls who are being told that they were born in the wrong body and need irreversible surgery and chemicals to fix it. That's not what they need. What they need is what I was privileged to have. They need the gift and privilege of time to mature and grow and gain perspective, and time to learn to accept their body and understand that their body is a special gift. They need affirmation that although being a woman is an immutable characteristic, there are infinite ways to be a woman. They need affirmation that we are all created in a unique way and bring a multitude of characteristics and traits that are combined in our body to make us a special person. Not one person is the same as another. And above all, they need adults to be adults. We are tasked with raising and protecting children, sometimes having to protect them from themselves.
You're down to 15 seconds.
We have the perspective and experience to be able to tell them that puberty is confusing and difficult, but they are strong and will get through it just like we all did. In conclusion, I ask that you please be the adults in these girls' lives when so many others are failing them. Stand for keeping their beautiful bodies intact. Stand for allowing them the privilege and time to grow and mature and accept their bodies as God created them. Give them the opportunity to reach the conclusion that I have reached, that being a woman and a mom is an incredible blessing that I wouldn't have traded for anything.
Thank
Please
you.
vote for HB 712.
Thank you. Also signed up to speak is AJ Colati.
Hello again. All right, this one I actually wrote, prepared for it. At the age of 19 and a half years old, I underwent a double mastectomy top surgery on January 14th, 2025. My consultation for the surgery took place at the age of 17 years old in early September 2022. You may be wondering, why did it take so long? Well, because getting approved by insurance and on the OR schedule for an elective surgery takes a long time. This is one of countless reasons why these kinds of bills are pointless, as their sponsors continue to draft them as if there's a pop-up gender clinic on every street corner offering walk-in services. Clearly, these people haven't a shred of a clue of what reality truly is. Members of both the state and the federal government's incessant compulsion to propose legislation which targets our individual rights as Americans isn't just absurd, but an utter waste of everyone's energy. You cannot call yourself a Granite Stater and rep the Live Free or Die motto if you advocate for or comply with folks' private medical business being put in the hands of anyone but themselves or their doctors. These kinds of bills would massively fail to garner a whiff of support if instead of merely appearing to threaten queer people's ability to access proper care, their true purpose was written in bold. New Hampshire lawmakers should have more control over citizens' livelihoods than they do. Open your eyes, people. The fear that you've been conditioned to feel towards the queer community is ruining your lives perhaps as much as it does ours, because admit it or not, we are the same as you. I'm pretty sure. Sorry, no, I'll circle back to that in a second. We all struggle under and are subjugated by the system in which we live. So I'm sorry that you see us as enemies, for we could just as easily be your neighbor if you gave us the chance to show you who we really are, not what someone tells you we are. Let us working folks stick together. We are more powerful that way. And then I also just wanted to address some crap that's been being said. Someone just said not one person is the same as another. So why would they stand for a bill that is assimilating people or putting people into boxes? It doesn't really make any sense to me. It seems completely contradictory. If you think there are countless countless ways to be a woman, then why would you be in support of this kind of proposal that is giving strict definitions to certain things? Yeah, also, people are told straight up the surgery you're receiving will not cure your dysphoria. People are prepared far in advance by everybody involved in the process, so long as the doctors are good doctors. Like, not every doctor is a good doctor, and they might screw up, but it doesn't have anything to do with it being trans care. Sometimes people suck at their jobs and are incompetent. It doesn't have to do with the fact that trans people are the ones receiving their care. That doctor just might be inept. But anyway, if it isn't an inept medical system or facility or office or whatever, you do get warned. This is not going to solve all your problems. You're just chopping your boobs off. That's what it is. That's what we all know it is. I'm just happy I did it. And that's the bottom line. Like, we're happy about it. Some people aren't. You're right. Some people are in so much pain from their decisions. But why would we make a law that prohibits such a large portion of people to not feel joy just so a couple of people can feel protected and comforted? This is the name of safety, not comfort. Remember what this committee is for. It is not public comfort. It is everyone's safety.
Thank you. Also signed up to speak is Linz Jakehouse.
My name is Linz Jakehouse. I'm a non-binary person, and I had top surgery just before my 26th birthday. April will be the 9th anniversary of my top surgery, and to this day, it's one of the best decisions I ever made that improved my life for the better and the best money I ever spent. When I was going through puberty, I felt extremely uncomfortable with my chest. Before I knew the words transgender or non-binary, I wished my chest could stay flat forever. I would wear multiple sports bras in an attempt to flatten my chest starting around age 10 or 11. When I was a teenager, I saw a documentary about a trans man getting top surgery and was incredibly jealous of it and wished that I was a trans man so I could get top surgery. In my early 20s, I met a non-binary person who had gotten top surgery and felt a ray of hope that I could too. I started wearing a binder to flatten my chest, which was very hot and got filled with sweat in the summer, and I'll admit I wore it longer than the recommended 8 hours at a time, which can make it hard to breathe. Qualifying for top surgery was not a quick and easy process. I had to see a gender therapist for at least a year before getting a letter of recommendation. I was lucky to be on my mom's insurance and to have her support. Overall, top surgery cost around $8,000, half of which was covered by my mom's insurance, and I saved every penny I could over the course of a year on a low-salary job to come up with the other $4,000 I had to pay out of pocket. When I woke up in the surgery room, I had the biggest smile on my face, and I felt like a weight had literally and figuratively lifted off my chest and shoulders. I felt more confident and at home in my body than ever before. Many studies have shown that regret rates for top surgery are 1% or less. I'm sorry for the small percentage of people who have gone through the lengthy process of being informed and then regret the procedure, but again, that's far lower regret rates than many other medical procedures that we wouldn't dream of banning. I was fortunate to have excellent health care and to be able to make this decision for myself along with my therapist and the surgeon without politicians putting any additional barriers in my way. I hope to be a parent someday, and if my teenage child needed top surgery, I would support them every step of the way. Although I was an adult when I received this care, it's no secret that those who put barriers in the way of trans people accessing health care have moved the bar into bans on adult care. Arizona, Georgia, Idaho, Kentucky, Mississippi, Oklahoma, Texas, and Virginia are seeking to stop Medicare funds from being used for this health care. Furthermore, it's discriminatory to ban the same procedure for trans people while allowing it to continue on non-transgender girls who have cancer or boys who have unwanted breast growth. It's the same procedure, yet it's only stigmatized by certain politicians when it applies to transgender or non-binary people. Stop this double standard and oppose HB 712, and I'm happy to take questions.
Any questions? Seeing no questions, thank you. Also signed up to speak is Representative Timothy Horrigan. You can take your coat off first if you want.
Yes.
Thank you very much. I don't want to prolong your long day too much, although I did fill out a pink card. So this bill, I think this is as I'm sure you've heard before, but just very quickly, this is something that young people and their families and their medical professionals are going to should decide for themselves without like a bunch of politicians like us inserting ourselves into the decision. And also so there are certainly circumstances where so-called top surgery is probably most people who get it are adult age, but there are some legitimate reasons when minors need to take advantage of it. And so this is I think this bill is ITL. It's part of, like, frankly, a lot of anti-trans hatred that, directed at a very small community whose lives are very difficult anyway. And also point out just the whole process of transitioning is very, very difficult. So a lot of the comments I've heard in the past about it seem to think it's really simple, like to say, oh, a guy can just put up a wig or something. But no, regardless of whether you're adult or a minor to start, it's an extraordinarily difficult process, and people do it just because they know who they already know who they are, so they want their bodies to conform to who and what they already know themselves to be. And I guess one thing I add news that I have some friends who one of their children belongs to a group out on the West Coast, kind of a fringe religious group, and they firmly believe that you shouldn't assign a gender to a child until the child's old enough to speak for themselves. And so their daughter gave birth to a child who clearly would normally be assigned female at birth. Everybody, so it was hard for them for the first few years until the child began speaking, not to refer to her as she, but one of the very first utterances that little girl did, who was a cis female, said, "I am a girl." And that's the same for trans girls who maybe chromosomes aren't the standard XX, or otherwise for some other reason are assigned male at birth. They usually know they're girls right from the beginning, from what I've heard. And trans boys usually know they're boys right from the beginning. And so this is so usually the vast majority of cases, the person has an inkling right from when they begin to have a sense of themselves and be able to speak for themselves that they are trans rather than cis like me. So I'm, just for the record, I am a cis male. So my gender identity is exactly what you'd expect from my gender expression, the way I look. So at least I hope that I identify as male exactly what you would probably think from looking at me and dealing with me. But that's not true
You're
for
down to
everyone.
15 seconds.
Okay, thanks. Well, I would say just please ITL this bill. It's unnecessary and have many, many bad consequences. So thanks for your time.
Okay, thank you. Any questions for Representative Horrigan? Okay, I'm seeing none. Thank you.
Right.
Also signed up to speak is Mackenzie West.
Hello, members of the committee. My name is Mackenzie West, and I am here to oppose HB 712. The truth of the matter is that chest augmentation for gender confirmation is of great importance to many transmasculine and non-binary individuals, and minors undergoing such procedures make a very small portion of such procedures. This law specifically targets transmasculine and non-binary individuals in a blatant attempt to discriminate. This law carves out exceptions for the medical necessity of cisgender individuals, often to reaffirm their gender identity. But why do we give less credence to transmasculine and non-binary identities? The surgical prerequisites of chest augmentation often require years of therapy and many, many hoops. As others have stated, the barriers are already high and regret levels are low, so why are we once again trying to insert the state into medical decisions of families and their doctors? The few adolescents that this bill affects know who they are, and they have known for a while, jumping through every hoop placed in their way to prove it to others. If we look at the timeline of these surgeries, for the few adolescents that this bill affects, we can see that these kids are often coming out of high school or preparing to do so, and many are looking to go off to college and radically changing lives ahead of them, often trying to escape the bigotry and harassment that has followed them for years. When you ask why they don't just wait until adulthood, it is simple. It is a radically changing time for many young folks, and they deserve to start a new chapter of their life without bigotry and dysphoria following them and allowing them to really feel themselves. I urge you to vote ITL on HB 712 and to get out of the way of brighter futures.
All set? Any questions? Seeing none, thank you. Also signed up to speak is Natalie Backus.
Thank you. Hello again. I'm just going to quote something from an article in the American Medical Association Journal of Ethics. The article is called "What's Wrong with Criminalizing Gender-Affirming Care of Transgender Adolescents?" In the section, Criminalization of Gender-Affirming Care. The criminalization of gender-affirming care for adolescents is emergent in multiple U.S. states. In the last 2 years, 25 U.S. states have introduced bills to restrict access to gender-affirming medical care for minors. For example, in 2021, Arkansas became the first state to outlaw physicians from providing gender-affirming care, both hormonal and surgical, to minor patients via an override of the governor's veto of the bill. In 2022, the Alabama legislature passed, and the government signed into law, a bill known as the Alabama Vulnerable Child Compassion and Protection Act, prohibiting physicians from providing gender-affirming care, both hormonal and surgical, to minors. Often the motivation behind such bills is political, a new front in the culture war targeting transgender citizens. For example, in January 2020, the South Dakota House of Representatives passed a bill criminalizing provision of gender-affirming treatment to transgender youth under the age of 16, shortly after the legislature's failure to pass a bathroom bill. You might remember the bathroom bill that was in front of the House Judiciary Committee recently. Proposed gender-affirming care restrictions coming after failure of bathroom bills are not unique and are evidence of political animus. As recently noted in the Harvard Law Review, the shift from stigmatization and vilification of trans youth in the bathroom bills to the victimization narrative embodied in the gender-affirming care bans illustrates how opponents of trans identity are adapting their rhetoric in response to changing legal and social attitudes towards transgender children. There's more to the article. I'd encourage you to read it yourselves. Please leave trans kids alone. I oppose this bill. Thank you.
Thank you. Any questions? I see none. Thank you. Also signed up to speak is Jamie Reed from the Courage Coalition.
Good afternoon. This bill is critically important for one simple statistic. 73% of those going to pediatric gender centers in the United States right now are girls. This is at the heart of the huge debate over this care globally. When I started working in a pediatric gender center, I had 4 to 5 new patients per month, and most of them were boys. When I left 5 years later, I had 40 to 50 new patients per month, and most of them were adolescent females. This sex reversal has been reported in clinics from Western Europe, from Canada, and the United States, and this has left many scientists incredibly concerned. In England, 15 years ago, there were just 250 referrals to their gender service, and nearly all of them were boys. 5 years ago, there were 5,000, and 75% of those were adolescent girls. This kind of complete and utter reversal for a clinical presentation is almost statistically never seen. One hypothesis is that these girls are just now feeling free to identify as boys. Another hypothesis is that we are actually seeing a new kind of socially mediated looping behavior. What I know as a scientist is that the safe thing to do is not to remove any healthy body parts from any minors until we actually have clear data to understand what is occurring. And that means that this bill is necessary. I also work directly with patients who have had these bilateral mastectomies as minors. One of the most heart-wrenching patient cases that I worked with had this exact kind of surgery. She was trans-identified when she had the surgery, and within 3 months, she called the center and begged for the surgeon to put her breast back on. The surgeon refused to take her call and refused to call her back. The surgeon punted that follow-up call to me. Why? Because she had absolutely no idea what to do in this situation, and she simply could not fathom that it would have ever occurred. The surgeon also told me that she would not even meet with this patient again until she had an entire year worth of therapy and a full psychological evaluation. That young woman was required to have neither of those things before we cut off her breasts. The last I heard in this follow-up case was that that young woman was now pregnant. She also grew up in foster care, and she had experienced sexual trauma and had a substance abuse disorder. I also want to share that my former spouse has also had this surgery. She was trans-identified for years before she had it, and she now permanently mourns the loss of her breasts. It took years for her to process this and to come to understand what occurred for her. It was never in the original flawed study to perform surgery on any minors at all, and it should not be allowed in any state in America for surgeries like this to continue. I urge you to please pass this bill.
Thank you. Any questions? Representative Kesselring.
Thank you, Mr. Chair. I have just one question. Is there any statistics, because you've talked a lot about statistics today and different things that specifically relate to other side effects that could come from having this breast surgery?
Thank you for your question. In my own spouse's case, she had her breasts removed, was in recovery, and was being given morphine. She coughed and suddenly had intense pain on the flank side of her chest. She had actually torn open the inside sutures and began to bleed out inside of her chest. She had to be taken in right away, right back in, put back under. The entire thing had to be opened back up, and she had to have this emergency surgery to repair the internal hematoma. She was bleeding out inside of her chest. My close friend, Prisha Mosley, had this surgery as a minor. She became pregnant. She's had a baby. We now are seeing detransitioners who have some of their milk ducts still left in their chest wall. Milk ducts will create and fill with milk once baby is born, regardless of some of these surgeries or not. She was in so much pain that she could not hold her baby because she could not put her baby to her chest without the milk ducts tightening and hardening inside of her chest wall. So she had to physically hold her baby in the unnatural way that, as a mom, I've held all of my infants. We simply do not know all of the outcomes that are going to occur when we're cutting off breasts of young women and seeing them mature into older women who might potentially want to have children of their own, pregnancies, or honestly, even utilize this area for sexual function. Many women who've never had sex before have no idea that removing this sexual organ could literally impact them for the rest of their life, for their ability to have orgasmic pleasure or to have this part of their body be part of an intimate relationship that they might want to have with an adult later on. We just simply don't know what we're doing to these kids.
Other questions? Representative DeLamus.
Thank you, Mr. Chairman. How old were the patients that were being prescribed puberty blockers and hormones when these surgeries were being done.
So one statement I heard was that there is a requirement that you take testosterone first. That's not in any guideline. There are many people who are now stating that they are non-binary and seeking to just have their breasts cut off without actually medically transitioning in any way. We had patients who were minors who we were directly referring to surgeons. I personally helped go around insurance requirements. So insurance will cover gynecomastia in insurance plans, but will not cover top surgery often for minors. And so I was teaching parents how to lie to get this surgery for their minor children.
Other questions? Seeing none. Okay, thank you. No one else has signed up to testify on HB 712FN. I'm almost afraid to ask, does anybody else wish to testify? Seeing no one, I'm going to close the public hearing on this bill, 712FN. That is the last bill we had scheduled for hearings today. We will be meeting again on Wednesday at 9:30 for additional hearings on other bills. Thank you. We stand adjourned.